Hello, hello, hello. Hello. A very good afternoon, ladies and gentlemen. Welcome to this Final Aid by Conceptual Medicine, the unique chanting revision program which was started 2 days back, and today is the third day when we are going to complete 7 subjects which are very important subjects for the exam. Previous 2 days session went like first day we did for 6 hours, next day we did for and again 6.5 hours, to total 12.5 hours, and the subject we have covered are approximately 12 subjects. Today we are going to cover 7, and yes, we are going to make it possible for the first time to revise all 19 subjects in less than 20 hours. And these all topics are your previous year topic and most high yield topic for the exam. That means you cannot afford to ignore these topics for the exam. You are not allowed to do that, my dear friends. And here the Josh is very high with the third day, and here the subjects which we are covering today is internal medicine, surgery, obs and gynae. This itself is 35, 35, 35. And you can see the pediatrics are approximately 13 marks, radiology 10 marks, dermatology 5 marks, psychiatry again 5 marks. So at least 100 plus marks subjects are going to be covered today. So today is the third day. I want each one of you to sit till last. The session might can end today after 8, that is till 9, but it is comfortably fine. I'll be meanwhile asking all questions to all of you. Please keep on saying I will pass, I will pass, I will pass. Meanwhile, for the PDF, please follow our Telegram channel Conceptual Medicine. Also, please subscribe to our YouTube channel Conceptual Medicine, and also our another YouTube channel Dr. G. Banu Prakash sir, and our Telegram channel same with the G. Banu Prakash sir. Remember one poem I have kept for all of you today. कोशिश करने वालों की कभी हार नहीं होती. कहता है कोशिश करने वालों की कभी हार नहीं होती, लहरों से डरकर नौका पार नहीं होती, नन्ही चींटी जब दाना लेकर चलती है, चढ़ती दीवारों पर 100 बार फिसलती है, मन का विश्वास रगों में साहस भरता है, चढ़कर गिरना गिरकर चढ़ना ना अखरता है, आखिर उसकी मेहनत बेकार नहीं होती, कोशिश करने वालों की कभी हार नहीं होती, मेहनत करने वालों की कभी हार नहीं होती. My dear lovely ladies and gentlemen, welcome to the class again. Today's session is going to be very special. तो कोई बोले रिवीजन नहीं हो रही सर, भूलता जा रहा है सर. अब सर ने अपना काम कर दिया है, 20 घंटे में 19 सब्जेक्ट पढ़ा दिया. अगर 2x पे देखोगे तो एक ही दिन में रिवीजन हो जाएगी. बचे हुए 25 दिनों में 25 बार रिवीजन कर सकते हो. 25 बार रिवीजन करने वाला मतलब राजा. तो यू ऑल आर king and queens, my dear friends. Yes, thank you so much. Thank you so much for the love. So let's talk about all these topics right now. Right now we are starting with a subject called as radiology. Sir, these are some discoveries, and previously asked questions were there from the discoveries. That is why just let's go through these discoveries, then system by system we are going to cover the radiology, because radiology is having overlap with so many subjects, even medicine, even your orthopedics, even your surgery. Everywhere you will see the radiology. Done, sir? So let's start with this thing. Now, first of all, X-ray. X-ray is discovered by the beautiful scientist W.C. Roentgen. Then coming to the CT. CT में कौन रहता है? God का घर वही है Hounsfield. तो Godfrey Hounsfield. X-ray was by W.C. Roentgen, and your CT scan by Godfrey and Hounsfield. My dear friends, MRI was discovered by Letterbuer and Mansfield. X-ray becomes our first investigation of choice in most of the cases. CT is best for your bony part, or you can say the local invasion. You have to check, if you have to check the bony destruction, you have to check best is CT scan. If soft tissue involvement you have to check, then my dear friends, MRI will become your investigation of choice. Now, radioactivity is also MCQ, which was asked in the exam. So, radioactivity is by the becquerel. So, my dear ladies and gentlemen, let's start with this very first system, and that is none other than your GIT. None other than your GIT. Now, by different contrast medias we have to use. Different contrast media will tell us where we are looking the pathology. So, very important. Then some pathologies we'll learn about, and we will get all the high yield topics from the radiology integrated with your surgery also, and other pedia even. I'll be covering CVS pedia ka yahan pe. Now, sir, barium swallow. Any pathology in the esophagus, if you have to check, you will give a contrast media called as what, sir? Your barium swallow, like Zenker's diverticulum, like Achalasia cardia. So we'll go for the barium swallow. Then, if any pathology we have to check in the abdomen and proximal part of the duodenum, then we are going to talk about the barium meal. So first of all, swallow. After swallow, there is a meal. Then coming to the barium meal follow through. So follow through is after duodenum, proximal part of the duodenum, what will come, sir? Small intestine. So small bowel problems, if they are there, like intussusception, etc., then you will go for the barium meal follow through. Now, if there is a large intestine pathologies, my different toxic megacolon, etc., then you will use a barium enema. Done. Okay. Now, coming to the disease number 1, sir. Question 1, sir. Question 1 is Plummer-Vinson syndrome. Now, what is happening in the Plummer-Vinson syndrome? There is going to be the iron deficiency anemia. There is going to be the cricopharyngeal webs. So here you can see the image where there is going to be the cricopharyngeal webs. After that, there is going to be the iron deficiency anemia. What are the features of iron deficiency anemia? Can you tell me what is a clinical feature of iron deficiency anemia? Yesterday itself, I have taught you in another session of pathology. The day before yesterday, we talked about the iron deficiency anemia. Can you tell me the feature you are going to see on the nails? Clinical feature I'm asking about the, yes, cholionychia is a clinical feature we see, sir. So right here, esophageal web is there. Because of this web, are you able to digest things easily? No, your answer is no. Your answer is what, sir? No. Then your answer is what, sir? Dysphagia is also there. So cricopharyngeal webs are there, dysphagia is there, iron deficiency anemia is there, plus one more feature you can see, that is your glossitis. So mnemonic is CID. CID wale kahan ghus jate hain? Ghar mein ghus jate hain. So your C stands for cricopharyngeal webs. C stands for cricopharyngeal web. I stands for iron deficiency anemia. Dietary deficiency will be there. Because of which you will have an iron deficiency. D for dysphagia. Because of this cricopharyngeal webs, there will be a dysphagia. And my dear friends, G for glossitis. So Plummer-Vinson syndrome, which is also called as Patterson-Brown-Kelly syndrome, which is also called as what, sir? Patterson-Brown-Kelly syndrome. The mnemonic is CID and Ghar. So this is what you need to remember for your exam. This question has been already asked in your previous exams, my dear friends. Now coming on to the next disease, and that is Zenker diverticulum. Can you tell me, in the ENT session I have taught you something, this Zenker diverticulum is outpouching. From which part? Which dehiscence I am talking about, in which muscle? Which dehiscence and which muscle we are talking about, my dear friends? Yes, absolutely correct. Please try giving answer. Yes, Abdullah Sheikh. Yes, Medico. Yes, Keval. This is your very nice answer. This is your Killian's dehiscence. And which muscle we are talking about? Inferior constrictor muscle. We are talking about what, sir? Inferior constrictor muscle. So यहाँ पे क्या हो रहा है? Inferior constrictor muscle के वहाँ से there is a outpouching coming outside, and that outpouching is visible on. Now this is which contrast media? If we are checking any pathology on the esophagus, can you tell me which contrast media we are checking right here, sir? Which contrast media we are checking right here, sir? Which contrast media is this? Yes, your answer is what, sir? Contrast media is barium swallow. Contrast media is what, sir? Your barium swallow. And here you can beautifully see, if a patient is having Zenker's diverticulum, there will be a clinical feature. Can you tell me what is that? The food will be stuck here, and because of that, foul smelling breath will be coming, and that is called as halitosis. The clinical feature is going to be what, sir? Halitosis. The patient is going to halitosis, plus there will be a dysphagia. dysphagia, plus there will be what, sir? Dysphagia is going to happen. Dysphagia is going to happen. So this is Zenker's diverticulum, outpouching of a mucosa through the weak mucosal layer, and and this is how you are going to see on the radiogram. Very, very good. The third is going to be what, sir? Achalasia cardia. Now what is happening in the achalasia cardia, sir? The lower esophageal sphincter tone, is going to reduce. Now what is happened? There is a lower esophageal sphincter. They are failing to relax. If they are not relaxing, they will be contracted like this. They will be contracted, and their contraction is depending on the weight. So if we take a liquid, they will get stuck here. But if we take a solid, solids are heavy, so they will open it. So dysphagia is there, my dear friend. Dysphagia is there. So dysphagia is for liquid, more common than the solid because of the weight. Liquid more common than solid, and that is because of the weight, my dear friend. That is because of the weight. So here on this contrast media, which is barium swallow, we are going to see the bird beak appearance. We are going to see what's a bird beak appearance. Can you tell me the name of a surgical procedure what we are going to do right here to treat such condition? Yes, please tell me. Chalo. This is going to be POEM, per oral endoscopic myotomy. And sometime, yes, people are right about the rat tail. Rat tail here is a regular, or you can say smooth margins. But in the esophageal carcinoma, that is with the irregular margin. That is with the irregular margin, sir. So here, achalasia cardia is also done and dusted. Done and dusted. Now, per oral endoscopic myotomy. तो यहाँ आपको निमोनिक कैसे याद रखना है? Achalasia cardia में bird beak sign देखने मिलता है, और bird क्या गाता है? Poem गाता है. कैसे poem गाता है? ऊपर पंखा चलता है, नीचे बेबी सोता है, सोते सोते भूख लगो, खा लो बे मूंगफली, मूंगफली में दाना नहीं, हम तुम्हारे मामा नहीं, मामा गए दिल्ली, वहां से लाए बिल्ली, बिल्ली के 2 बच्चे, हम सब सच्चे. डन है? चलो, let's talk about the next is carcinoma esophagus. Sir, carcinoma esophagus, if you see, upper 2/3 part is having squamous lining and lower 1/3 is having what, sir? Adenocarcinoma. Here the filling defect is initially the dysphagia we talk about. Dysphagia is for solid more common than the liquid. Solid more common than the liquid, sir. Okay? Now, solid more common than the liquid, sir. Here you remember the bird beak sign is there. Sorry, rat tail appearance is there. Rat tail appearance is there, but the irregular one. Irregular. In the surgery, we are going to talk about the surgical treatment of. So, proximal margin we take 15 centimeter. Distal margin we take 5 centimeter. How to investigate? We will use a endoscopic USG. Endoscopic USG initially, then we take an endoscopic biopsy. Local staging के लिए we do a MRI. Metastasis के लिए we do a CT scan where it is going. So all those things we will learn in a surgery also, sir, about the cancer esophagus. Cancer esophagus. Now coming to the next condition, that is condition number 5, diffuse esophageal spasm. My dear friends, diffuse esophageal spasm itself is telling you this is a spasm of the esophagus, which is making the esophagus looks very, very irregular, and there is a filling defect on the barium swallow investigation. You are going to see which appearance, sir? This is called as cork screw appearance. This is a motility disorder, or in short you can say painful motility disorder. Painful motility disorder in which you are going to see the cork screw appearance. Cork screw appearance. Cork screw appearance, my dear friends. Now coming on to the next one, that is congenital hypertrophic pyloric stenosis. My dear friend, congenital, that means initial weeks. So remember, present in few weeks after the birth. That is first thing. What do you mean by hypertrophy? Hypertrophy means increase in size of cell. Increase in size of cell. And where it is happening? At the pylorus. If at the pylorus the cell size is increasing, there is going to be the stenosis. There is going to be the stenosis. And which contrast media now we are using right here, sir? Can you tell me? Which contrast media? Is it barium swallow or is it barium meal? So your answer is going to be barium meal, barium meal. And which sign you are going to see right here, sir? Because of the narrowing of the pylorus, because of the stenosis of the pylorus, can you tell me which sign you are going to see? This is called as mushroom sign. This is called as mushroom sign. And this baby will be presenting with the vomiting also. This baby will be presenting with the vomiting also. Can you tell me vomiting की अगर बात करेंगे, so which vomiting is going to be there? With HCl. तो HCl, sorry, acid is going to come out. ठीक है, acid is going to come out. And is it bile stain vomiting or non-bile stain? Because there is an obstruction in the pylorus. The vomiting is going to be the non-bile stain vomiting. Plus when we are palpating, there will be a olive shaped lump. There will be a olive shaped lump, my dear friends. So here see child present with the non-bilious vomiting. Per abdomen olive shaped lump. So the acid is going outside. Your acid is going outside, because of which what will happen inside? Metabolic alkalosis. You are going to see what, sir? Metabolic alkalosis, metabolic alkalosis, metabolic alkalosis. Done and dusted, sir. Done and dusted, sir. Now coming to the next one is seventh one, diverticulitis. Diverticulitis. Now diverticulitis, you will see small outpouching in the diverticula. We are talking about the large intestine, where you will see the small outpouching is there. And on the investigation, what we are putting right here, from here we are putting which contrast media? Can you tell me which contrast media we are talking about right here? Please identify that contrast media we are talking about right here, sir. The contrast media which we are using right here is, this is barium enema, very good, and which this appearance is called as, sir, what this appearance is called as, yes, many of my friends have already guessed, this is called as sawtooth appearance, my dear friends. This is called as what, sir? Sawtooth appearance, sawtooth appearance. Wonderful answer and a wonderful performance by each one of you. Approximately you will see in an exam 30% questions are very easy. 30% are very easy like these. Sir, 40 to 50% are moderate questions. Moderate questions mean you need to apply some logic along with that. And sir, again 20% what are left, they are tough questions. So tough questions are 20%. And doable are at least 80%. Out of this 80%, 30% is very easy stuff. In that 30%, make sure you make minimum silly mistake. Silly mistake is going to happen. But in those 30%, try to avoid that. And that happens when we are very overconfident or under studied. The two things are there. Either we are very much enthusiastic कि ये तो आता ही है, ये तो छोड़ो, या तो हमें बिल्कुल नहीं आता. तो उस केस में easy questions के अंदर गलतियां होने के चांस रहते हैं. तो be in somewhere in the equilibrium where you will fall in the 80% of the category, and definitely you guys are going to pass the exam, sir. Now diverticulitis, basically investigation of choice, if someone is asking, then is going to be the CECT, but initial first investigation, barium enema we will put, and we will see a sawtooth appearance, sawtooth appearance. ठीक है, चलो. Let's talk about the colon cancer. Let's talk about the colon cancer, my dear friends. Colon cancer, if we talk about, sir, colon cancer, you will see it is risk factor is mostly because of what? Red meat. Red meat की वजह से mostly common होता है. It is right sided colon cancer, left sided colon cancer. One will obstruct, one will bleed. In treatment we do right hemicolectomy, left hemicolectomy. But here you need to focus on the defect. On the barium enema, again you are going to see the apple core defect, sir. Apple core, typical feature, radiological sign you are going to see in the colon cancer, and that is going to be your apple core. Also the gene involved is C for colon and sounding like a K. There is going to be the KRAS gene mutation. KRAS gene mutation. KRAS gene mutation is going to be there. Done, sir. Now coming on to the next one, most common cause of most common cause of obstruction in the children, and that is going to be the intussusception. See sir, what is happening in the intussusception? There is going to be the telescoping of the intestine. There is going to be what sir? Telescoping of the intestine. And what different type of signs you are going to see? So my dear friends, remember, number one, you can see right here sir, coil spring appearance. Sir, claw sign you are going to see, sir. Donut sign, this is also called as what sir? Target sign, my dear friends. Also you are going to see sausage shape lump. So these are the signs which are associated with the intussusception. Plus the stool is going to be the red recurrent jelly stool. Red recurrent jelly stool. Can you tell me which vaccine is associated with the intussusception? Another MCQ you can add right here. Which vaccine we have to talk about? Yes, Shweta has given a correct answer, and that is going to be the rotavirus, sir. That is going to be the rotavirus. See how well you guys are trained, how well you are revising in such a short time. Such high yield content is there with you, and if you are good to go further, you can solve some more MCQs, which will give you idea what extra things I need to add on in my knowledge. Sir, beautifully done, beautifully done. Now let's talk about the 10th one, that is ischemic colitis. Sir, ischemic colitis, where you will see the ischemia, and ischemia on the X-ray looks more black. So here you will see a beautifully right here, you can see right here, thumb printing sign. What you are going to see, sir? Thumb printing sign, thumb printing, ischemic colitis. Done, sir? Then coming to the different type of bubbles. Bubbles are asked multiple times. As I told you, these topics belongs in the 30%, which is easy doing questions in the exam. So first of all, let's talk about the pyloric atresia. What do you mean by bird atresia? Atresia means absent, some structure is absent. Okay? Absent. Then coming to the single bubble sign. In the pyloric atresia, you are going to see the single bubble sign. In the duodenal atresia, you are going to see the double bubble sign. What is another condition in which you are going to see the double bubble sign? Any guesses is there? And this has been asked in your previous exam also, my dear friends. Which other condition is associated? Yes, coffee with scrub has given a very correct answer. Annular pancreas. When the ring of the annular tissue is covering the duodenum and constricting it, there will be again a double bubble sign. Annular pancreas. Annular pancreas is going to be the answer, my dear friends. Then coming to the jejunal atresia. Jejunal atresia, you are going to see the triple bubble sign. Triple bubble sign. Now, can you tell me when you are going to see the multiple bubble sign? When you are going to see the multiple bubble sign, sir? Where you are going to, which condition you are going to see the multiple bubble sign, my dear friends? The multiple bubble sign is a condition seen in, yes, you know the answer, you can give the answer. The multiple bubble sign is intestinal perforation. So now another sign, cupula sign. Cupula sign you will see in, another sign, please tell me. Cupula sign you are going to see in, yes, cupula sign you are going to see in peritoneal perforation, where gas will be under the diaphragm, where the gas will be. Very good, peritoneal perforation. Pneumoperitoneum होएगा जब. Very very good Shalinder, very good Faizo, very good Shabash, बहुत ही बढ़िया Anirudh, Vacha, absolutely correct. So here we are done with this part. Now sir, sigmoid volvulus, again multiple time asked question both in FMG and NEET PG exam. This sigmoid volvulus, what is happening? Your sigmoid colon is wrapping against itself. You have seen two dogs fighting with each other, and one tail there, here. That is what, sir? Anti-clockwise rotation is there. Same thing is happening here. Now this is going to show you the beautiful sign, and this is called as coffee bean sign. One more sign is seen here, that is called as bird of prey sign. Bird of prey sign is also seen right here, sir. Bird of prey sign. Okay, sir? Chaliye. Chalo, sir. Let's talk about the next. And that is your ulcerative colitis. Ulcerative colitis. Ulcerative colitis. Can you tell me the drugs we have learned in the ulcerative colitis? What drugs we have given? Gali se associated hai. That is what I can tell you, as a hinting word for this diagnosis. Ulcerative colitis. Yes, my dear friends. Can you please let me know what we are talking about? Sir, first of all, you will see which sign you are going to see. Here you can appreciate right side. Here you can appreciate right here side. This is ulcerative colitis का lead pipe allergy. Others are collar button, pseudopolyp, granular mucosa. Ulcerative में superficial, you can see mucus or submucus is involved. Superficial layers are involved in the ulcerative colitis, and main feature you are going to see sulfa sala, O sala, Mes sala. Yes, Tania Firdos has given a correct answer. Now coming to the next, in the Crohn's disease, what you are going to see? The Crohn's disease, you are going to see the string sign of Cantor. String sign of Cantor, string sign of Cantor, string sign of Cantor you are going to see, sir. Also in Crohn's disease, you will see the skip lesion. Skip lesion, skip lesion. Can you tell me from pathology which anka you are going to see in the ulcerative colitis and which anka you are going to see in the Crohn's disease? Okay, which anka you are going to see in the ulcerative colitis and which anka you are going to see in the Crohn's disease? Can you tell me? In the Crohn's disease, it is going to be the P anka. In the ulcerative colitis, it is going to be the C anka. Perfect answer. If you don't know, totally fine, but we have learned after attending the class. That matters the most. That matters the most. Shabash. What a wonderful performance by each one of you. Beautiful, beautiful answers by each one of you, sir. Now coming on to the next one, sir. Hydrid cyst. Hydrid cyst is caused by this. Yesterday only we have learned this thing in a microbiology, sir. It is caused by Echinococcus granulosus or dog tapeworm, where you are going to see the definitive host. Who is a definitive host and who is an intermediate host, sir? Who is a definitive host and who is an intermediate host? From the yesterday only I have taught you, sir, who is a definitive host. Intermediate host is man or sheep, and definitive host is bow bow, that is dog, that is dog, that is dog. Beautiful answer. And here it is water lily sign, water lily sign. In the surgery also we are going to talk about this again, and we are going to talk about the technique by which we will get rid of this. Now my dear friends, gallstone. This investigation is, can you identify the investigation which is shown in the image right here, sir? Which investigation is shown in the image right here, sir? Which investigation is shown in the image right here, sir? This is ultrasound, ultrasonography, and this is something called as posterior acoustic shadow. If posterior acoustic shadow is present, that means this is a radiolucent gallstone. Radio-opaque gallstone, radio-opaque gallstone. Done, sir? So this is for the investigation of choice in case of a gallstones. In the radiology, just this thing you need to know and you are good to go. Now coming to the diaphragmatic hernia, my dear friends. Diaphragmatic hernia, okay? Now diaphragmatic hernia, what is happening? When the baby is born and the diaphragm is very weak, weak diaphragm lead to the protrusion of intestinal content in the thorax, So this condition requires the treatment. First of all, resuscitation we need to do, IV fluids, etc. we need to give to such patient, and then we have to reposit it. Okay? Good. Okay? Now can you tell me, anyone guesses the type of congenital hernia? Boldeck. Yes, Boldeck type is there. One more type is there. Okay? Most common is Boldeck type of congenital diaphragmatic hernia you are going to see, sir. Now coming to the next we have talked about, and that is what, sir? Your, yes, Morgagni and Boldeck. Morgagni is more common than the Boldeck. Okay. Now Crohn's disease, you are going to see the string sign of Cantor. If you can appreciate right here, sir, string sign of Cantor. This is again a feature of Crohn's disease what we were discussing of. This completes our 19 diagnosis in case of what, sir? Your GIT. Now I'll one by one ask you the questions. Can you identify the disease? Just showing you 4 to 5 images just to know the radiological diagnosis you are able to find or not, and rest are the extra points you can keep on adding in your brain simultaneously. My dear friends, yes, please let me know. Okay, jaldi se. The diagnosis is going to be, Weber-Killer has given a first answer, that is Plummer-Vinson syndrome. The next diagnosis you have to make, yes sir, please let me know what the diagnosis. Guess the diagnosis. Beautiful answers by all the broad-minded medicos, colorful FMGs. Please let me know. Please let me know the answer. This is diffuse esophageal spasm. Very nice. Sir, diagnosis. Yes, absolutely correct. Please, diagnosis. 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 Diverticulitis. Very nice. Very nice. Sir, diagnosis. Diagnosis. Very, very nice, sir. Very, very nice, sir. Diagnosis. Ischemic colitis, thumb printing sign. Very, very good. Please, diagnosis. 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 Sigmoid volvulus. Very, very nice. Very, very nice, sir. Very, very nice, sir. Diagnosis. Diagnosis. CHD, that is congenital diaphragmatic hernia. Beautifully diagnosed. Everyone has done a very beautiful job. Now we are good to start with the next system, and that is going to be the respiratory system, sir. The next system we are going to start is respiratory system, sir. Respiratory system. And for number one, we have to talk about the atypical pneumonia, sir. Atypical pneumonia, sir. Atypical pneumonia. The most common cause of atypical pneumonia is going to be mycoplasma. Yesterday itself we have learned about this, sir. Atypical pneumonia. This is going to be the mycoplasma. Mycoplasma is gram positive or gram negative? My first question for all of you. Mycoplasma, and this is previous year question. Mycoplasma is a cause of atypical pneumonia where on the X-ray you will see the opacities. Multiple opacities you are going to see on the chest X-ray. This is atypical pneumonia. Please let me know, this is what? Positive or negative? Mycoplasma is gram negative. Acid fast bacilli, very good. Chalo. Coming to the Klebsiella pneumoniae, Klebsiella pneumoniae, Klebsiella. You can see right here, sir. And also, can you tell me the cause of, gram positive it is. Can you tell me the most common cause of typical pneumonia? It is gram positive. It is gram positive, yes. Typical pneumonia. Can you tell me the cause of typical pneumonia? Pneumococcus pneumoniae. Pneumococcus pneumoniae. They both are what, sir? Gram positive. Gram positive. Now, Klebsiella. So, Klebsiella pneumoniae will lead to bulging fissure like this. You can very well appreciate right here, sir. Opacity on the right side, upper lobes are involved. This is bulging fissure present, and this is going to be the Klebsiella pneumonia, sir. Now coming to the Aspergillus. Aspergillus is a fungal infection caused by Aspergillus. Aspergilloma is a fungal infection caused by Aspergillus, sir. Aspergillus. Now what you are going to see right here, sir, this air crescent sign on CT scan, it is asked in your previous exam, sir. Air crescent sign on CT scan is a feature of Aspergilloma. Now, sir, miliary TB. Miliary TB, if you see, sir, hematogenous root spread is going to be there, and millet seed pattern you can very well appreciate. This is HRCT, and this is going to be the chest X-ray where you're going to see the millet seed appearance. Sir. Now coming next to the Gons focus and Simon focus, that also we have learned yesterday. Sir, primary TB, in the primary TB which is most common in the children, the middle to the lower lobes are involved. And the focus you are going to see is Ranki plus Gons. Ranki plus Gons focus you will see in the middle to the lower focus. And Simon focus is seen in the secondary TB. And this is involving middle to the apical lobe, sir. And here you are going to see the ऊपर क्या होता है? आसमान focus और Simon focus. So primary TB, in short you have to remember, primary TB के अंदर middle to the lower lobes are involved, and the focus you are going to see Rankis and Gons. In the secondary TB, sir, middle to the apical lobes are involved, and the focus you are going to see Simon and Asman focus. These are the focus you are going to see. Now pleural effusion, pneumothorax, important topic. Sir, pleural effusion, when there is a fluid inside the pleural cavity. So understand right here, the CP angles are blunt now. Now patient is having difficulty in breathing also. and also patient might be cyanosed also. My dear friends, what a treatment you are going to give to such patient? What a treatment you are going to give such patient, my dear friends? Tell me, what treatment you are going to give this patient? Sir, you are going to give this patient tube thoracostomy. Tube thoracostomy. Tube thoracotomy. How you are going to do the tube thoracotomy? If this is a rib, my dear friend, you are going to go for the upper border or lower border? Yes, tube thoracostomy we are going to do. Yes, upper border or lower border? Upper border or lower border? Sir, you are going to go from the upper border because on the lower border neurovascular bundle is present. I taught you well in the anatomy class we have learned on the very first day, sir. Yes, very nice, very nice. Pleural effusion. Sir, the most common in the adult is going to be the most common space in adult is going to be the 5th mid axillary, and in the children it is going to be the 2nd mid clavicular. 2nd mid clavicular. Now coming to the same condition, pneumothorax. Now पानी की जगह क्या भर गई? हवा. So you can see your lung is getting collapsed, and between visceral and the parietal pleura you will see complete air which is making it collapse. In this also you will do a tube thoracotomy. Very good, perfect. Now tension pneumothorax. What is happening in the tension pneumothorax? The air is coming out inside but not going outside. The flaps are not allowing air to go outside. Massive air is trapped and lung is severely collapsed. Along with that, your trachea is deviated to the other side. The trachea is deviated to the other side. This is an surgical emergency, my dear friends. This is an surgical emergency, my dear friends. Now, what treatment you are going to offer right here, sir? This is a surgical emergency. What treatment you are going to offer right here, sir? What treatment you are going to offer right here, sir? What treatment you are going to offer right here, sir? Yes, please let me know. Needle thoracosynthesis with the wide bore needle. Yes, my dear friend. Coffee bean scrub. Yes, very good. It is needle thoracosynthesis. And if you see the air and water in the same compartment, air bhi ghus gayi wahan, pani bhi ghus gaya, there is a flat line, and straight away radiological diagnosis is going to be a hydropneumothorax. Going to be what, sir? Your hydropneumothorax. Done. Now coming to the next finding you are going to see in the respiratory system, and that is going to be the cannonball appearance, sir. Cannonball appearance. My dear friends, cannonball appearance. Why it is seen so? Any cancer, including any cancer in the body, if it go to the lungs, it will form this cannonballs. It will form the irrespective of anything. Any cancer metastasizing to the lung will show us cannonball appearance. Now, sir, Pancoast tumor. The most common area which Pancoast tumor is involving is right side apical mass. You are going to see. You can very well appreciate right here, sir, right in the right place, apical mass. Now this will lead to the Pancoast syndrome. In Pancoast syndrome, you are going to have a pain. You are going to have a brachial plexus involvement. If it is growing big, here are the brachial plexus involvement will be there. And sir, there will be a atrophy of the upper limb muscle. Sir. Can you tell me which splint you will give to such patient where brachial nerve is getting injured? Can you just guess the name of the splint you are going to give such patient in case of a brachial plexus injury, sir? Brachial plexus injury, sir. And my dear friends have given a very correct answer, and that is none other than your aeroplane splint. That means you people are well revised, well taught, well remembered. Very nice. And then also this patient is going to have a Pancoast syndrome. Now Pancoast syndrome is multiple time taught to you, all of you. Pancoast syndrome आपको बार-बार पढ़ाया जा चुका है, अब आपके दिमाग में बस चुका है. सर एक निमोनिक तो बताया था आपने, female. What is this female, my dear friends? ptosis, meiosis, anhydrosis, loss of ciliospinal reflex, and anophthalmos. Sir, what test we are going to do to check the this syndrome? Horner syndrome. Can you tell me Horner syndrome? Which test we are going to do? I taught you there in the pharmacology itself, sir. Horner syndrome में sir. Yes, Horner syndrome में which test? Which test, my dear friends? Someone was dilating the eye, and that was none other, and that is metabolized by pseudocholinesterase. That also hint I am giving you. Sir, that is also called as white lady, sir. Another hint I am giving you. अब तो पहचान जाओ लाडलो, क्या कर रहे हो? Yes, join our Telegram channel Conceptual Medicine to get the PDF annotated and unannotated also, and also daily content. Cocaine. Harshita has given a very correct answer. The answer is cocaine, sir. Cocaine, sir. Shabash, mere shero. क्या बात है? क्या बात है? Very good, very nice, very. So Pancreas tumor is done, sir. Pulmonary hamartoma. There is a popcorn calcification you are going to see in the lungs. Sir, what about this? If this popcorn you will find in the breast. Breast में अगर popcorn मिलने गया तो बेटा फैजू दोस्त मिल गई PDF दे दी है ग्रुप के अंदर. Sir, tell me which other fibroadenoma. 2 popcorns, one is chest, another is there fibroadenoma. Plus 1 popcorn cells we were seeing somewhere in the pathology. Just giving you 2 options, choose one, Hodgkin's or non-Hodgkin's. Popcorn cells in the pathology you will see in the Hodgkin's or non-Hodgkin. A very simple question. Hodgkin or non-Hodgkin? Yes, tukka marna ho to bhi kya maroge? Yes, the answer is very correct. That is Hodgkin's lymphoma. This is how you are going to work in the exam, and this is how you all are going to pass this exam. No one can stop you. May God bless you. Love you all. Truck bhar ke. Chaliye sir, let's talk about the next one. Bronchiectasis. Irreversible destruction to the bronchi. Irreversible destruction. Restrictive lung disease. On CT scan, you are going to see the signet ring appearance. Signet ring look like this. Look like this. This is signet ring. ऐसे ऊपर ऊपर. This is signet ring. Or also one more appearance is tram track appearance. TTA. That is your tram track appearance. हाँ तुक्का ही था. तुक्का था अच्छा था. ठीक है. चलिए tram track appearance. Coming on to the next part called as what's your sarcoidosis, my dear friend, ladies and gentlemen. Sarcoidosis. Sir, sarcoidosis. Abnormal growth of inflammatory cells you are going to see, and bilateral hilar lymph adenopathy you are going to see. One more sign in sarcoidosis you are going to see. That is called as panda sign. Panda sign, panda sign, panda sign. Now one more question, sarcoidosis ka. Sir, sarcoidosis is a causative organism for the anterior uveitis. Sorry, is a condition associated with anterior uveitis, intermediate uveitis or posterior uveitis? Sir, anterior uveitis, intermediate uveitis और posterior uveitis? Yes, yes, ophthalmology कल पढ़ाई थी, उसमें से सवाल आना चाहिए, अभी आएगा निकल के मज़ेदार तरीके से. You are going to no again तुक्का मारना, इतना भी गंदा नहीं मारना. Sarcoidosis is the second most common cause of sarcoidosis is second most common cause of intermediate uveitis. Intermediate uveitis, my dear friends. Anterior का HLA B27 था. Intermediate. Aniruddha has given a correct answer. Intermediate uveitis. Intermediate uveitis. Now coming on to the next sector is emphysema. Emphysema is an obstructive lung disease where compliance is less. Recoil is not. Compliance is there, recoil is not. Because of the compliance, the chest is going to be the barrel-shaped chest. The chest is going to be the barrel shape. This emphysema is of 2 types mostly. One is centriacinar, one is panacinar. Centriacinar is because of smoking, and panacinar is because of alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin deficiency. And the smoking part will lead to squamous cell carcinoma. The smoking part will lead to what's squamous cell carcinoma, Answer this. Antitrypsin deficiency will lead to adenocarcinoma. What is going to happen? There is going to be the viral chest. The vital capacity of the lung is going to increase. What about the FeV1 percentage? The air which is coming out, is it going to decrease, increase or stay normal? ये मैंने आपको फिजियोलॉजी के अंदर पढ़ाया था सर. I have taught you well in the physiology this thing sir. Can you tell me? FeV1 percentage, I am asking you. This is going to be decreased, my dear friend. Very good answer by everyone. Vaibhav, Vaishwani, Sankaran, Maria, Himanshi, Shivom, Harshika, Anirudh, Faizu, Techie, Coffee. Very, very good. Everyone very good. The absolutely correct answer. Now silicosis. सिलिका डस्ट की वजह से होता है निमोकोनियोटिक डिजीज वेयर यू आर गोइंग टू सी द एग शेल कैल्सिफिकेशन. जैसा अंडे का बाहर की परत होती है वैसी कैल्सिफिकेशन यू आर गोइंग टू सी. नाउ सर इफ देयर इज अ केस ऑफ न्यूमोपेरिटोनियम, which sign is this? You have already answered this sir. Which sign is this sir? Pneumoperitoneum, which sign we are talking about, my dear ladies and gentlemen? Which sign we are talking about? This is what called as cupula sign. This is what called as cupula sign. If you will see the peritoneal perforation, my dear friends, the first, this was exam question, that is why I have written this. Next step is directly you will not go for the exploratory laparotomy. First you will give the IV fluids, my dear friends. IV fluids, my dear friends. IV fluid, my dear. Then you will go for the exploratory laparotomy. And if someone is asking you pneumoperitoneum ka case is there, what is the definitive management? Then you will mark answer as exploratory laparotomy. And if someone is asking you before exploratory laparotomy, what you will do? Your answer should be IV fluids. Your answer should be what, sir? IV fluid, IV fluid, IV fluid. Now what is consolidation? With the air bronchogram, when air is replaced by fluid inside the lungs, my dear. COVID-19, what you are going to see? Multiple glass ground opacities, multiple glass ground opacities, glass ground opacities. Pneumocystis jirovecii, HIV positive and bilateral glass ground glass appearance, ground glass appearance. Done, done, done. Clear okay, Fanta? Now I will ask you some X-rays and you will answer me, sir. Sir, please make the diagnosis. लंच कौन से करता? तुम बना के लाने वाली थी ना आज, लाई नहीं, बताओ. काम चोरी करती हो, बिल्कुल गलत बात. चलो आंसर. तुमने माना कि तारीफ मुमकिन नहीं. आफरी 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 भी देखे मुझे. वेरी गुड आंसर है जी. वाओ. डायग्नोसिस, डायग्नोसिस. चुप चुप खड़े हो जरूर कोई बात है. पहली मुलाकात है जी, पहली मुलाकात है. ला 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 ला. पहली मुलाकात है जी, पहली मुलाकात है. दिस इज गोइंग टू बी द मिलिट्री टीवी. शाबाश मेरे शेरो. सर डायग्नोसिस, लंग कोलैप्स है और आपका ट्रैकिया डेविएट नहीं है. फिर ये क्या होगा? ये होगा कि वो होगा? बताओ शेरो क्या होगा? आंसर तुमको आता है, चैट में लिख के बता दो जी. This is pneumothorax, naughty boys and girls. The diagnosis is going to be, the diagnosis is going to be, yes, 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 yes. Yes, 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 yes. Yes, 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 yes. Hydropneumothorax, hydropneumothorax. Bolo, hydropneumothorax. Yes, 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 yes. Yes, 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 yes. Can you tell me popcorn calcification in the chest X-ray is seen in? And the answer you know, you should type in the chat box. La 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 la. ला 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 ला. पल्मोनरी हेमाटोमा. क्या बात है, बहुत बढ़िया आंसर दे रहे हो, खुश हो गया दिल. यस, यू नो द आंसर, यू विल से इट नाउ. यू हैव द आंसर, यू विल पास द एग्जाम. मे गॉड ब्लेस यू ऑल एंड लव यू ट्रैक भर के. यस, दिस इज व्हाट, दिस इज व्हाट सर. सार्कोइडोसिस, बायलेटरल हाइलर लिम्फेडिनोपैथी. ओके 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 ओके. That condition is called as, this condition is called as This condition is called as सर ने कौन सा गोद ले रखा है, तुम्हें कॉफी पिलाएंगे जो है? चलो, this is cupula sign, pneumoperitoneum. Very good. Clapping. We finish one system. Now we are going to do the another system, which is cardiovascular system, and this system is integrated with your pediatrics, my dear ladies and gentlemen. Okay, chalo, let's talk about this cardiovascular system. First of all, the number one thing we are going to study is TGA, transposition of great arteries. Now what is happening right here? On X-ray you are going to see egg on string appearance. संडे हो या मंडे रोज खाओ अंडे, अभी अंडा किस पे लटका हुआ है? धागे पे। ये मोह मोह के धागे तेरी उंगलियों पे जा उलझे, कोई टोह टोह ना लागे किस तरह। So my dear friends, what is happening right here? Now your aorta, क्या ओटा ना खोटा मुंह खोटा खोटा सिक्का, aorta is abnormally arising from right ventricle. Normally tell me, aorta should arise from where? अब ये राइट वेंट्रिकल से अराइज हो रहा है एओर्टा। कहां से अराइज होता है एओर्टा? राइट का उल्टा क्या होता है? इट इज लेफ्ट साइड माय डियर फ्रेंड्स, बट हियर इज अ प्रॉब्लम, इट इज अराइजिंग फ्रॉम द राइट साइड. That is why the appearance is looking like a anda. So egg on string appearance, egg on string appearance. Answer is going to be what, sir? Egg on string appearance. So egg on string appearance. Why? Because aorta is abnormally arising from the aorta right ventricle. Done, done, done. Now coming on to the TAPVR, somewhere it is called TAPVC also. TAPVR, what is happening, sir? Figure of 8 appearance or snowman appearance. Yes, I'll draw snowman for all of you. This is called as snowman appearance. Chalo. Now this snowman appearance, why this is so? Why this is so, my dear friends? The pulmonary vein, which is supplying oxygenated blood, is draining into right atria. Is draining into right atria. Where it should drain? Can you tell me? Pulmonary vein, which is supplying oxygenated blood, where should it drain? जब आपके राइट वेंट्रिकल से निकल के पल्मोनरी आर्टरी जाती है लंग्स पे, लंग्स से पल्मोनरी आर्टरी कहाँ जानी चाहिए? पहले लॉजिक लगा के बताइए. इट शुड कम इन द लेफ्ट एट्रिया. नाउ इट इज कमिंग इन राइट एट्रिया. यस माय डियर फ्रेंड, एंड दैट इज व्हाट प्रॉब्लम हैपनिंग हियर, एंड बिकॉज ऑफ विच यू आर हैविंग अ फिगर ऑफ 8 appearance and this is Santa Claus appearance. Now my dear friend, another question is figure of 8 appearance. The figure of 8 brace is used for, or you can say splint or sling is used for. Figure of 8 sling is used for. Orthopedic question, just taught you yesterday only. That is why I clearly asking you, all of you, my dear friends. This is going to be the bilateral clavicular fracture. Bilateral clavicular fracture. Shailendra, very good. Shailendra, very good. Very good. Shailendra the great. Chalo. Sir, now coming to the tetralogy of Fallot, sir. Tetralogy of Fallot, sir. Tetralogy of Fallot having a 4 components, sir. What is 4 component they are having, sir? POVR. This is how I remember. POVR. P for pulmonary stenosis, sir. P for pulmonary stenosis, sir. V for ventricular septal defect, sir. O for overriding of aorta, sir. And R for right ventricular hypertrophy. Sir, because of this right ventricular hypertrophy, you are going to see the boot-shaped heart, sir. Boot-shaped heart, sir. And if I add one more feature, it will become pathology of Fallot. Can anyone guess which one feature we will add to this and it will become pathology of the Fallot? Which one feature we are going to add and this is going to become the pathology of the Fallot, my dear friend? This is going to be the atrial septal defect, my dear friends. Atrial septal defect, my dear. Atrial septal defect, my dear friends. ओ जूते ओ दूल्हे की सालियो, ओ हरे दुपट्टे वालियो, पैसे ले लो, जूते दे दो, पैसे दे दो. Ta-da na na na. Box shape heart, dandana, sorry, boot shape heart. Now coarctation of aorta, persistent narrowing is seen in the aorta, which will lead to the figure of 3 appearance. Which will lead to the figure of 3 appearance. Figure of 3 appearance. ठीक है? ठीक है? चलो, done. Now pericardial effusion, pericardial effusion, pericardial effusion, pericardial effusion. Okay, chalo, done. Pericardial effusion. ठीक है, चलो पेरिकार्डियम, मनी बैग और लेदर बॉटल अपीयरेंस। पेरिकार्डियल एफ्यूजन में क्या हो रहा है, दिल के अरमा, इफ दिस इज अ हार्ट, इफ दिस इज अ हार्ट, दिल के आसपास क्या भर गया, पानी, तो क्या बोलता है, सैया ने देखा हमको ऐसे, मैं पानी पानी हो गई। सो याद रखना, देयर इज अ वाटर नियर द इन द पेरिकार्डियम स्पेस, ठीक है। हाउ यू विल ट्रीट सच कंडीशन, क्या करोगे आप वहां पे, नीडल कार्डियोसिंथेसिस वी विल डू, डन। Epstein anomaly, what is this Epstein anomaly, my dear friends? There is going to be the box shaped heart. Why this is box shaped heart? It is because of the enlarged ventricles. This Epstein anomaly is associated with which toxicity? My question for all of you, sir. Epstein anomaly is, yes, lithium. Lithium is a mood stabilizer given during the pregnancy, and this is causing the problem. Very good answer by all my dear friends who are watching us live. Beautiful answers by everyone, shabash, very good, proud of you. ठीक है, both the ventricle, yes my dear Shweta friend, right more than left is the correct answer. Congestive heart failure, 4 important feature you have to remember of, sir. Congestive heart failure, my dear friends, you have to remember, first is increase in cardiothoracic ratios, second is pleural effusion, sir, third is cephalization of the vessels, sir, fourth is curly B line, sir. These are the 4 features you are going to see. Also bat wing appearance, yes we see bat wing appearance. Congestive heart failure, acute congestive heart failure, chronic congestive heart failure, that we are going to study in the medicine ka topic, sir, medicine. Now constrictive pericarditis. Constrictive pericarditis, there is a thickening or you can say calcification of the pericardium, and this mimics the TB. TB के अंदर you will see the calcification like this, and here you are going to see egg in cup sign. ऐसा लगता है जैसे अंडा डाल दिया कप के अंदर, तो egg in cup sign, egg in cup sign, tubular heart. Yes, my dear friends, Swami Lucky. Now aortic dissection, what is happening, a tear in the internal layer of the aorta will lead to the tennis ball like appearance. The true lumen, right here you will see there is a tear in the luminal layer of the aorta, and this is going to separate from the true layer, and true layer is this layer which is more white, and this is false lumen. This is false and true, it is looking like a tennis ball, that is why called as tennis ball like appearance. You are going to see in the aortic dissection. This completes our CVS also. Now I'll ask some questions and you will answer me, sir. Randomly I'll ask you. चलो ऐसे बिना उसके भी पूछ लेते हैं. चलो sir, figure of 8 appearance is seen in, my first question for all my dear broad-minded medicos. Figure of 8 appearance is seen in. Figure of 8 appearance is seen in TAPVR, TAPVC, very good. Tetralogy of Fetal, where boot shape heart is seen. What are the 4 features we are having? Chalo. Tetralogy of Fetal, what 4 features we are going to see? What 4 features we are going to see, sir? Just mnemonic bhi bata doge, I'll be more than happy. I'll be more than happy with you guys. You guys are my love. POVR. Sir, egg in cup appearance. 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 Constrictive pericarditis. Sir, egg on string appearance. Egg on string appearance. Egg on string appearance. Egg on string appearance. Sir, egg shell calcification. तीसरा अंडा. Egg shell calcification. Egg shell calcification. Eggshell calcification. Eggshell calcification. Eggshell calcification. Very good. Silicosis, absolutely correct. Coming on to the next system, CNS. You will see ischemic versus hemorrhagic stroke, my dear friends. We are having an image of NCCT, head. In this, if there is a hemorrhage, there will be a white area. If there is a ischemia, there will be a black area, sir. A typical radiological diagnosis if you have to make between the hemorrhagic and the ischemic. Why this ischemia is happening? Because of the thromboembolism. Because of thromboembolism, this ischemia is happening, and treatment is going to be the antithrombotic agents like erytipase, etc. Done, sir? Now, hemorrhagic stroke is happening mostly because of the hypertension, EDH, SDH. Now here the primary motive is control little bit of BP plus give the perfusion. ठीक है? ठीक है? चलो, done. Then coming to the hemorrhagic stroke के अंदर हो गए, which in the stroke which artery is bleeding, which area is bleeding? Can you tell me which area is bleeding and which artery is most commonly bleeding? In the hemorrhagic stroke, the area bleeding most commonly is putamen, and the artery which is bleeding most commonly is going to be the mid-cerebral artery, MC artery, mid-cerebral artery, sir. Mid-cerebral artery, very, very good. Subarachnoid hemorrhage, very good, Shweta. Subarachnoid hemorrhage, sir, there is going to be the thunderclap headache. There is an injury to the subarachnoid space, or you can say what is bleeding? Berry aneurysm. You can very well see right here, sir. Berry aneurysm is getting bleeded. Done. Now, subdural hemorrhage. Subdural is like a sickle-shaped hemorrhage. Sickle-shaped hemorrhage. तो कहता है सबको पार जाना है नदी के. कैसे जाएंगे? ब्रिज से. तो इंजरी is going to be to the bridging veins. Then coming to the EDH, multiple time asked question in the exam. Chal, let's talk about the extradural hemorrhage. Extradural hemorrhage, you will see right here. Plano-convex. E for extra, E is like a idli. Who makes good idli? Mamma, MMA. Mamma makes very good idli, that is middle meningeal artery. You are going to see the lucid interval. What is lucid interval here, sir? The patient will be awake and patient will be what, sir? Drowsy. Or you can conscious and unconscious is a better word. Conscious, unconscious. Conscious, unconscious state will come. This is what called as lucid interval. Lucid interval, lucid interval. Now coming on to the next one is Sturge-Weber syndrome. Sturge-Weber syndrome. Sane insane wala alag hai. Mostly conscious, unconscious is mostly associated with this, and also sanity, insanity can also come, but mostly conscious, unconsciousness will come. Now, sir, Sturge-Weber syndrome, you are going to see the port wine stain right here, sir. Plus, you are going to see the tram track calcification. Typical feature. Neurocystic sarcosis. Yesterday only we have learned in the microbiology, neurocystic sarcosis is caused by Taenia solium. This is a tapeworm worm. Tapeworm caused due to eating of a pork, uncooked pork, and there will be a cyst in a dot or dot in a whole appearance. You can appreciate right here, sir. Cyst in a dot or dot in a whole appearance. ठीक है? चलो, इसका PDF मिलता है क्या? हाँ, बिल्कुल मिलता है. आप अपने चैट बॉक्स पे ऊपर जाइए, कॉन्सेप्चुअल मेडिसिन ज्वाइन द लिंक पे दिया है. लिंक खोलने के बाद आपको टेलीग्राम मिलेगा. इस टेलीग्राम में आपको सारी PDFs मिलेगी. ठीक है? चलिए. Multiple myeloma is a plasma cell tumor. Here you are going to see the loss of Benz-Jones protein. On the X-ray skull you are going to see raindrop pigmentation, and other bones you are going to see the punch out lesion. Typical finding, radiological finding. Paget's disease, old bone replaced by new bone is faulty now, my dear friends. Can you tell me this cotton wool skull is seen in which stage of Paget's disease? There are the 3 stages we have talked about yesterday. There are the 3 stages we have talked about yesterday, my dear friends. What are the 3 stages we are talking about? Dil ka dariya beh hi gaya. Sir, mixed stage. Mixed stage. Can you tell me the other finding you will see in the Pages disease? Other finding also I have shown you, sir. Other findings of the Pages disease. We have seen this yesterday only, my dear ladies and gentlemen. My dear ladies and gentlemen. Chalo, fatafat se. Picture frame vertebra. Yes. Grass blade sign, flame sign. Very, very good, sir. Diffuse axonal injury. You can see hypodense foci on NCCT. Axon are getting damaged. This is putamen area. Axons are getting damaged. Diffuse axonal injury. Meningioma, dural tail sign is there. Plus samoma bodies you will see. Most common benign tumor. Then glioblastoma multiforme, butterfly shaped tumor you are going to see. This is a malignant tumor of the brain, sir. Malignant tumor of the brain, sir. Oligodendroma, sir. Remember calcium deposition you will see on the CT scan right here, sir. Very nice. Yes. Fried egg cytoplasm is also a feature of oligodendroma glioma, sir. Putamen bleed, as we already talked about, mid-cerebral artery is going, sir. And the reflex which is going to be positive is Babinski's reflex, sir. On touching the extremities, there is going to be the fanning of the finger. That is Babinski positive, sir. Now, Mount Fuji sign you are going to see in the tension hydropneumocephalus. Tension hydropneumocephalus. Some questions I am going to ask, my dear friends, and you are going to answer me right now, sir. Question number 1, I am going to ask you, sir. Cyst in a dot or dot in a hole sign is seen in. Cyst in a dot or dot in a hole sign is seen in. Yes. Cyst in a dot or dot in a hole sign is seen in. Neurocystic sarcosis. Neurocystic sarcosis. Very, very good. Sir, bridging veins are getting damage in which disease? Which injury we are talking about? Bridging veins are getting damage in SDH. SDH. Sir, tram track appearance plus port wine stain. Tram track appearance plus port wine stain. What we have to think of? Tram track appearance plus port wine stain. What we have to think of? Tram track appearance and port wine stain. What we have to think of, sir? Sturge-Weber syndrome. Sturge-Weber. Sir, signet ring appearance is a feature of. 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 Signet ring appearance is a feature of bronchiectasis. Bronchiectasis. Very good. Let's talk about the next system called as renal system. First of all, staghorn calculi. You can see triple phosphate stone, most commonly seen with the young boys. Horseshoe kidney, where two lobes of the kidney they are fused together. On intravenous pyelogram, what you are going to see? The flower vase appearance, and on this CT scan you are going to see horseshoe appearance. Horseshoe appearance. Duplex pelvic ileal system. You can very well see this is one pelvic ileal system, this is two pelvic ileal, and this is like looking like a drooping lily. So this is called as drooping lily sign. This is called as what, sir? Drooping lily sign. Ureterocele. Now there is a cystic dilatation in the ureter inside the bladder. This is looking like a adder head or cobra head appearance. Adder head or cobra head appearance, sir. Posterior urethral valve. Now your valve is obstructing your urethra. The male child will be having a complaint of obstruction of flow. On, sir, micturating urethrogram, you are going to see there is an obstruction of the flow, and ultrasound ke upar. This is USG examination. On USG examination, you are going to see the keyhole appearance. You are going to see what, sir? Keyhole appearance. Now, neurogenic bladder. The sphincter tone of the bladder is increased, because of that which the dyes which coming inside is going outside like a tree like this. So remember, this is a Christmas tree appearance. This is called as Christmas tree appearance, sir. Christmas tree appearance. Polycystic kidney disease. On IVP, you are going to see the spider leg appearance, and on CT scan, you are going to see the multiple cysts, sir. Multiple cysts, sir. Multiple. Renal TB, putty kidney, medullary nephrosis, you are going to see the microcalcification of the nephrons. This is an investigation called as micturating ureterogram, which was diagnosing us the posterior urethral valve we were talking about. Posterior urethral valve we were talking about. Then the next system we have to talk about is a musculoskeletal system. Sir, this is due to the deficiency of vitamin D in children, it is ricket, and in the adult it is going to be the which disease? If there is a vitamin D deficiency in the adult, which disease we are thinking of? Vitamin D deficiency in the adult, we are thinking of what, sir? Vitamin D deficiency in the adult, we are thinking of, yes, osteoporosis. Very, very good. This is cupping sign. This is ricketic rosary. Also on head we are going to see. On the head we are going to see. The hint I am giving you. Please try to identify. Head पे कौन सा sign देखने मिलेगा sir? Head पे which sign you are going to see, sir? On head you are going to see what, sir? On the head you are going to see what, sir? Craniotaps, scurvy. Due to deficiency of vitamin C, white line of freckle you are going to see. White line of freckle you are going to, plus gum bleeding you are going to see. Hyperparathyroidism, rugger jersey spine we were talking about, sir. Hyperparathyroidism, where calcium resorption is happening, serum calcium levels are increased. Done, sir. Salt and pepper appearance will also seen, sir. In fingers there is going to be the brown tumor, sir. Thalassemia we were talking about. This sickles, this chipmunk face is exclusively for the thalassemia. Menzer index was there more than 13, sir. We have talked about, sir, yesterday only, sir, in the pathology session, sir. Sickle cell anemia is having both. One is your crew cut appearance or hair end appearance. This is a feature of both thalassemia and sickle cell anemia. And sickle cell anemia will lead to splenectomy. After splenectomy, which bodies are seen? Question for all of you. Sir, after splenectomy, which bodies you are going to see? After splenectomy, which bodies you are going to see? Yes, your answer should be there in the chat box. Yes, my dear ladies and gentlemen, please. After splenectomy, which bodies you are going to see? Howell Jolly bodies. Howell Jollies. Yes. Sundar Sankraman Kumar. Very nice. Very nice. Very nice. Spinal hemangioma, you are going to see what's a polka dot sign and jail bar sign. Polka dot sign and jail bar. Fibrous dysplasia, there will be a Schipper Crookes deformity in the fibrous dysplasia, where you will see a ground glass matrix in the metaphyseal region. Ground glass matrix you are going to see in the metaphyseal. This will lead to a Schipper Crookes deformity. This is again a previous year question of the exam, sir. Now arthritis, osteoarthritis versus rheumatoid arthritis. Sir, osteoarthritis is a degenerative disease and rheumatoid arthritis is an inflammatory disease. Inflammatory disease. The patient will be complaining of early morning stiffening of the fingers for more than 30 minutes. For more than 30 minutes. C-reactive protein, etc. we are going to investigate, and this is how we will make the diagnosis and treatment with DMARD, etc. drugs we are prescribing. Then, sir, osteoarthritis, the most common joint involved is knee joint, most common side involved is medial side. Medial side. Okay, X-ray bilateral standing, bilateral knee standing view, AP lateral we are going to perform. In that we are going to diagnose this osteoarthritis. Now, sir, swan neck deformity and Botnius deformity, yesterday also I have told you. Can you just tell me what is happening on PIP and what is happening on DIP in all of them, sir? If you know one, you will be able to tell others. Can you tell me, sir? Kindly tell me, sir. Swan neck deformity. स्वान नेक पीआईपी में क्या हो रहा है? हाइपर एक्सटेंशन. डीआईपी में फ्लेक्शन. Opposite will happen here, flexion, and opposite will have a hyper extension. This is how beautifully you will separate, and these are seen in rheumatoid arthritis. Charcot's joint or neuropathic joint, it is seen in diabetes mellitus patient. It will look like a fracture, but this is not a fracture. These are the osteophytes which are deposited right there, and they are the painless condition. They are what's that? Painless condition. Multiple myeloma we already did. Extra edge, CT scan, PET CT, and PET CT you will see the radioisotope we use is 18FDG, and this is used for the metastasis. This is used for the metastasis. Now X-ray of the breast is called as, your answer is going to be the mammogram. This is going to be the mammogram. Then technetium scan is there. The cold nodule you can see right here, uptake is not there. When uptake is fully there, this is called as hot nodule. On the basis of this, you will see this is Graves' disease, where a Batman type of appearance is going to see. Multitoxinodular goiter is going to be there, hot and cold, both nodules you can see. And here you will see there is a cold nodule completely, where there is an absence of one nodule, and this is autonomous nodule. And here is going to be the thyroiditis, where there is going to be the small uptake of the radioisotope. So this is technetium 99 scan we were doing to diagnose the thyroid gland disorders. Now coming on to the next topic, and that is called as dermatology. So your radiology is done and dusted in just 1 hour and 15 minutes, my dear friends. Congratulations everyone, and welcome to the Final Aid by Conceptual Medicine, a unique revision program where we are going to do all 19 subjects in 18 to 20 hours, highly beneficial, covering all your previous year topic and high yield topic for the exam, my dear friends. Very good. I will pass. Are we ready to start the next topic, and that is dermatology? Dermatology, my dear friends. Yes, dermatology. आप कौन सी स्किन केयर करते हो मैं नहीं बताऊंगा. चल, dermatology, sir. Let's talk about the layers. Sir, we are having layers, different layers we are having, sir. So this is corneum and basal. Between this, what is there? LEGS, legs. This is how we will remember it. Sir. Sir, here C for corneum, the topmost layer, where it is called as dead keratinocyte, because nucleus is absent. And if nucleus is present, the condition is called as बिल्कुल सही बात है, FMG के नाम का स्किन केयर करता हूं मैं. ठीक है, चलिए. Then if nucleus is present, this condition is called as parakeratosis. Done, sir. Then coming stratum lucidum. Lucidum is a clear cell layer present in palm and soles. Granulosal, where laminar bodies are present. Laminar bodies क्या करती है? हमारा moisturization का काम करती है. If laminar bodies are absent, it will lead to the winter eczema. स्वामी लक्की कह रहे हैं आओ थोड़ा बर्गर खाएं. Now spinosum, you can see this is the thickest layer. Spinosum, you will see this is the thickest layer, having a special cells called as Langerhans cell, whose function is phagocytosis. Sir. Stratum basal is the first layer to be synthesized. This is having what, sir? Here Merkel cell, sir. Merkel cell, type 1 touch receptor, Merkel cell. Also they are having melanocyte, which will secrete a melanosome. ठीक है, melanin, which is responsible for the color tones. Then coming to the base, that is dermis, having the sensory supply, etc. Now these are the basic introduction. Now we'll turn about the cells, the layers, and from where they are derived from. My dear ladies and gentlemen, here if we talk about the cells layer and from where they are divided from, the first thing we have to talk about the keratinocyte. कहता है करो या मरो, Merkel, करो, K for keratinocyte, करो या मरो, they are derived from, you have to act, करो या मरो, act, ectoderm, sir, ecto. Melano, N for no, that is your neural crest cell, sir. न्यूरल क्रेस्ट सेल, सर. देन लंगर खाके, LANGER, लंगर खाके क्या आया? मजा. तो मजे से मीजोडर्म, सर. मजे से क्या हो गया? मीजोडर्म, सर. नाउ दिस keratinocytes, they are present in all the layer. Melano and Merkel, wala, they are present in the basal layer, and Langerhans cell is present in stratum spinosum. They are present in stratum spinosum. Now let's talk about this cell keratinocyte. हॉलमार्क क्या है इसका? केराटिन फिलामेंट एवरी लेयर के अंदर प्रेजेंट होता है, ऑलमोस्ट एवरी लेयर के अंदर प्रेजेंट होता है. Now coming to the melanocyte. Melanocytes are the other cells which are most commonly seen in the stratum basal. Here what is happening? There is a melanocyte which is secreting somme, and somme is making melanin. Now if there is an increase in melanin, the tone will be little dark, and if there is a less melanin, the tone will be more fair, and which will lead to risk of your skin cancers. Now this one melanin unit is having 36 keratinocytes, that is very equal. No matter how much melanin you have increase or decrease, every melanin unit will have a 36 keratinocytes. That means keratinocytes are not responsible for color tone. Then who is responsible? Melanin is responsible. Melanin is Merkel cell, they are type 1 touch receptors. They are having type 1 touch receptor. CK720 positive. Langerhans are having beer bag granule. How the beer bag granule? They look like a rod shape. They look like a tennis racket shape. They look like a rod shape, and they look like a tennis racket shape. They look like a tennis racket shape, sir. Then they are CD207 and 1A positive, sir. The layer, sir. Basal is a first layer to be formed. Spinosum is the thickest layer, and granulosum contain what, sir? Filaggrin. Laminar bodies also they contain filaggrin also. Sir, if there is a deficiency of filaggrin, it will lead to a previous year question that is called as ichthyosis vulgaris. They will lead towards, sir, ichthyosis vulgaris, ichthyosis vulgaris, ichthyosis vulgaris, ichthyosis vulgaris. Now coming on to this winter eczema. As we already told, there are the laminar bodies in this thickest layer. If there is a decrease in laminar body, the moisturizer will go and the skin will be very dry. And this risk factor in the winter is going to be the bath with the hot water. We should avoid. Plus, if there is a less less sun exposure in the winters, so that will also lead to deficiency of vitamin D, and vitamin D is essential for the laminar body. So we will give a supplementation of vitamin D. Along with that, we can advise them the moisturizer. We can advise them the moisturizer. Actinic keratosis, cutaneous horn. Why this is present? Because of radiation exposure is there, UV light exposure is there, pre-malignant condition for squamous cell carcinoma. Then lucidum is a clear cell layer present in palm and sole, and corneum is a topmost layer which lacks the nucleus, and yes, if nucleus is present there, that condition is called as parakeratosis. So before starting a chapter 1, we will ask some questions. Sir, question number 1. Sir, Langerhans cells are derived from. Langerhans cells are derived from. My first question for all of you. Langerhans cells are derived from. Langerhans cells are derived from. Langerhans cells are derived from. Langerhans cells are derived from mesoderm. Sir, winter eczema is happening because of decrease in. Winter eczema is happening because of decrease in. Winter eczema happening because of decrease in. Winter eczema happening because of decrease in. Laminar bodies, sir. Next, sir. If nucleus is present in the topmost layer, what that condition is called as? If nucleus is present in the topmost layer, what that condition is called as? Parakeratosis. Very, very good. Parakeratosis. Very, very good answer. Absolutely correct answer. Maza aa gaya, sir. Let's move on to the very next thing is, sir, blistering disorders. So if we talk about the blistering disorder, first we'll see the blister. Blister is divided into vesicle and bulla. Vesicle is smaller, that is less than 0.5 centimeter, and bulla is more than 0.5 centimeter. Bulla bada hota hai, vesicle chota hota hai. Now we talk about the pemphigus disorder. Pemphigus is an autoimmune disorder where IgG antibodies against the desmoglein, which will lead to blister formation. and this blister can erode, which will lead to crust formation. You can see right here, sir. This pemphigus is divided into two, foliaceous and vulgaris. Sir, foliaceous is like a flower. Flower is number 1 item, that is why desmoglein 1. Vulgaris is like a vulgar, that is desmoglein 3. Desmoglein 3, sir. Then coming, flower is present in grand mass orchid, so granulosum. Vulgaris बातें कहाँ होती है? कांटे की तरह चुपती है, स्पाइनोजम. स्टार्टम स्पाइनोजम. देन फॉलेशियस फ्लावर को ऊपर ऊपर से छूना है, दैट इज बाय सुपरफिशियल बुल्ला. एंड पेम्फिगस वल्गैरिस, देयर इज गोइंग टू बी द डीप बुल्ला. Deep bulla. Now what common signs you are going to see, sir? Sir, common sign, one is tangential force, which is coming like this. One is perpendicular force. If tangential force is coming, there is going to be the Nikolsky sign, and if perpendicular force is coming, there is going to be the bulla spread sign. There is going to be what, sir? Bulla spread sign. Plus you are going to see the row of Tom appearance, which you can very well see here. Direct immunofluorescence study, you will see the fish net like pattern where IgG plus C3 is deposited. C3 is deposited, my dear friends. Treatment with steroid, cyclophosphamide, and rituximab. So what crux we have studied? Pemphigus, foliaceous and vulgaris. There is a IgG antibody against the desmoglein, which will lead to the blister formation. And they are having tendency to get ruptured. Then Nikolsky sign, then Bullard spread sign, then row of Tom appearance is there, then fish net appearance is there. These are some important things we have to study in that. Now bullous pemphigoid. Now what is happening, sir? IgG against BPAG2 gene. Now IgG against BPAG, tense subepidermal bulla is seen, sir. Blisters are present, but Nikolsky sign and row of Tom appearance is absent. Treatment is steroid. But if a linear IgA disease, now antibody IgA is against BPAG2. Like bullous pemphigoid, there was IgG against BPAG2. Here there is a IgA against BPAG2 gene. Here you are going to see what string of pearl appearance. You can very well see string of pearl or bead appearance like this. Sir. And on direct immunofluorescence studies, you are going to see the linear pattern, sir. This is the. Now dermatitis herpetiformis. What is happening? This is associated with the celiac disease where there is a crypt hyperplasia. You can very well see these are the crypt, but in the celiac disease there is a hyperplasia of the crypt. That is why there is a no gap left, sir. No gap. Drug of choice is Dapsone. Plus you have to avoid a gluten-free diet. Plus you have to take a gluten-free diet, and you have to avoid barley, rye, oat wheat. Here is, you can see the crypt hyperplasia has happened, sir. Barley, rye, oat wheat. Now coming to the next one, and next one is going to be what, sir? Your Darier's disease and Halle disease. Both are having calcium ATPase channel defect. In both of them, what will happen? Calcium ATPase channel defect is going to happen. Sir, what involvement is there? Seborrheic area, these are involving the skin fold. What sign you are going to see? Sandpaper-like appearance. In the Darier's disease, what you are going to see? Sandpaper-like appearance. And in the Halle disease, you are going to see brick wall-like appearance. For the Darier disease, where brick wall-like appearance is treatment is oral retinoid, and where Halle disease, there is a brick wall-like appearance, here treatment is diplomovac. Monoclonal antibodies you have to give, sir. Erythema multiforme. Viral infection and drugs can cause that. What lesion you are going to see? You can see right here, sir. Target sign, iris sign, and bull's eye. Target sign, iris lesion, and bull's eye. And this is associated with Lyme disease, where there is going to be the calf muscle congestion, and in eyes there is going to be the suffocation, and coming from the rat urine. Sir. Most common cause here in the epidermic lesion, you will see 10 and Stevens-Johnson's because of the drugs. Now here the important catch is your body surface area involvement. In the toxic epidermal necrolysis, there is a body surface area involving more than 30%, and the Stevens-Johnson syndrome, the body surface area involvement is less than. In both of them, you will see the pseudo-Nikolsky sign. So Nikolsky sign, pemphigus foliaceus and vulgaris, and pseudo Nikolsky sign is seen in the 10 and Stevens-Johnson syndrome. 10 and Stevens-Johnson syndrome. Now erythema nodosum multiforme we have seen. Now it's time to study erythema nodosum and marginatum also. Nodosum, there is an inflammation of a subcutaneous fat. So this is a painful condition, tender, and causes sulfa drug and sarcoidosis. Erythema marginatum, reactive inflammatory condition associated with acute rheumatic fever. If a patient is having a history of acute rheumatic fever, there is a chances you are going to see the serpentine lesion like this. Serpentine like lesion like this. Serpentine lesion like this. Done, 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 done. Then next chapter is infections. Infections. Before that, let me ask you some question. Let me ask you some question. Sir, IgG against desmoglein is seen with. IgG against desmoglein is seen with. IgG against desmoglein is seen with. Pemphigus, pemphigus, pemphigus. Sir, IgA against BPAG2 is seen in. IgA against BPAG2 is seen in. Linear IgA disease. Drug of choice for linear IgA diseases. My next question is drug of choice for linear IgA diseases. Drug of choice for linear IgA diseases. Drug of choice for linear IgA disease is going to be Dapsone. It is going to be Dapsone, Dapsone, Dapsone. Sir, which special things you have to avoid in gluteal hypersensitivity, dermatitis herpetiformis? What diet you are going to avoid? And multiple time asked question in the exam, sir. Sir, it is barley, rye, oat and wheat. Sir, pseudo-Nikolsky sign seen in two conditions. What are those two conditions, sir? Pseudo-Nikolsky sign is seen in two conditions. What are those two conditions, sir? Pseudo-Nikolsky sign is seen in two conditions. What are those two conditions, sir? Sir, Stevens-Johnson syndrome and 10. Toxic epidermal necrolysis. Very, very good. Very, very good. Absolutely correct answer. Now going to the next one, infection. We have studied this erythrasma. Yesterday only we studied the microbiology caused by Corynebacterium minutussimum. And what you are going to see, the velvety appearance, and on Wood's lamp you are going to see the coral red color, sir. Coral. Non-bullous impetigo caused by Streptococcus pyogen. Streptococcus pyogen is gram positive or gram negative? Streptococcus pyogen is gram positive or negative? I taught you well. Sir, gram positive or gram negative? Streptococcus pyogen. Gram positive or negative? Yes, my dear friends, it is gram positive. Cocci, catalase negative, cocci, yes, gram positive. Golden yellow honey color crusting will be there. The child will be giving history of a honey eating. Cellulitis. Sir, cellulitis is caused by both Streptococcus pyogenes and aureus, sir. Pyogenes and aureus, sir. Sir, aureus will lead to two type of endocarditis. Can anyone mention that? Yesterday only we have learned that. Let's revise that also, sir. I told you microbiology is an overlap with your dermatology, sir. Yes, sir, please. Staphylococcus. Sir, here cellulitis, what is happening? Diffuse swelling. Margins, you cannot tell the margins, sir. There will be increase in the inflammation. The cardinal signs like Gruber, tuber, dollar, Keller, functional ratio will be seen right here, sir. Cellulitis. Cellulitis, sir. Sir, what two endocarditis you are going to see, sir? Can anyone guess? IV drug abuser में क्या देखने मिला था? Right sided valve endocarditis, and other type of endocarditis was ट्राई तो करो यार. नेटिव वेल्व एंडोकार्डाइटिस, नेटिव वेल्व एंडोकार्डाइटिस, नेटिव वेल्व एंडोकार्डाइटिस. चलिए, मूविंग ऑन टू द दिस folliculitis, frunculosis and carbuncle. Folliculitis is a superficial infection. Frunculosis is a deep infection of a hair bulb, and if multiple hairs are involved, that is called as carbuncle. Cause can be bacterial, virus, fungal or parasite. Erysipelas, erysipelas, question asked in the exam. Sir, erysipelas is what happening? There is a plastic type of desquamatation is happening on the skin. Puffy swelling is happening on the skin. So who is causing that? Streptococcus pyogenes, affecting the superficial area of the skin. Superficial layer of the skin. Treatment is penicillin per oral or IM penicillin you have to give. Puffy swelling on the face. Red, puffy, plastic type swelling is erysipelas, erysipelas, erysipelas. Okay? Don't ever confuse it with the SLE. SLE is not a puffy swelling. SLE is not a puffy swelling, sir. Then fungal infection like pityriasis versicolor yesterday, some Malassezia globosa, better answer than furfur. If we put this on 10% KOH mount, what appearance we are going to see? Spaghetti and meatball appearance. Spaghetti and meatball appearance. Sir, on Wood's lamp, what we are going to see? Apple yellow color fluorescence. We are going to see apple yellow color. Very, very good. Topical treatment, ketoconazole. Systemic is selenium sulfide. Systemic is selenium sulfide. Selenium sulfide. Now, let's talk about the next condition called as candidiasis. Candidiasis, sir, here is vaginal and oral. So, we'll see whitish discharge coming from the vagina, and oral thrush is going to be caused by Candida albicans. On Saburat dextrose agar, you are going to see creamy postury colonis, plus one phenomena you are going to see. This is Raynaud Brody's phenomena. Raynaud's Brody's phenomena you are going to see, sir. Yes, sir. Drug of choice is fluconazole. Pedra, sir. Black pedra is by Pedra hoti, white is by Trichosporon bijali. Dermatophytosis, a very important topic for your exam, ladies and gentlemen. Sir, here we are having three: tricho, micro and epidermophyton. My dear friends, here the skin, hair and nail involvement we have to check. In the tricho, every part is involved, skin, hair and nail. And also, skin is involved in all. Tricho में तीनों involved है, skin सब में involved है. Micropore से hair निकलते हैं, that is why along with the skin, hairs are involved. What is left? Nail. So skin and nails are involved in epidermophyton. Now this trichophyton is looking like a cylinder shape. Trichophytons are cylinder shape. Microsporon is having SS for spindle shape. You can see spindle shape. And epidermophyton, you have to remember multiple shapes are there. Sir, remember like this, epic people go to club, sitting in a boat, eating pear. So there will be a club shape, boat shape, pear shape. Club shape, boat shape and pear shape. Club shape, boat shape and pear shape. Very good, Shweta. Very good. So trichophyton, microsporon and epidermophyton is clear to all of you. Now Tinea capitis. टीना भाभी कहाँ चढ़ी? सर पे. दो बच्चे हुए इसके. एक का नाम था किरण, जिसके अंदर बोगी स्वेलिंग हुई, और एक का नाम हुआ फेबस, जिसके अंदर पपड़ी बनी. तो ये कीरियन कैसी थी? बोगी स्वेलिंग. और ये फेवस कैसा था? पपड़ी जैसी स्वेलिंग. कैसी थी? पपड़ी जैसी स्वेलिंग. अब टीना भाभी को सर से नीचे उतारना कैसे? घिस के. तो याद रखना, ड्रग ऑफ चॉइस फॉर टीनिया कैपिटिस इज गोइंग टू बी द ग्रिसियोफ्लुविन. इट इज गोइंग टू बी व्हाट, सर? ग्रिसियोफ्लुविन. Now other tenias are like Tinea manus, Pedis, Angizum and Cruris. Tinea manus, Pedis, Angizum and Cruris. Manus is seen in hand, Pedis is in feet, Angizum is in nail, Cruris is. And drug of choice is terbinafine is better answer than itraconazole. It's better answer than the itraconazole. Sporothorax. Canky is causing sporotrichosis, Rose Gardner's disease, draining lymphatic along with the linear nodule along with the draining lymphatic. What is the treatment? Treatment is itraconazole. Chromoblastomycosis, copper penny bodies, sclerotic bodies. Drug of choice is again itraconazole. Mycobacterial infection, two type skin infection. You have to remember like here, sir. One is lupus vulgaris, another is scleroderma. Sir, lupus vulgaris, you are going to see the plaque central scaling is going to see with the inflammation on the side, and on diascopy you are going to see the apple jelly nodule. On the diascopy you are going to see what, sir? Apple jelly nodule, apple jelly nodule. Then scleroderma, most commonly seen in the children with the draining sinus. Draining sinus, you are going to see draining sinus, draining sinus. Leprosy, leprosy. Now different type of leprosis you have to talk about. First of all, Ridley-Jopler's classification, if we talk about TT, BT, BL, BB, LL. Out of this, very important is what, sir, to know that good prognosis is of TT and poor prognosis is of LL. First thing. Second is most common type of India is BT. So here we talk about the BT. BT, you are having a satellite type of lesion. You are having a satellite type of lesion, sir. Satellite lesion. And now this kind of image you are going to see in the LL type having worse prognosis of the leprosy. Then again the leprosy virulence factor is PGL1 and LAM. PGL1 and LAM. Most common cranial nerve involved is facial nerve. Overall most common nerve is ulnar nerve. Most common nerve for biopsy is radial cutaneous nerve, and temperature loss earlier cold more common than the warm, my dear friend. Cold more common than the warm, my dear friends. Now coming to the multibacillary versus paucibacillary. Multibacillary, you will see the lesions are less than 6 and multibacillary lesions are equal to or more than 6 lesions are there. For multibacillary, treatment goes for 12 months and paucibacillary treatment goes for 6 months. And what treatment we are giving in the leprosy patient is RCD, that is rifampicin, clofazimine and dapsone. How much it is given? An adult dose has been asked in the exam multiple time, my dear friends. Yes, number one is rifampicin, 600 mg once a month we will give, sir. Clofazimine 300 mg का एक tablet once a month followed by 50 mg daily, and dapsone is दे देना, then रोज देना है 100 mg daily. 100 mg daily, sir. The rifampicin is 600 mg once a month. Clofazimine is 300 mg का एक tablet followed by 50 mg daily, and dapsone is 100 mg daily. Dapsone is what, sir? Your 100 mg daily. Now lepra reaction, type 1 and type 2 lepra reaction if we have to talk about, sir. Type 1 lepra reaction is associated with type 4 and type 2 is associated with type 3. Total sum would be 5. 4 plus 1, 2 plus 3. Now this is seen in, type 1 is seen in BB, BT देती है बिल भरवा के, तो BB, BT, BL, and type 2 is associated with LL type of leprosy. Sir, clinical feature in the type 1 is pre-existing tender lesion, and in the type 2 is new nodular lesions. Systemic involvement in case of a type 1 is absent, and in the new nodular lesion which is LL type, yes, systemic involvement is present because LL type is having the worst prognosis. Treatment is first NSAIDs because it is a tender lesion, that is why first we'll give NSAID, but drug of choice in both of them would be steroid. So this is pre-existing tender lesion and these are the new nodular lesion in type 1 and type 2 lepra reaction. Type 2, type 1 lepra reaction, type 2, type 1 lepra reaction, lepra reaction. Chalo, some questions and then we'll move forward. Sir. Sir, India में most common type of leprosy is going to be yes, दोनों में तीनों ड्रग रहेगा श्वेता. India में most BT type. Which lesions you are going to see in the BT type? Which lesions you are going to see in the BT type? What all lesions you are going to see in the BT type, sir? What lesions you are going to see in the BT type? Very good. You are going to see the lesion called as satellite type of lesion. Sir, coral red appearance on Wood's lamp examination is because of? Coral red appearance in the Wood's lamp is because of? Coral red appearance in the Wood's lamp is because of? Which disease we are talking about? Erythrasma. Erythrasma. Sir, In the 10% QH mouth, spaghetti meatball appearance is a feature of. Spaghetti meatball appearance is a feature of 10% QH mouth के अंदर. Yes, please. Malassezia, furfur, pityriasis. Pityriasis. Very, very good. Very, very good. चलो आगे बढ़ते हैं. Let's talk about the sexually transmitted infections. You will see right here, sir, easily. Sir, first of all, syphilis. It is caused by Treponema pallidum. There are the 3 stages of syphilis. Can anyone tell me the 3 stages of syphilis? First stage is going to be the painless chancre. Painless chancre. Second, there is going to be the raindrop pigmentation. Third is going to be the gamma formation. And here you will see the syphilis lesion right here, sir. If you will focus here, sir. This is smiling, happy lesion. हंसता हुआ नूरानी चेहरा. कहता है हंसता हुआ नूरानी चेहरा, काली जुल्फे रंग सुनहरा, तेरी जवानी तोबा तोबा, दिलरुबा दिलरुबा दिलरुबा. इसको दर्द नहीं हो रहा इसलिए खुश है. What is the drug of choice right here, sir? Drug of choice is going to be the benzathine penicillin. The drug of choice is going to be, sir, benzathine penicillin. Except neurosyphilis, what will be? Aqueous crystalline penicillin will give, sir. अब आया LGV, lymphogranuloma venerum. Now what is happening right here? Groove sign, and this is caused by chlamydia trachomatis. और यहाँ रहता है LGV stands for लगे रहो. तो कौन लगे रहो? डॉक्टर साहब. तो ड्रग ऑफ चॉइस फॉर डॉक्टर साहब इज डॉक्सीसाइक्लिन. LGV drug of choice is doxycycline, and here you are going to see the groove sign, sir. Here you are going to see what, sir? Groove sign. Now chancroid. Chancroid is a painful ulcer. You can very well see how painful it is and how badly this ulcer is crying. क्या कह रहा है? रो रहा हूँ ना मैं, सुन रही है तू, ला 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 ला. तो कोई रो रहा हो तो उसको चुप कराना है. कैसे चुप कराओगे? अजी चुप हो जाओ. अजी चुप हो जाओ मतलब अजिथ्रोमाइसिन. अजी चुप हो जाओ मतलब अजिथ्रोमाइसिन. एंड दिस इज कॉज्ड बाय द एच डूकरी. दिस इज कॉज्ड बाय द H डूकरी, sir. H डूकरी, sir. Dandana. Now, donovenosis is caused by Klebsiella granulomatosis. What is having? A beefy red ulcers which bleeds on touch. So, donovenosis caused by Klebsiella granulomatosis. Again, here the same problem is there. अब आंसू कैसे आ रहे हैं? खून के आंसू आ रहे हैं. तो रिमेंबर, तो खून के आंसू वाले को भी बोलना है अजी चुप हो जाओ. The drug of choice is going to be azithromycin. The drug of choice is going to be what, sir? Azithromycin. ठीक है, azithromycin. Congenital syphilis, गांधी जी के 3 बंदर क्या क्या? Interstitial keratitis. There will be a peg-shaped teeth and there will be a sensory neural hearing loss. Sir, gonorrhea, Neisseria gonorrhea, purple color, cocci colonis, gram negative. Sir, drug of choice is ceftriaxone. Purulent white discharge is coming right here, sir. Then coming, sir, papulosquamous disorder. Before that, let me ask you some question. Sir, painful ulcer seen in, question number 1, painful ulcer is seen in, chancroid caused by, painful ulcer is seen in chancroid caused by H. Ducrey. Painless ulcer is seen in, that is seen in syphilis caused by Treponema pallidum. Sir, groove sign is seen in, groove sign, sir, groove sign is seen in LGV, sir. Beefy red ulcers which bleed on touch is seen in D से है something, D से. Donovenosis caused by Klebsiella granulomatosis. Very, very good. Sir, Sir, purulent white discharge is seen in. Sir, purulent white discharge is seen in. Purulent white discharge is seen in. Purulent white discharge is a feature of. Yes. Purulent white discharge is feature of. Sir, gonorrhea. Very good, very good, very good. Let's move on to the next, and that is papulosquamous disorder. Number one papulosquamous disorder is going to be the psoriasis. Is going to be the psoriasis, and most common psoriasis, psoriasis vulgaris, which is a plaque psoriasis. Here is a silvery white scaling you are going to see, and after removing this, there is going to be the pinpoint hemorrhage. This is called as Osbert sign, and also the test is called as Grattage test. Grattage test. Grattage test. Now, type of psoriasis, plaque psoriasis, which is the most common type, there is the psoriasis vulgaris. Treatment is steroids. Guttate psoriasis, the history will be of a upper respiratory tract infection and nummular lesions you are going to see on the trunk, my dear friends. Treatment is macrolide. Only psoriasis where antibiotic is given is a guttate psoriasis. Is what, sir? Your guttate psoriasis. Then coming to the pustular psoriasis. The pustules are there, and there is a history of sudden withdrawal of steroid. Sudden withdrawal of steroid, and here treatment is acetate. Inverse psoriasis, again treatment is steroid. These are different type of psoriasis, and treatment we have mentioned about. Treatment summary: if less than 10% of the body surface area is involved, topical steroid, retinoic acid, coal tar we give. More than 10% may we give phototherapy. If no response to phototherapy, the last dose is what's on methotrexate. Methotrexate. Lichen planus, an autoimmune condition. Lacy lesion in the buccal mucosa, nail mein nail pterygium are purple color pruritic lesions you are going to see. Koebner phenomena you are going to see, sir. And Koebner phenomena is also seen in vitiligo, psoriasis and lichen planus, VPL. Vitiligo, psoriasis and lichen planus, sir. Now coming to the pityriasis rosea, herald patch which is arranged in such pattern, this is called as Christmas tree pattern. Usually a self-limiting condition. This condition is a self-limiting condition, my dear friends. And if it is not getting relief, we will use a low dose steroid. We will use a low dose steroids. Now lichen nitidis, you are going to have a typical feature for this. You have to remember, first of all, nodular lesion. If we prepare a slide, a cut slide into this, you will see a, yes, you will see a clutch in ball appearance. You can see a clutch in ball appearance. Chalo. Let's talk about the pigmentary disorders right now, sir. Pigmentary. Number one is melasma. Sir, increase in melanin, and that too in the pregnancy is called as melasma. After pregnancy is called as melasma. What about during pregnancy? It is called as. During pregnancy, जो pregnancy mask आता है, this mask is called as. Can anyone guess the answer? This pregnancy mask is called as. This pregnancy mask is called as colasma. Mr. Techie, very good. Colasma. This is called as colasma. Now, Mongolian spot, just a normal spot, bluish. It can go, can stay, doesn't matter. If it is involving your mukhota, it is called as nevus of ota. If it is involving your body, this is called as nevus of ito. And if along with the ito, there are the hairs present, then this is called as Bacchus nevus. Now coming to the depigmentation because of the toxins secreted by the different products. Now let's see what are the toxin and what is the source. So toxin source is rubber. Rubber से क्या निकलता है? Quinone. Hydroquinone is like a queen. Queen क्या पहनती है? रबर की चप्पल. पति, प्यारा पति. प्यारा ब्यूटानॉल पति. पति के लिए क्या पहनते हो? बिंदी. तो याद रखना, बिंदी से निकलता है प्यारा ब्यूटी फिनॉल. प्यारा ब्यूटी फिनॉल. अब प्यारा ब्यूटी कैटिकॉल. कैट के क्या होते हैं? हेयर, बाल. तो हेयर डाई से निकलता है कैटिकॉल, और फिनॉल निकलता है बिंदी से, और हमारी क्विनॉन, जो हमारा क्विनॉन है रबड़ की चप्पल, दैट इज फ्रॉम द रबड़. सो दीज आर द डिफरेंट important toxins along with their sources. Chikungunya, chick sign, there is a hyperpigmentation is there. Can you tell me which mosquito is causing the chikungunya? Which mosquito is causing the chikungunya? Can you tell me, guys? Which mosquito is causing the chikungunya? Can you answer me question? Which mosquito is causing the chikungunya, sir? The mosquito which is causing the chikungunya is going to be, sir, चिकनगुनिया कौन कॉज कराएगा? नहीं, एडीज, वेब ऑफ किलर, वेरी गुड, एडीज मॉस्किटो, एडीज मॉस्किटो ना यार, वेरी गुड. Acanthosis nigricans associated with metabolic X syndrome. Metabolic X syndrome is associated with PCOS, diabetes mellitus, obesity, hyperpigmentation of the skin will be there, looking like a velvet cake. Now Peutz-Jeghers syndrome, my dear friend, Peutz-Jeghers syndrome, there is going to be the perioral lentigen and also STK11 gene is involved, and there will be a hamartomas polyp in the GIT. STK11 gene and hamartomas polyp, very good. Fixed drug eruption, hyperpigmented patch because of the drug reaction, stop that drug and go some low dose steroid, you are going to fix it. Piebaldism, neural crest cells are dysfunctioning, where you will see a white forelock sign. What is white forelock sign? A patch of skin and hair are depigmented. Vitiligo, we are having segmental vitiligo and other type of vitiligo in which there will be absence of some part of melanin. Freckles increase in melanin and complete absence in melanin leads to albinism. Now last chapter what we are going to stop is skin appendages. Skin appendages, sir, there is going to be the hair, nail and gland we have to talk about. Number one thing is hair cycle. My dear friends, hair cycle, if we talk about anagen, catagen and telogen. Sir, anagen is a growth phase, catagen is an involution phase and telogen is a resting phase. So growth, involution and resting phase. So growth phase is for 3 years, फिर सीधा नीचे आ जाना है 3 weeks and then 3 months. 3 year, 3 week, 3 month. 3 year, 3 week, 3 month. Anagen, catagen, telogen. Anagen, catagen, telogen. ठीक है, चलो. Now androgenic alopecia is because of the faulty testosterone. Now your normal testosterone is converted into 5-dihydrotestosterone with the help of 5-alpha reductase. Because of that, in the male, the pattern coming like this is called as Hamilton pattern, and female 2 patterns are there. One is Ludwig, जो मांग बीच से, and second is, oh my God, side से, that is your Olsen. Olsen is from side and Ludwig is from center. So these are the pattern by which female lost their hair. Topical treatment is minoxidil and systemic is finasteride. Systemic is finasteride. Then coming to the alopecia areata. Alopecia areata, there is going to be the patchy hair loss. Patchy hair loss, this is an autoimmune condition. And also the hair you are going to see right here, sir. Exclamatory mark hair is going to see. Exclamatory mark hair is going to see. Nail की बात करेंगे sir. Nail psoriasis. Nail psoriasis. Again the link is there. The people who are finding difficulty for the PDF, please follow our Telegram channel Conceptual Medicine, my dear friends, for the PDF and all the important information always and always. Chali, sir, nail psoriasis, most characteristic and most common finding. So, sir, most characteristic finding is going to be the oil drop sign, which is also called as salmon patch, and most characteristic is going to be the pitting. Terry nails, congestive heart failure and hepatic failure का feature. Half and half nail, renal failure, paronychia infection of the nail bed and thickening of the nail plate is called as subangular hyperparakeratosis. Hyperkeratosis. Now sweat gland, 2 type, eccrine and apocrine, sir. Eccrine and apocrine. Eccrine is opening directly and apocrine is opening along with the hair follicle. When the duct is opening directly, either there is a hyperhidrosis or anhidrosis. या बहुत ज़्यादा होगा या बहुत कम होगा. तो hyperhidrosis is excessive and hydrosis is no, and this is associated in the children. If it is blocked, then there is going to be a disease, again a previous year topic, malaria, sir. And apocrine, sir, fox body disease, itchy papules are seen like. Acne vulgaris is very important, sir. Most characteristic feature is comedone. Now this comedon is of two type. Open comedon where the dust will settle and because of the dust it will become black. And closed comedons are white in color. Now what are the different stages we are having? Grade 1 is having the comedon. The characteristic feature grade 1 is having the comedon. Grade 2 is having the pustules. Grade 2 is having the pustules. Then grade 3 is having the papules. Sorry, grade 2 is having papule mostly and grade 3 is having pustule. So comedons, papule, pustule and C for char. Char से क्या है? Nodules plus cyst. Nodules plus cyst. Nodule plus cyst. Nodule plus cyst. So comedons, papules, pustule and nodules and cyst. Nodules and cyst. Treatment grade 1 where you will see the comedon treatment is topical retinoid. Grade 2 where you will see the papule, the treatment is topical antibiotics. Where you will see the pustule, grade 3, the treatment is oral antibiotic. And where you will see cyst and nodule, the treatment is going to be the isoterritinoid. Previous year topic of the exam. Grade के हिसाब से treatment पूछा जाता है. Which treatment which we are giving, sir? Now rosacea. What is rosacea? Rosacea is a problem in which a person is feeling flushing after going to the dry areas, hot areas, hot liquids, hot food, and this is something which is self-limiting condition. Rosacea, sir. Miscellaneous topic number 1 is capillary hemangioma. It is present by birth, sir, and this hemangiomas can be present anywhere. Here it is benign tumor. It will be removed with the help of laser later on, sir. Collodion baby. What is happening in the collodion baby, sir? Congenital ichthyosis, where baby born with the plastic-like skin because of the squamatization disorder. Here will keep baby in a warm environment, warm, moist environment. Later on, the squamatization will be corrected and the baby will be fine. But Harlequin baby, Harlequin ichthyosis is having 100% mortality rate and genetic disorder is ABCA12, ABCA12. Now staphylococcal scald system syndrome has been asked recently, my dear friends. Etiology is going to be Staphylococcus aureus. Because of this, there is going to be the plastic-like squamatation and desquamatation happening. Most common age is 3 to 7 days. Blister conjunctivitis you are going to have. Treatment is again because bacterial infection, antibiotics you are going to give. Now the last topic is neurofibromatous type 1 and neurofibromatous type 2. Type 1 is autosomal dominant associated with chromosome number 17. What features you are going to see? Sir, Lish nodule, number 1. Scoliosis, sir, there will be optic glioma. Third, neurofibromas. Yes, sir, there will be a cafe-oleate spot, and Shim's short stature is going to be there. Lish nodule, cafe-oleate spot, optic glioma, then there is going to be scoliosis, short limb. These all are the features of your neurofibroma type 1, neurofibromatous disease type 1, which is on chromosome number 17. Now coming to the NF2, neurofibromatous type 2, this is chromosome number 22 associated with schwannoma, which is the 8th nerve tumor, where we have saw the ice cream in cone appearance. Here you are having a Verrucki bodies. These Verrucki bodies is arranged in a palisading pattern, and here is having a 2 areas. If there is a lot of density of Verrucki bodies, this is called as Antony A area. If there is a less density of a Verrucki body, this is called as Antony B area. Now this again completes our 2 subjects, my dear friends. One is radiology and another is your dermatology. Few questions I will ask and you will answer me, and then we will take a short break and then we'll start from the pediatrics. Question number 1, sir. Sir, neurofibromatous type 1. Can you tell me any 3 features, important 3 features of neurofibromatous type 1, sir? Neurofibromatous type 1, sir. Neurofibromatous type 1, sir. Yes, please keep trying. Cafe-oleate spot, very good. Scoliosis, optic glioma, very, very good. Sir, half and half nails are features of Half and half nails are features of. Very good. Half and half nails are features of. Half and half nails are features of chronic renal failure. Sir, malaria, hyperhidrosis, anhidrosis is apocrine or ecrine sweat gland disorder? Apocrine or ecrine sweat gland disorder? Apocrine or ecrine sweat gland disorder? Sir, ecrine sweat gland disorder. Ecrine. Sir, nail pterygium most common characteristic finding is going to be. Most characteristic finding is going to be. The characteristic finding is going to be lichen planus, lichen palus, lichen palus. Sir, salmon patch and oil drop sign is a feature of. Salmon patch and oil drop sign is a feature of. Salmon patch and oil drop is a feature of nail psoriasis, nail psoriasis, nail psoriasis. So let's take a short break and then start pediatric, or you guys want to continue it till 5 o'clock and then want to take break? All call is yours. We can take a short break of 10 minutes and we can start at 4:20 and then we can go till 5 and finishing this, then we start a obs and gynae. Break. Okay. Let's meet back at 4:20, my dear friends. Just a 10-minute short break. See you all. Welcome back, ladies and gentlemen, to the conceptual medicine and the final aid by the conceptual medicine, my dear friends. Yes, we are back with another subject that is called as pediatrics, and how easily we are going to finish it, you will see it and appreciate. And after pediatrics, we are going to finish the obs and gynae, sir. So let's come back and let's start revising along with me. So number one topic we are going to touch in this is jaundice. So how this jaundice is happening, what this jaundice is, yellowish color of pigmentation in the body, in the urine and the sclera is jaundice. How this is happening, that we will be talking right now, sir. Now let's talk about the pathophysiology behind this. The fetal hemoglobin is breaking into the heme, then heme is breaking into the biliverdin, biliverdin is breaking into the bilirubin, and this bilirubin is your lipid soluble, which is unconjugated. And yesterday in the pharmacology itself I taught you that unconjugated is not going out from the kidney. So if it is not going out from the kidney, so rest of the areas it will go. So your skin and sclera will be yellow in A choleric or P hepatic jaundice, but your urine will be normal. Why? Because this is unconjugated lipid soluble. So normally what happens, initially it is lipid soluble, it is converted into water soluble via enzyme called as UDP gluconyl transferase. This enzyme will convert lipid soluble into water soluble, and if water soluble one is increasing abnormally, it will come in the urine itself also. So skin, sclera and urine, if they are, that means conjugated bilirubin is increased. If only skin and sclera is involved, that means unconjugated is increased. Unconjugated is increased, my dear friends. Yes, unconjugated is increased, my dear friends. So remember, right here, the excretion in the urine, because this is water soluble and there is going to be urine, skin and sclera, all are yellow, The pre-hepatic jaundice where lipid soluble is increasing, unconjugated is increasing. Post-hepatic jaundice is where there is a water soluble is increasing, and along with that water soluble, remember, this is going to be the post-hepatic jaundice, Done. Now, normally what happens, if this is abnormal increase, then it will happen. Normally what will happen, this conjugated come outside from the bile duct, secreted in the bile, then intestine, sarcobilin, yellow brown feces responsible. Who is responsible for the yellow brown feces? Your answer is going to be the stercobilin. Now the jaundice is divided into two. One is physiological and another is what, sir? Your pathological. Now physiological is like a good guest. Good guest is coming late, going early, and pathological is a bad guest which is coming early and going late. How? If a jaundice is coming after 24 hours of the birth and going within 7 to 14 days, this is going to be the physiological jaundice. And my dear friends, if it is coming before 24 hours and staying for more than 7 to 14 days, this is going to be the pathological jaundice. Daily rise in physiological less than 5, daily rise in the pathological more than 5 mg/%. Total bilirubin 15 mg%, less than 15 mg% in the physiological, more it is your more than 15 in the pathological. The treatment in the physiological is going to be the reassurance, and in the pathological, phototherapy is going to convert this pathological jaundice into lumirubin, that is going to be the water soluble form, and that is going to get excreted out from the body. Also you can give the drugs like phenobarbital. So physiological and pathological clears. Now how to clinically assess the amount of bilirubin we are having, that is Kramer's rule, my dear friends. Now Kramer rule, if we have to talk about the head massage is given with the help of 5 fingers. So if it is head involvement is there, depigmentation is there, then 5%. Chest, we will do like this. Chest, this is 10%. Abdomen and thigh, it is 12 to 15%. And then palm and sole, this is going to be the 15 to 20%. So these are the different values clinically you can evaluate to see the level of bilirubin inside the body. Then coming to the next topic is called as neurology. So jaundice is clear to all of you. Can you just give me a thumbs up after the break? So we have talked about the pre-hepatic and post-hepatic jaundice. Done. Pre-hepatic jaundice was Pre-hepatic jaundice was lipid soluble or water soluble? Lipid soluble. Which enzyme was coming to convert it into water soluble? UDP gluconide transferase. Then it was converted into water soluble. Water soluble form, if it is increased, that is post-hepatic jaundice, and if it is lipid soluble is increased, that is called as pre-hepatic jaundice. That is called as what, sir? Pre-hepatic jaundice. Pre-hepatic jaundice. Done, sir. Now neurology, seizure disorder. What is seizure? Increase in electrical activity in the brain is seizure disorder, and along with the electrical activities, motor activities also involved, that is called as convulsions, and more than 2 seizures episode is called as epilepsy, and most common epilepsy we will see with the subtle seizure. We will see with the subtle seizure. We will see the subtle seizure. And most common cause of seizure is was asked in your exam, and that is your SHIE, stands for hypoxic ischemic encephalopathy. Hypoxic ischemic encephalopathy, sir. Now different type of seizure you have to study right here, sir. Absence seizure. How the presentation is going to come? The teacher will be complaining, the school age children is looking up without going unconscious. ऊपर देख रहा आसमान को बिना unconscious हुए. That is going to be the present also. Absence season. Drug of choice less than 2 years is going to be the ethosuximide, and drug of choice more than 2 years is going to be the valproate. Is going to be what, sir? Your valproate. Generalized tonic-clonic seizure. The drug of again choice is valproate. Febrile seizure because of fever. IV, lorazepam, rectal, diazepam, prophylaxis, clobazam. Clobazam. Again दोबारा से sir, IV, Loraza, rectal, diaza, prophylaxis, clobazam. So this is what you need to remember for the absence, GTCS, and the febrile seizure. Febrile seizure. Sir, neural tube defect. What is the most sensitive marker, most specific marker? If you see the most specific, that is your choline esterase. Again, exam question. Most sensitive, if we talk about, sir, that is alpha fetoprotein, sir. Alpha fetoprotein, sir. Alpha fetoprotein, sir. And prevention is done with the help of folic acid. Can you tell me the dose of folic acid? Yesterday also we have learned in the PSM class, sir. Yesterday also we have learned in the PSM class, sir. Sir. Folic acid, sir. Sir, folic acid normally we give 500 mcg. If neural tube defect is already there in the, to prevent it, if already the child has born with that, how much we will give? In that scenario, 4000 mcg. 4000 mcg, 4 gram. बिल्कुल सही बात है अर्चित. Very nice. Very nice here. Very nice. Good answers. Good answers. चल. Now, sir. Different type of neural tube defects we were talking about. Most specific was acetylcholine esterase, and most sensitive is going to be the alpha fetoprotein. Alpha fetoprotein. My dear friends, spina bifida occulta, meningocoele and myelomeningocoele. What are they? You will see right here. The hair and the skin is covering the defect right here. So this is spina bifida occulta. Sir, if your meninges are coming outside, this is meningocoele, and if along with the meninges, if nerve fibers are also coming outside, this is called as myelomeningocoele. Skin और hair ने defect को cover करा तो spina bifida occulta, और अगर आपकी meninges बाहर आई तो meningocoele, और अगर meninges के साथ nerve fiber भी बाहर आए, that is called as myelomeningocoele. That is called as myelomeningocoele, sir. Sir, if brain is absent, yes, brain is absent, this is called as anencephaly. Anencephaly, anencephaly. And sir, if brain is herniating out, this is called as encephalocele. This is called as encephalocele. Encephalocele. Then cranioschisis, rachis we'll see, where brain plus spinal cord is absent, upper part. If lower part is absent, we will call that as rachis. So these are some neurological defects you have to remember for the exam. My dear friend, next is dehydration. The most common cause in Indian dehydration is diarrhea, and most common cause of diarrhea is rotavirus in the children, and in the adult, or you can say after the virus, the cause is E. coli. The cause is E. coli. Now, mild to moderate and severe dehydration. What will happen in that, sir? In the mild to moderate, the child is thirsty. In the severe, the child is drowsy, not expecting to have a water. अगर पानी मांग रहा है पीने को तो mild to moderate, पानी नहीं पी पा रहा, that is going to be the severe dehydration. Sunken eyes can be seen in both. Skin pinch time can be delayed in both. But main is thirsty. Main is thirsty. Now ORS, yesterday also we talk about the sodium and glucose is 75, potassium is like a kela 20, citrate is like a santra 10, bacha hua chloride is 65. Now coming to the treatment of severe dehydration, and the fluid of choice for severe dehydration is Ringer lactate IV. Sir, how much we give for the first 10 kg? First 10 kg it is 100 ml per kg. For the next 10 kg it is going to be the 50 ml per kg. 50 ml. Can you tell me for the 15 kg child how much ml fluid you are going to give? How much ml fluid you are going to give for the 15 kg child, sir? 15 kg child, sir. 15 kg child, sir. How much fluid you are going to give, sir? 50 kg child, sir. How much fluid you are going to give for the 50 kg child? Yes, it is your 15 kg. This is going to be your 1250. अर्चित वेरी गुड 1250. अरे पहले 10 किलो के लिए 1000 हो गया, अगले 5 किलो के लिए 50 mg के हिसाब से 250 हो गया, 1250 हो गया ना. नाउ एज मैटर्स. लेस देन 1 year we will take more time and more than 1 year will take less time, and it is divided into first 30% and 70%, sir. Sir, remember right here, if age is less than 1 year, the first 30% is given in first hour, remaining is given in 5 hours. And half time will be taken for the age more than 1 year. The first 30% of the value will be given in half an hour, and the rest of the 70% of the value is given in remaining 2.5 hour. Remaining 2.5 hour, 3 hours and 6 hours. 3 hours and 6 hours. Why? Well, let's talk about CVS now, sir. Half of it we have covered already in the radiology part, sir. Now fetal circulation, the important things, one-liners we have to rectify for our exam is that blood supply is by 2 umbilical arteries and 1 umbilical vein. Which umbilical vein is left? Left one is left and right one is obliterated. This umbilical artery is carry deoxygenated blood and vein is carrying oxygenated blood. Oxygenated blood. Done, sir. Now coming to the ductus venosus. Ductus venosus किसको दे रही है, सर? Remember right here, sir. Left umbilical vein into the inferior vena cava. Left umbilical vein which is left to the inferior vena cava. Ductus venosus. Now ductus arteriosus, pulmonary artery to the aorta. Pulmonary artery to the aorta. Pulmonary artery to the aorta. Foramen ovale, sir. Right atria to the left atria. Right atria to the left atria, sir. Right to the left atria, sir. Sir. Chali, congenital heart disease we have divided into cyanotic and acyanotic. Sir, acyanotic, the blood is from left side to right side. Left side से right side की तरफ आ रहा है acyanotic में, ठीक है साहब. और cyanotic के अंदर the blood is going from right side to the left side. Right side to the left side. तो right side में अगर हमारा deoxygenated blood है, it will go to left side. There will be a cyanosis. So cyanosis is seen with the left shunt. And acyanotic pink color baby seen with the right shunt. So my dear friends, this acyanotic are 3D diseases. What are 3D? ASD, VSD and PDA. VSD and PDA. Atrial septal defect, ventricular septal defect and patent ductus arteriosus. My dear friends, what type of murmur you are going to see in this? Sir, ASD तोड़ देता है कौन? MSD, महिंदर सिंह धोनी. ASD तोड़ देता, छक्के मार तो यहाँ था मिड सिस्टोलिक. बड़ा ही VSD सब्जेक्ट है, वेरी स्ट्रेसफुल डिजास्टरस सब्जेक्ट, दैट इज योर PSM, पैन सिस्टोलिक मर्मर. दैट इज व्हाट सर? योर पैन सिस्टोलिक मर्मर. एंड PDA इज पढ़ते रहो कैसे? कॉन्टिन्यूअस मर्मर. तो 3 मर्मर्स इन 3 acyanotic disease: ASD, VSD, PDA. ASD is mid systolic and diastolic, VSD is pan systolic murmur, and PDA is continuous murmur. Sir. Then coming to the cyanotic, blue, 5 T's and 2 E's. Then sir, tetralogy of Fallot, transposition of great arteries. The tetralogy of Fallot में कौन सी appearance देखने मिलेगी? Can you tell me which appearance you are going to see in the tetralogy of Fallot? Yes, my dear ladies and gentlemen, which appearance you are going to see in the tetralogy of Fallot? Which appearance you are going to see in the tetralogy? Boot shape. TGA में कौन सी appearance देखने मिलेगी? TGA. Yes, please. TGA में, TGA के अंदर which appearance you are going to see? TGA के अंदर which appearance you are going to see? TGA you are going to see egg on string. TAPVR, TAPVR, shabash, very good. TAPVR, TAPVR, yes, TAPVR, very good. Then this is Tetralogy of Fowler, TGA. Then it is coming to be the tricuspid atresia and truncus arteriosus. Then two E's are there. Epstein anomaly. Which appearance you are going to see in that Epstein anomaly, sir? Epstein anomaly में क्या देखने मिलेगा सर आपको? Epstein anomaly में Epstein anomaly you are going to see box shape, abnormal enlargement in the ventricle, left more than right. Then Eisen-Menger phenomena is abnormal blood flow. Abnormal blood flow. So these are the cyanotic and acyanotic heart disease. Cyanotic and acyanotic heart disease. Now I'll ask you the question which is cyanotic, which is acyanotic. You will answer in the chat box. Sir, my question number 1 is ASD, VSD and PDA. They are cyanotic or acyanotic heart disease? They are cyanotic or acyanotic heart disease? They are cyanotic or acyanotic heart disease? Very good. Sir, tell me the two names in the cyanotic heart disease. At least two names. At least two names in the cyanotic heart disease. Two names in the cyanotic heart disease. TGA, TAPVR, very good. Truncus arteriosus, tricuspid atresia, very, very good, sir. Now, sir, congenital heart disease is diagnosed with the help of a NADA's criteria. So, NADA is having major criteria, NADA is having minor criteria. Sir, major criteria says what? This is again exam question, that is why very important to teach you. Sir, NADA says what? NADA major says there is a systolic murmur grade 3 or more, plus diastolic murmur, plus cyanosis and congestive heart failure. Systolic murmur grade 3 se upar, diastolic murmur, then there is going to be cyanosis along with the congestive heart failure. This is NADA's major criteria to diagnose the congestive heart failure, congenital heart disease. Then, sir, minor criteria says systemic murmur less than grade 3, abnormal second heart sound, abnormal ECG, abnormal chest X-ray and abnormal BP. Abnormal BP. These all are coming under the NADA's minor criteria. Minor criteria. Now my question is, sir, abnormal second heart sound is major criteria or minus criteria? Abnormal second heart sound is major criteria or minor criteria? Abnormal second heart sound is major criteria or minor criteria? Major or minor? Major or minor? जल्दी से. Abnormal chest X-ray, abnormal ECG, second heart sound, systolic murmur, grade 3 से कम. These are part of. Come on. आंसर क्यों नहीं आ रहे तुम लोगों के? This is NADA's minor criteria. अभी तो पढ़ाया तुम्हें. Abnormal second heart sound, ECG, X-ray. These are minor criteria. NADA's minor criteria. Minor. Now, neonatology is the next topic we are going to talk about. So, neonatology, the weight of baby. Remember, the weight at the birth is 2.8 to 3 kgs. 2.8 to 3 kgs. And low birth baby is less than 2.5 kgs. Very low birth weight is less than 1.5 kgs. Very low birth weight is less than 1.5 kgs. Less than 1.5 kgs. Then, sir, head circumference is 35 centimeters. And at the time of birth, your head circumference is greater than chest circumference. But after 1 year, what happens? Your chest circumference is greater than the head circumference. Your chest circumference is greater than the head circumference. And your head circumference, which was 35 centimeter, if it increases by 2 centimeter and become 37, 38, 39, anything, that will be considered as hydrocephalus. 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 Sir, can you tell me? Hydropneumocephalus which sign is seen at audio and radiology? Can you tell me which sign I am talking about? Which sign you are going to see in the hydropneumocephalus? Some mountain was there. This is the biggest hint I can give you all. Some mountain sign was there, sir. The mountain sign was there, sir. That is Mount Fuji sign. Very good. Love you all. Love you all. Love you all. Now, sir, the question is newborn do not shiver and do not sweat. So how it generates heat? So heat is generated by another famous MCQ, that is by lipolysis of the brown fat. Yes, that is by lipolysis of the brown fats, my dear friends, which is present at mostly nape of the neck, my dear friends. Then there will be a hypothermia less than 36.5 degrees Celsius. We call that as hypothermia, and more than 37.5 degrees Celsius called as hyperthermia. The newborn loses heat. How newborn loses it? Conduction, convection and your radiation. Now what is this conduction? Contact with cold surface. जैसे ही ठंडी जगह को छुआ वैसे ही heat loss हुआ. That is called as conduction. कन्वेक्शन क्या होता है? सोर्स ऑफ कूल एयर. ठंडी जगह को छुआ नहीं पर उसके पास खड़े हो तो ठंडी हवा से आपका जो है काम खराब हो रहा है, आपकी हीट जा रही है बाहर. इवेपोरेशन इज लॉस्ट थ्रू द स्किन. ऑल द टाइम इट विल गो लॉस्ट थ्रू द स्किन एंड मोस्ट कॉमन टाइम एट द रेट ऑफ बर्थ. रेडिएशन, जो स्किन एक्सपोज होगी उसी से जाएगा. रेडिएशन इज नॉट इन टच विद द कोल्ड सरफेस. कोल्ड सरफेस के पास ही near but not in touch with the cold surface. कोल्ड सरफेस के पास है बट टच नहीं किया है तो रेडिएशन विच इज ओवरऑल मोस्ट कॉमन. तो आसपास ठंडी चीजें रहती हैं जिसकी वजह से आपका हीट लॉस हर टाइम होता रहे. एक्सपोज एरिया से इवेपोरेशन मोस्ट कॉमन टाइप एट द बर्थ. देन कन्वेक्शन इज ठंडी हवा छूती है उसकी वजह से. कंडक्शन इज कॉन्टैक्ट विद द cold surface. These are the different ways by which examiner can ask you. All of these are following are the ways of heat loss except. So he can give you what's a lipolysis of the brown fat also. That is exclusion. That because that is a generation of heat and this is a losing of the heat, my dear friends. Now coming to another PSM question, NICU. लीकू लेबर रूम की क्वालिटी इंप्रूव कर रहे थे. नीकू की भी क्वालिटी इंप्रूव करने के लिए गवर्नमेंट ने फैसिलिटीज दी. तो नीकू का जो टेम्परेचर है विच इज वेरी इंपॉर्टेंट, नियोनेटल आईसीयू. सर नीकू टेम्परेचर इज 25 to 28 डिग्री सेल्सियस. 25 to 28 डिग्री सेल्सियस. इट शुड बी लिटिल बिट वार्म ओनली. इट शुड बी लिटिल बिट वार्म ओनली. आई थिंक स्टक्ड. No, it's fine. Done. Okay. Then coming to the kangaroo mother care, sir. Important topic again. Kangaroo mother care. Indication to start less than 37 weeks or weight less than 2.5 kg. या तो बच्चे का वजन less than 37 week होगा या तो weight less than 2.5 kg होगा. When to stop? How to do it? Stopping is weight more than 2.5 kg हो जाए या फिर the age of the baby should be more than 37 weeks. And how it is given? Skin to skin contact to the baby is given so that mother heat can be given to the newborn baby. Mother heat can be given to the newborn baby, sir. Newborn baby, sir. Now, sequence of puberty in girls and boys. What is first coming, then boys? Sir, remember, girls के अंदर the first coming is thilar. That is increase in breast bud size. Last is menarche. Boys, first is testicular growth and last is beard or sperm arc. Best method for the growth assessment in child. कैसे पता चलेगा बच्चा अच्छे से ग्रो कर रहा है कि नहीं? So remember, weight for height. How the weight increases? In the first 5-month weight doubles, 1 year triples, 2 year it become 4 times. Very easy, sir. Again, 2.8 to 3 kgs. Sir, in the 5-month it doubles, 1 year it triples, 2 years it become 4 times. So when your weight is becoming 4 times, it is in the 2 years. When your weight is becoming 3 times, 1 year. When your weight is becoming double, that is your 5 month. That is your 5 month. 5 term. Done. Then coming to the length. Okay. चलो, then coming to the length, sir. At birth the length is 50 centimeter. कल फोरेंसिक में भी पढ़ाया था सर. रूल ऑफ हाथ से पढ़ा था हमने. जैसे 2 to the 4, 3 3 the 9, फिर 5 7 the 35, 8 5 the 40. 10 मंथ में क्या हो जाता है? 50 सेंटीमीटर. सर 3 month, 9 month and 1 year is important. Firstly, height increases by 10 centimeter, 10 centimeter, 10 centimeter, 10 centimeter. 9 month it will become 70. After 1 year it will become 75. 2 years it will become 90, and after 4 years it will become double. This again is MCQ. When your height is becoming double, so remember after 4 years. When your weight is becoming double, after 5 months, after 5 months, after 5 months, after 5 months. Okay, chali, done. Now coming to the mid-arm circumference. So there is a test called as Bengal test. There is a test called as Bengal test. Bengal test. Bengal test. So Bengal test. Mid arm circumference, we are having a Bengal test. चूड़ियां पहनाते हैं, बोल चूड़ियां, बोल साजना. Then Shakir's tape is there. Arnold classification. Arnold classification. Arnold classification. Arnold classification. Arnold classification, sir. Shakir's tape. Remember, normal, normal, the 3 colors are there: red, yellow and green. So normally more than 12.5, then between 11.5 to 12.5, then this is less than 11.5, then this is less than 11.5, less than 11.5, less than 11.5, less than 11.5. Done, sir? 11.5. Done, sir? So this is arranging of a mid circumference, and degree grading we are red, green and yellow color. Important, asked in the exam previously, sir. Now malnutrition. Malnutrition, sir, based on the duration and based on the severity. Sir, duration में acute and chronic. Acute में the weight is reduced, chronic में height is affected. When the weight is affected is called as wasting. And wasting, how to check? Weight for height, weight for height. And when height is affected, that is called as stunting, that is height for age, height for age. So what is stunting? Height for age. Wasting is W for W, that is weight for height, that is weight for height, weight for height, weight for height, weight for height. Then based on severity, we are having severe malnutrition. So what is severe malnutrition? Bilateral pedal edema, symmetrical first, weight for height less than 3 standard deviation, and height for age. Weight for height is what, sir? Wasting. And height for age is stunting. So wasting, stunting along with the bilateral pedal edema will suggest you of a severe malnutrition. Asked question in your exam. Again, the important topic for next is going to be the Kwashiorkor versus marasmus. Kwashiorkor versus marasmus. The protein deficiency, predominant deficiency in Kwashiorkor is going to be the protein, and marasmus there is going to be the calories. Onset age is 1 to 4 year ka baby, marasmus is less than 1 year, sir. Sir, edema is present in Kwashiorkor. Kwashiorkor ka bachcha is going to have a pot belly, and marasmus bachcha is going to be very thin, sir. Sir, because of a swelling in case of a Kwashiorkor, the muscle wasting is hidden, and because of no swelling in the marasmus, there is going to be the visible muscle wasting. If we talk about the appetite, despite having big belly, appetite is poor, and despite having thin, the appetite is good. When the pot belly is there, the person will be lethargic, and when the pot belly is not there, the person will be alert. Also in the Kwashiorkor, in the hairs, you are going to see the flag sign, my dear friends. Flag sign, my dear. Flag sign, my dear friends. Now this is a Kwashiorkor baby, and this is a marasmus baby. Now some questions I am going to ask you. Please let me know, sir. Sir, predominant deficiency in the Kwashiorkor is going to be. My first question. Predominant deficiency in the Kwashiorkor is going to be. प्रोटीन, वेरी वेरी गुड सर। क्वेश्चन कॉर्स के अंदर व्हाट विल हैपन टू द एपिटाइट, व्हाट विल हैपन टू द एपिटाइट इन द क्वेश्चन कॉर, व्हाट विल हैपन टू द एपिटाइट इन द क्वेश्चन कॉर, what will happen to the appetite in the kwashiorkor? Poor. Which baby is very alert baby sir? Which baby is very alert baby sir? कौन सा वाला baby बहुत ही alert baby होगा? Which is going to be very alert baby sir? Alert baby कौन सा है? Marasmus. Marasmus. Muscle wasting is hidden in. My next question. Muscle wasting is hidden in. 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 Very good. It is kwashiorkor. Flag sign is a feature of, this is flag sign. This question can come in exam. मेरे दिल के अंदर से धड़कन बोल रही है एग्जाम में आ सकता है सर. Be careful sir. Sir, muscle, this flag sign is a feature of kwashiorkor. Very good answers by everyone, sir. Let's talk about the nutrition. Breastfeeding, when you should start as soon as possible. Exclusive breastfeeding should be absolutely for at least 6 months. Then coming to the prolactin reflex is production of the milk, that is called as galactopoiesis, and oxytocin reflex is ejection of milk by galactokinesis. These two are very important, sir. Now cow versus human milk, if we say sir, cow milk is having a protein called as casein and human milk is having a protein called as whey protein. Carbs are more in human milk, it is less in cow milk. Proteins are more in cow milk, less in human milk. Fat is approximately same. Now storage of breast milk is important. In the room temperature you can store it up to 6 to 8 hours. In the refrigerator, it is 24 hours. In the freezer with the minus 20 degree, you can save up to 3 months, up to 3 months. Now, short stature, let's talk about the short stature, sir. Short stature. My dear friends, yes, come back. Physiological and pathological we have divided into. Physiological is familial and constitutional. Overall, most common is going to be the constitutional. My dear friends, here you have to remember something. So, final height and puberty we have to compare. If final height is short and puberty was on time, this is familial delay. Again, I want to say, final height was short despite puberty on time, this is familial delay. Final height is normal despite puberty was delayed is called as constitutional delay. It's called as constitutional delay, sir. Other than that, pathological में stunting, Turner syndrome, Down syndrome. Now we divide this into two, disproportionate and proportionate. What is disproportionate? Where upper segment, lower segment ratio is abnormal for the age, and proportionate means upper segment, lower segment ratio is normal. Now upper segment, lower segment ratio where it is abnormal, so there is a chances in half of the cases when upper segment is larger and there is a chances when lower segment is larger. So when upper segment ratio is larger, my dear friends, there is going to be the short limbs. There is going to be the short limbs, my dear friends. And lower segment we are having short trunk. So what conditions we are having with the short limbs but the trunk is normal? Achondroplasia. Yesterday also in the orthopedics we have studied about the achondroplasia. Can you give me the input about the achondroplasia? What sign you are going to see on the X-ray pelvis, sir? X-ray pelvis, which sign you are going to see? Then rickets and congenital hypothyroidism. These are for the disproportionate of upper segment greater than the lower segment, then lower segment greater than the upper segment. There will be a problem in the vertebra. So there can be a TB. In TB, you are going to see the port spine. Port spine vertebra. Vertebral abnormalities like hyposis, lordosis, these kind of things can there. And a fusion of spine can ankylosing spondylitis can happen. Then there will be a spondoepiphyseal dysplasia. Spondyloepiphyseal dysplasia. Very good, sir. Very good, sir. Very good, sir. So this is upper proportionate and lower proportionate. Done. Overall, most common type of short stature is constitutional. Most common pathological is malnutrition. And upper segment, lower segment ratio at the time of birth is 1.7:1. After 2 years, it will become 1.5:1, and after 7 to 10 years, it will become 1:1, 1:1, 1:1. Done, done, done. Sir, fetus pass urine by first 24 hours, and fetus pass meconium by 24 to 48 hour. 24 to 48 hour. 48 hour. Now, primitive neonatal reflexes which are present by birth, but they disappear after the birth. Now, rootling reflect, where the baby will be going to the area where you are touching the baby like this. Then there will be a sucking reflex. Moment you are giving something to baby, baby starts sucking. Then there will be Mouros reflex, in which the hand and the mouth will be like this. Then one more reflex is there, which is not primitive reflex. It comes after 7 to 10 months after the birth, and that is called as. Congratulations, Dr. Vicky. Very nice. Very nice. Congratulations. Okay. Now, Mouros reflex, that is called as parachute reflex, जिसमें आपके हाथ और पैर दोनों उड़ जाते हैं. That is not a primitive reflex. That is a reflex coming after the birth, and it stays throughout the life. Stays throughout the life. Then parachute reflex, what we were talking about, sir. Done. Apgar score, sir. Apgar score. Apgar. A for appearance. If baby is pink, give 2 marks. If the baby is acrocyanosis, sir, हाथ और पैर क्या है नीले और बॉडी पिंक, गिव 1 marks. Fully blue baby cynos, give 1 marks. ठीक है, sorry, 0 marks. 0, 1 and 2. Now, sir, pulse more than 100, 2 marks. Less than 100 going to be the 1 marks. No pulse, 0 marks. Grimace, cries and pull. You are putting a nasogastric tube and the baby is crying and trying to pull away, 2 marks. Weak cry, 1 marks. No reaction to that, going to be the 0 marks. Activity, full flexion extension is there, 2 marks. Weak flexion is there, 1 marks. No activity, 0 marks. Respiratory efforts, sir, strong cry is there, then give 2 marks. If weak sounds are there, 1 marks. No sound approximately, remember this is going to be the no breathing, 0 marks you are going to give. 0 marks going to give. Can you calculate Apgar score for me? Right here, sir. Sir, baby is pink. Heart rate is 120. Sir, weak response to nasogastric tube. Weak flexion. Strong cry. चलो फटाफट कैलकुलेट करो फटाफट. Strong cry. Weak flexion. Weak response to NG tube. जल्दी से. Baby is pink, फटाफट 2 नंबर. हार्ट रेट 100 से ऊपर है 2 नंबर. वीक ट्यूब रिस्पॉन्स है 1 नंबर. वीक फ्लेक्शन है 1 नंबर. स्ट्रॉन्ग क्राई 2 नंबर. 2, 4, 6, 8. Correct answer is 8. This is how you are going to calculate. The first person to give answer was Rahul Yadav, followed by Bhaivav. Wow, nice. चलो डन हो गया. चलो सर. Now let's talk about and more than 7 is normal baby. More than 7 is what, sir? Normal baby. Normal baby. Now sir, preterm midterm छोड़ो, आओ genetic disorder की तरफ. Let's talk about the next topic, and that is what, sir? Your genetic disorder. So number one thing we are going to discuss here is a trisomy 21. Trisomy 21. Trisomy 21. Sir, most common genetic cause of low IQ is trisomy 21. What special features you are going to see, sir? Abnormal ears. Sir, flat nose, flat face, Simon crease, plus which congenital heart disease is associated with? This is endocardial Cushing defect. Endocardial Cushing defect is the most common congenital heart disease associated with the Down syndrome, which is itself a most common genetic cause of low IQ. Trisomy 21. Trisomy 21. Edward syndrome. E for Edward, E for election. Election कौन से उसमें डालते हो? साल में 18. Trisomy 18. Short neck, sir. Short neck. Overlapping of the fingers. Club foot. Overlapping of the finger. Club foot. Club foot. Club foot होगा तो which splint you are going to give? Can you tell me which splint you are going to give, sir? Which splint you are going to give to such baby? Which splint you are going to give? Dennis Brown splint. डेनिस ब्राउन. कॉन्जेनाइटल टेलिपस इक्वानोवेरिस सुना था ना. पटाऊ, पटाऊ प्यूबर्टी कब आती है? 13 ईयर्स में. तो व्हाट इज गोइंग टू हैपन? क्लेफ्ट लिप, क्लेफ्ट पैलेट, पॉलीडेक्टाइली. Cleft lip, cleft palate and polydactyly, my dear friends. Turner syndrome, 45XO. Sir, this is seen in the females with the normal IQ. 45XO. What is going to happen? There is going to be the webbed neck. There is going to be the broad spread nipples. These are shield chest. Abnormal mensuration with the normal IQ. This will suggest you of a Turner syndrome. This will suggest you of a Turner syndrome. Noonan syndrome, pseudo-Turner, can be in the male, can be in the female, and IQ is less. Rest features like undistended testes, triangular faces will be there in the Noonan syndrome. Klinefelter syndrome. Klinefelter syndrome is 47XXY. Sir, टांगे लंबी लंबी, long leg, hair absent, axillary and pubic hair. Axillary pubic hair बिल्कुल absent. Small testes, small penis. Puberty starts at time but progress slow. लंबी टांगे, गोरा चिकना बदन, लंबी height, that is Klinefelter. And under small testis and small penis is hidden gift, that is Klinefelter syndrome. Klinefelter syndrome, sir. Then coming Angelman syndrome. Angel's man is having low IQ because angel is making the man fool. So low IQ, smiling face, and also getting seizures. Chromosome defect on 15q chromosome. 15q chromosome. 15q chromosome, sir. I ask all these 7 chromosomal abnormalities and you guys guess it because one is going to be your exam question, and next we are going to talk about the milestone, my dear friends. My dear friends, number 1 is, sir, most common cause of genetic cause of low IQ. Most common genetic cause of low IQ is going to be, most common genetic cause of low IQ is going to be, sir, Down syndrome. Can you tell me the trisomy in the Down syndrome? Trisomy in the Down syndrome? 21. Very good. Sir, long leg, absent axillary pubic area hairs. Along with that, there will be a short penis and testis, small penis and testis. This is going to be the Klinefelter syndrome. Klinefelter syndrome. Sir, cleft lip, cleft palate, along with the polydactyly. Along with the polydactyly. Along with the polydactyly. We are talking about ऐसे कटेंगे दिन ये दिन. Very good, very good, very good, very good, very, very good. Sir, undistended testis, triangular faces, low IQ, shield chest, webbed neck is a feature of उनको ये पल हर पल. Harshika, very good. Noonan, coffee with scrub, very good. It's Noonan. Pseudo Turner. Sir, a female with the normal IQ having broad spread nipple and a webbed neck. Now your diagnosis. Now your diagnosis. Now your diagnosis. And now your diagnosis. Now how you are going to make, and that is Turner syndrome. That is going to be the Turner syndrome. Let's move on to the next topic called as milestone. Milestone, sir. Milestone, sir. Milestone. Very good. Very good. I'm very happy. Now, sir, milestone. Language milestone. सबसे पहले मोनोसिलेबस. मोनोसिलेबस क्या होता है? माँ, बा. 9 मंथ में क्या बोलता है? बाइसिलेबस. मामा, बाबा, बाबू. 1 ईयर में बोलता है 2 से 3 वर्ड. आई लव यू. 2 साल में क्या बोलता है? पूरी कहानी, सॉरी सेंटेंस बोलता है. आई लव यू फ्रॉम डे 1 ऑफ कॉलेज. देन 4 साल के बाद पूरी कहानी. I love you from moon and back, this, that, we went there, we did this, that, I can't live without you, this. So this is storytelling. The storytelling is 4 years. Sentence is 2 years. 2 to 3 words is 1 year. Bisyllabus is 9 months. Single syllabus is your 6 month. Done and dusted. Social milestone. Social smile. It comes in 1.5 month. Can we take that as 6 weeks? Yes. S for 6, X for smile. S for smile. Recognize mother. माता जी को पहचानता है 3 महीने में. ठीक है साहब. Then mirror smile 6 month. Social smile 6 weeks. Mirror smile 6 month. Mirror smile 6 month. बाय बाय. मम्मा के यूट्रस को कब बाय बोलते हो? 9 महीने में. तो बच्चा बाय बाय करना भी कब शुरू करता है? 9 महीने. 9 महीने में जो दिखा, चाची दिखी बाय, मौसी दिखी बाय, मामू दिखा बाय, अंकल दिखा बाय, मोहल्ले वाले बाय, गांव वाले बाय, शहर वाले बाय, इंडिया वाले बाय, रशिया वाले हाय. चलो डन. So this is bye bye is 9 month. Bye bye is what sir? 9 month. 9 month. 9 month. ठीक है. चलो. Peekaboo game. Peekaboo game. Peekaboo game. ठीक है. Peekaboo game 10 to 12 month. मोची छुप गई, मोची आ गई. So this is called as peekaboo game. 10 से 12 महीने में खेलने लग जाता है. स्ट्रेंजर कहाँ रहता है सर? 7 समंदर पार. तो 7 month. एंग्जाइटी क्या है? 7 month. स्ट्रेंजर. सेपरेशन. Sir, 14th day of February is what sir? Your Valentine Day. और Valentine Day वाले दिन क्या होता है? प्यार होता है. और अगले दिन क्या हो जाती है? 4 दिना दा प्यार और रब्बा बड़ी लंबी जुदाई, लंबी जुदाई. ओ चलो याद रखिएगा. सेपरेशन एंजाइटी इज 15 month is 15 month. Sir, color gender name is 3 year. Color gender name is 3 year. Color gender name is 3 year. Then कपड़े खोलना कब शुरू करता है बच्चा? 2 साल में. पहनने कब लग जाता है? 3 साल में. बाएं हाथ से कि दाएं हाथ से लिखेगा? that is 4. बावल कंट्रोल पहले आता है 4 साल में. ब्लैडर कंट्रोल is coming at 5 year. Is coming at 5 year. Sir, then coming to the fine motor milestone. सर बाइडेक्स्ट्रस अप्रोच 4 मंथ. ट्रांसफर करना शुरू करेगा चीज़ों को. ऐसे मैंने कब पकड़ लिया इधर से इधर ट्रांसफर 5 मंथ. एक हाथ से पकड़ना शुरू करूँगा 6 मंथ. अल्नर ग्रास 7 एंड रेडियल ग्रास 8. इमेच्योर पिंसर ग्रास 9 एंड मेच्योर पिंसर ग्रास एट 12 month. At 12 month. At 12 month. Then sir cup without spill at 15 and spoon without spill at 18 month. लाइन कब ड्रॉ करेगा? 2 साल में. सर्कल 3 साल में. स्क्वायर या प्लस 4 में. एंड ट्राइंगल 5 में. हेक्सागन 6 साल में. हेक्सागन 6 साल में. देन ग्रॉस मोटर माइलस्टोन माय डियर फ्रेंड्स. ग्रॉस मोटर माइलस्टोन सपोर्ट एंड विदाउट सपोर्ट. सपोर्ट एंड विदाउट सपोर्ट. इफ अ बेबी इज सिटिंग विद सपोर्ट दिस इज 5 month and without support is 8 month. Standing with support 9 is looking like a stick and we are taking the advantage of stick right here. Stand with support is 9 month. Without support 12 month is also 1 year. It is 1 year. Walking is 12 month to 13 month and walk without support is 13 to 15. Running is 18 month. Climbing, jumping is 2. Climbing, jump and climb stair 2. Skipping, climbing and jumping stair with hand 2 साल में हाथों से चढ़ने लग जाता है. 4 साल में स्किपिंग एंड जंपिंग फ्लोर ऑन द इंडिविजुअल फुट. नाउ सम क्वेश्चंस एंड देन वी आर मूविंग ऑन टू द नेक्स्ट सब्जेक्ट कॉल्ड एज ऑब्स एंड गायनी. सो माय डियर फ्रेंड्स लेट्स मी आस्क यू सम क्वेश्चन फ्रॉम द मोटर माइलस्टोन. सर बाय बाय कब बोला बच्चे ने? लुट गए सारे नजारे वो क्यों. वेरी गुड सर. सेपरेशन एंजाइटी. सेपरेशन एंजाइटी. सेपरेशन एंजाइटी. सेपरेशन एंजाइटी 15 month. सर रिकॉग्नाइज मदर. रिकॉग्नाइज मदर. रिकॉग्नाइज मदर. 3 months. Very good. Sir, mature pincer. Mature pincer. Mature pincer. 12 months. Very nice. Sir, stand without support. 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 Sir, peek a bow game. Peek a bow game. Peek a bow game. Peek a bow game. Peekaboo game. Very, very nice. Very, very nice. Very, very nice. Chaliye, let's talk about the very next subject now. That is your gynecology. We have successfully completed pedia today. Okay, we will start this gynae class at 5:20. 5:20. Break. 5:20. Just after 9 minutes, we'll start the gynae class. Welcome, ladies and gentlemen, to the final aid by the conceptual medicine, and welcome back with the biggest subject, gynecology. This subject will take approximately 1.5 hours to complete. We'll be increasing little speed to complete it down, and all important previous year topic along with the important topic we are going to cover. And for PDF, please follow our Telegram channel, that is your conceptual medicine, and do subscribe our YouTube channel. And also, if you want to reach out me, you can reach out me on my Instagram, that is pjamwal7. Okay, I'll be waiting for the queries, and also after passing a good news also I'll be waiting for from all of you. My dear friends, now we talk about the menstrual cycle at the first go, how it is starting, what is positive feedback, what is negative feedback, all those things are very, very important. So right here, if you see, the hypothalamus is the first thing which is secreting the GnRH, gonadotropin releasing hormone. This is acting on the anterior pituitary. So hypothalamus, pituitary and ovarian axis, it is called as. How they are coordinated, the important thing is this: hypothalamus secreting something which is going to the anterior pituitary, and they are secreting the FSH. The FSH is acting on the ovarian granulosa cells, sir. Ovarian granulosa cells, sir. This ovarian granulosa cells are producing the estrogen, which are helping in what, sir? Proliferation. It helps in the proliferation. Now the estrogen level, if increasing this value, that is more than 150 to 200 picogram, it will give you a feedback, and that feedback is called as positive feedback, and it is sent to what, sir? Your LH, luteinizing hormone. This LH and FSH is secreted by pituitary gland, and this LH is becoming high now. After estrogen was high, now LH is high, and peak of LH is coming on day 14th, which is the day of ovulation. When the day of ovulation has happened, there will be a corpus luteum, and this corpus luteum will start secreting the progesterone. And sir, if progesterone level is more than 3 milligram per ml, then it gives the negative feedback. So your progesterone is giving the negative feedback, and estrogen is giving the positive feedback. It is giving the positive feedback. So estrogen is there. Estrogen ke baad mein what is happening? LH is coming. LH is getting surged on the day 14. Ovulation is happening. Corpus luteum is coming. Corpus luteum is giving us what, sir? Your progesterone. And the function of progesterone is to make the uterus more secretory. Now what will happen after the negative feedback? The LH start decreasing, and LH start decreasing, the corpus luteum also start degenerating, because LH and corpus luteum, they both are bhai. So they start decreasing, the progesterone level falls, the secretion which are made in the proliferative area, that also decreases. So there will be endometrial shredding. There will be what, sir? Your endometrial shredding. So this is whole summary of a menstrual cycle. Important thing is, this is asked in the exam. They have asked, this is day 14, which surge you are going to say? You are going to say LH surge. LH surge se pehle kiska aata hai? Estrogen ka. Estrogen is sending which feedback? Your answer is positive feedback. After that LH surge, which surge is going to happen? Progesterone surge. Which feedback progesterone is sending? It is sending the negative feedback. Just 3 to 4 points in this. If you remember, the question are asked from this area only. Then coming to the follicular growth, how this grow? 2 mm per day to 14 mm, then 18 to 22 mm, we call that as a mature follicle, and out of this, which is called as captain follicle. So remember, 14 mm size will be called as a captain follicle. These are again a one-liners. LH peak is coming 10 to 12 hours before the ovulation, and LH required, the minimum LH required for the ovulation is 75 milligram per ml. Minimum estrogen required for LH surge is 200 picogram. तो 200 estrogen होगा तो वो LH की सर्च कराएगा 75 तक. 75 LH आगे जाके ओवुलेशन कराएगा, वहां से फिर आएगा कॉर्पस ल्यूटियम हमें देगा प्रोजेस्टेरॉन, वहां से LH से चला जाएगा नेगेटिव फीडबैक. ये नेगेटिव फीडबैक जाने के बाद हमारा LH कम होएगा, प्रोजेस्टेरॉन कम होएगा, एंडोमेट्रियल श्रेडिंग विल हैपन. डन एंड डस्टेड. Now, what is Mittelschmer's pain? This Mittelschmer's pain and Mittelschmer's blood. Pain is a mid-cycle pain. Whenever there is about to ovulation happen, there is a physiological pain and there is a no pathology. That is why we do a USG, we find it is a normal, so we do a reassurance, that is a no need to have any treatment. Then on the other hand, we are having Mittelschmer's blood. It is a mid-cycle blotting, where it is pouch of Douglas is having a mid-cycle blotting from there. If USG done, no nothing has happened in the USG, no pelvic pathology, then treatment is reassurance. So for Mittelschmerz pain and Mittelschmerz blood, the treatment is reassurance, reassurance and reassurance, my dear friends. Then coming on to the next, how to calculate the day of ovulation. For example, your cycle is of a 35 days, always minus 14. For example, your cycle is of a 30 days, always minus 14. For example, your cycle is of 40 days, always minus 14. Whatever the day is coming, that is called as day of ovulation. Now, my dear friends, the question is, what is a normal cycle length? What is a normal cycle length? On an average, it is 21 to 35 days. And on an average, it is 28 days, and average blood loss in each cycle is 5 to 80 ml, 5 to 80 ml, and normal duration is 2 to 7 days. This is again a controversial. Somewhere it is written 20 to 80, somewhere 5 to 80, है ना? 20 to 80. Somewhere it is 50 to 80, not 5. Oh, sorry. It is 50 to 80 ml. 52, somewhere it is written 20 to 80 ml also, depends on the books. So let it be. Abnormalities regarded to the menstruation. Sir, abnormalities regarded to the menstruation. What is oligo? Oh, delayed menses. Oligomenorrhea is what, sir? Delayed menses. And what is a normal duration was 21 to 35 days. Now it is more than 35 days. The most common cause of PCOD. PCOD. Delayed menses, it is PCOD. Then poly, मतलब पहले आ गया, that is going to be the early menses, less than 21 days, less than polymenorrhea is पहले ही आ गया, that is less than 21 days. क्यों आया पहले? P for P, that is PID. Oligo बाद में आया, O for O, PCOD. Polymenorrhea पहले आ गया, that is PID, sir. That is good, sir, PID. Then coming menorrhagia, मन भर के साइकिल आए. कैसे साइकिल आए, सर? मन भर के साइकिल आगे, भर के आगे because of a uterine fibroid, sir. Uterine fibroid मतलब 80 ml से ज़्यादा blood loss हुआ, या फिर more than 7 days तक साइकिल आए, more than 7 days. Metrorrhagia, sir, metrorrhagia. Metro is sometime up, sometime under the ground. So irregular metro is there. So metrorrhagia is an irregular cycle. What is the most common cause of irregular cycle? This is DUB, that is dysfunctional uterine bleeding. What is DUB? That is organic without organic pelvic pathology. Now what is AUB? With organic pelvic pathology. If no organic pelvic pathology and there will be irregular menses, then it is DUB. With organic pelvic pathology, this is called as AUB. This is called as AUB. Now this AUV is defined with the help of a classification called as palm coin classification. A very important classification for your exam, palm coin classification. My friend, number 1 is P. P for polyp. Along with me, please keep on saying and writing in the chat box, my dear friends. Yes, on the 17th of January 2026, you all are going to pass this exam. So be there with me for another 1.5 hours and we are going to complete gynecology and obstetrics. Now my dear, A for adenomyosis. L for leiomyoma, which is called as fibroid. M for malignancy, C for coagulation disorder. O for ovulatory disorder, endometrial disorders, iatrogenic and not yet got it. So palm coin classification is for AUV, AU with pelvic pathology. DUV is without pelvic pathology, done and dusted. Now another problem is hypomenorrhea. We have studied about the delayed menses, early menses, man bhar ke menorrhagia menses, irregular menses. Now says hypomenorrhea, less menses, less than 5 ml, or you can say 20 ml or less than 2 days of bleeding. It is because of Asherman syndrome. Now what is happening in the Asherman syndrome? There is an intrauterine fibrotic bands are present. Because of these bands, the proliferation is what, sir? Prohibited. It is inhibited right there. Because of less proliferation, less menses are coming. So Asherman syndrome is a cause for the hypomenorrhea. It's a cause for the hypomenorrhea, sir. Now primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea means pain during the menses. Drug of choice is mefenamic acid. Secondary dysmenorrhea, the most common cause is endometriosis. What do you mean by endometriosis? Sir, presence of active endometrial tissue, जिसको कहाँ होना चाहिए था? Uterus के अंदर. Now is present somewhere else, that is called as endometriosis. Secondary Dysmenorrhea का causes endometriosis, there will be a pain. So now the next term is amenorrhea. Now the next term is amenorrhea. Amenorrhea मतलब absence of menses, sir. Absence of menses, sir. Number one is what, sir? Your physiological, and number second is pathological. Physiological and pathological, my dear friends. In pregnancy, it is due to the beta HCG. In lactation, it is due to the prolactin. तो प्रेगनेंसी में क्यों नहीं आते मेंसेस? बिकॉज ऑफ बीटा एचसीजी लेवल्स आर हाई, दे डबल्स बाय 48 आवर्स, है ना? वो सारी वैल्यूज विल आर गोइंग टू स्टडी अबाउट दैट. लैक्टेशन में इट इज ड्यू टू द प्रोलैक्टिन. इट इज ड्यू टू द प्रोलैक्टिन. नाउ माय सम क्वेश्चंस एंड देन विल टॉक इन डिटेल अबाउट दिस. सर, excessive menses are called as, sir, my first question for all of you, excessive menses are called as, excessive menses are called as, excessive menses are called as menorrhagia. Can you tell me what is the cause of menorrhagia? Can you tell me what is the cause of menorrhagia? Cause of menorrhagia. Cause of menorrhagia is fibroid. Sir, irregular menses is called as. Sir, my next question is, irregular menses is called as. Irregular menses को क्या बोलते हैं? What irregular menses are called as? Irregular menses are called as. Irregular menses are called as metrorrhagia. And here we are having two causes. What were those? One without organic pelvic pathology and one with organic pelvic pathology. One without organic pelvic pathology, one with organic pelvic pathology. DUV and AUV. DUV and AUV. Sir, delayed menses is called as. Sir, delayed menses is called as. Delayed menses is called as. Delayed menses is called as. Delayed menses is called as oligo. And oligo का cause क्या है sir? Oligo का cause क्या है sir? What is the cause of oligo? What is the cause of oligo? PCOD. Very, very nice. Now let's talk about this thing, sir. Primary pathological and secondary pathological. Primary pathological का मतलब है she never mensurated, मतलब some kind of anatomical defect is there. Now secondary pathological is she was mensurating normally before, but from the past 3 cycles she is not able to because of the HPO axis dysfunction. Because of the HPO axis dysfunction, that is hypothalamus, pituitary and the ovarian axis dysfunctions. Now let's talk about the different pathologies, what they talk about the primary pathological. So we have to check at the certain level. We will check at the endometrium level, we will check at the ovarian level, pituitary level and the hypothalamus level. These are initial 4 levels where we will checking ki problem kya hai primary pathological ka, primary kya hai secondary pathological ka sir. Let's talk about the primary pathological at the endometrium level. So endometrium level पे सबसे पहली problem क्या हो सकती है? Namaste, Dr. Shiv Kumar. Dr. Shiv Kumar is passed out student and doing internship near the Goa. May God bless you always. Keep growing. चलो Mullerian agenesis की बात करते हैं. Let's talk about the Mullerian agenesis. Mullerian agenesis. Mullerian agenesis के अंदर क्या होता है? Mullerian duct is absent and Mullerian is mulayam, making female organs like cervix बनाया, uterus बनाया, बनाई fallopian tube. और बनाना भूल गया वजाइना का नीचे वाला लूप. सो रिमेंबर अपर पार्ट ऑफ द वजाइना, अपर पार्ट ऑफ द वजाइना, सर अपर पार्ट ऑफ द वजाइना इज मेड बाय Mullerian duct. So these structures are absent. These structures are absent. Sir, cervix, uterus, fallopian tube and upper part of the vagina is absent. Then tell me who is making the lower part of vagina? Who is making the lower part of vagina? That is urogenital sinus. Urogenital sinus. Urogenital sinus. Very good. Now sir, what is happening right here? These structures are absent. So your ovary is normal because ovary is not made by Mullerian duct. So she can have her own baby but with the help of IVF. In vitro fertilization. सर क्या हुआ सर्विक्स नहीं है, क्या हुआ यूट्रस नहीं है, अंडा तो बन रहा है, तो आईवीएफ की मदद से बच्चा पैदा हो सकता है. एचपीओ एक्सेस नॉर्मल है तो सेकेंडरी सेक्सुअल कैरेक्टर भी इसके क्या होंगे, नॉर्मल होंगे. Now one syndrome which is associated with it is Mayer-Rokitansky-Kuster-Hauser syndrome. इसके अंदर Mullerian agenesis के साथ renal abnormalities. What renal abnormality? Horseshoe kidney. क्या होगा? Horseshoe kidney. Along with that, spinal abnormality. What is spinal abnormality? That is your spina bifida occulta. Spina bifida occulta. Spina bifida occulta, sir. Sir, this is Mullerian agenesis. Is the first reason for the primary pathological. Then coming to the second reason is testicular feminization syndrome or androgen insensitivity syndrome. Sir, external genitalia is of a male and secondary sexual characteristics are like female, mistaken as external genitalia is of a female and mistaken as a female child at birth, but the karyotyping is 46XY. Here the karyotyping is 46XX. Plus secondary sexual characteristics are present. मतलब pubic areas पे, axillary area पे hairs will be present, sir. And here you will see no hair you will see. So two type of diagnosis you can make right now. What two type of diagnosis? One is clinical diagnosis. If your axillary hairs are absent, you will make a diagnosis of testicular feminization syndrome. If axillary hairs are present, you will talk about the Mullerian genesis, because we have learned in the Mullerian genesis, secondary sexual characteristics are present. And best method is karyotyping. If you will see, maybe external genitalia is of a female, but inside chromosome 46XY is present in case of testicular feminization syndrome. And in case of Mullerian agenesis, 46XX is present, sir. 46XX is present, sir. So this is a basic difference between the Mullerian agenesis and the testicular feminization syndrome. Testicular feminization syndrome, my dear friends. You understood that the concept behind this testicular feminization and the Mullerian agenesis. Okay? Now coming at the ovarian level, the number one reason is Turner syndrome. Streaky ovaries are present, my dear friends. Short stature, streaky ovaries were found in girls, low IQ, webbed chest, webbed neck, shield chest. These all are feature of a Turner syndrome. Here you can give a treatment like estrogen and progesterone. Just a hormonal supplementation you will give and the patient will have a better prognosis. Pure gonadal dysgenesis. Now sir, some part of X बन रहा था, X का थोड़ा सा part नहीं बना, थोड़ा part defaulty हो गया. Height was normal, but some part of the X was not formed. उसकी वजह से दिक्कत आ रही है, तो याद रखना estrogen प्रोजेस्टेरोन दे दीजिए, estrogen प्लस प्रोजेस्टेरोन दे दीजिए. ठीक है, चलो. Rest is normal, Abdullah. Sware syndrome. External genitalia is of a male, karyotyping is of a male, but गलती से मुलेरियन डेक्ट अंदर डेवलप हो गई. भाई कैरियोटाइपिंग भी आदमी की थी, बाहर से जेनेटिलिया भी आदमी का था, बट जो यूरोजेनाइटली सिस्टम अंदर का था वो सारा फीमेल का डेवलप हुआ. इंटरनल ऑर्गन्स आर ऑफ फीमेल. तो यूट्रस बनाया, ओवरी नहीं बनाई, यूट्रस बनाया, वजाना बनाया, बनाई फेलोपियन ट्यूब, तो ये सारा कुछ अंदर बन गया. ठीक है, सो दिस इज कॉल्ड एज स्वायर सिंड्रोम. वजाइनोप्लास्टी करा दो इसको. ठीक है, डिस्पाइट ये आदमी के क्रोमोसोम लेके घूम रहा है, बट फॉर द मैरिज डू द वजाइनोप्लास्टी प्लस ऑर्किडेक्टमी एज सून एज पॉसिबल, अदरवाइज इट विल लीड टू द ट्यूमर. Now we went to the pituitary level. Pituitary said craniopharyngioma. There is a tumor of a pituitary which releases prolactin, and because of prolactin there is going to be the absence of menses, and for that drug of choice is cabergoline and definitive management is surgery. Then coming to the hypothalamus level, Kallmann syndrome. There is a mutation in the Kal1 gene. Infertility with anosmia will be there. यहाँ पे क्या देना, पल्सल्टाइल GnRH. दो तरीके से GnRH दिया जाता है, continuous to suppress the hypothalamus and pulsatile to increase the activity. यहाँ पे we need to increase the activity of hypothalamus. That is why we are giving the pulsatile GnRH. This was all about the primary pathological. Let's revise the primary pathological at the endometrium level. What reasons we got? Number one reason at the endometrium level in the primary endometrium level, the primary reason we got was what, sir? Mullerian agenesis. Mullerian agenesis. Second reason because of testicular feminization syndrome, sir. Both of them were separated secondary sexual characters present. Here it was absent. Here it was absent, sir. Secondary sexual characteristics were absent, sir. Then we went on to the endometrial level is clear. Then ovary level, sir. Ovary pe 3 reasons were there. One is Turner. One is pure gonadal dysgenesis. Another is Swyer syndrome. Another is Swyer syndrome. Swyer syndrome में बाहर से भी मेल का था, अंदर कैरियोटाइपिंग भी XY थी, बट मुलेरियन डक्ट की वजह से अंदर के पार्ट सारे क्या हो गए थे, फीमेल के. अंदर सारे पार्ट क्या हो गए थे, फीमेल के हो गए थे, सर. देन कमिंग टू द पिट्यूटरी. पिट्यूटरी के पास क्या हो रखा था, सर, क्रेनियोफ्रेंजियोमा. एंड फिर गए सर हाइपोथैलेमस के पास, क्या हो रखा था सर वहाँ पे, कार्लमैन syndrome. So all the reasons for the primary pathological we have summarized right now, sir. Now coming on to the secondary pathological. Everything is clear to all my dear friends who are watching live there with me, sir. ये समझ में आएगा primary pathological and secondary pathological का फंडा यहाँ पे, ठीक है? Absolutely correct. चलिए, let's move on to the next. Move on to the next is secondary pathological. What does this secondary pathological means? Sir, secondary pathological means she was earlier menstruating, but some problem has occurred that she is not able to menstruate from the past 3 cycles. My dear friends, first is Asherman syndrome. And we know at the endometrial level, what is Asherman syndrome? Fibrous bands are present, hysteroscopic removal done. Ovarian level, PCOS. Pituitary level, pituitary tumor, Sheehan syndrome. Sir, what is this Sheehan syndrome? Postpartum necrosis of the anterior pituitary due to the PPH. Chalo. What is the treatment to this Sheehan syndrome? Substitution of all hormones. Hypothalamus due to excessive weight loss and stress, there is no menses coming on. PCOS की वजह से नहीं आ सकते, शीहान सिंड्रोम की वजह से नहीं आ सकते, एशरमैन सिंड्रोम की वजह से आ सकते. So these are the causes of what, sir, your secondary pathological. Now I ask you question, you will tell me it is primary pathological or secondary pathological. Sir, Asherman is an example of primary pathological or secondary pathological. Primary pathological or secondary pathological. Primary pathological or secondary pathological? Very good. Sir, Sheehan syndrome. Primary pathological? Sheehan syndrome. Very good. Sir, what about the Swyer syndrome? Swyer syndrome is primary or secondary? Swyer syndrome. Sir, pure gonadal dysgenesis. Primary pathological. Absolutely clear this topic. Let's move on to the next one, puberty. So precocious puberty मतलब पहले आ गई, precocious menarche मतलब puberty पहले आ गई, menses पहले आ गई, delayed मतलब बाद में. Now सारा का सारा फंडा किसका है? Everything is dependent on the hypothalamus. अगर कोई चीज पहले आ गई तो उसको क्या करना है? रोकना है. How to suppress it? We'll give a contagion. Whether it is talking about the precocious puberty or talking about the precocious menarche, you have to give the continuous GnRH. You have to give what, sir? Continuous GnRH. And if it is delayed, you need to activate the hypothalamus. And to activate the hypothalamus, what you will give? Pulsatile GnRH. What you will give, sir? Pulsatile GnRH, sir. PCOS. Let's talk about this disease. These are again important questions for the exam. PCOS is also called as Steen-Leventhal syndrome. Pathophysiology क्या है? There is an insulin का resistance which is causing the small follicles. इंसुलिन रेजिस्टेंस की वजह से स्मॉल फॉलिकल्स हो रहे हैं सर. सिम्टम्स टेंडेंसी टुवर्ड्स ओबेसिटी, एक्ने, हिरसुटिज्म, मुंह पे बाल आएंगे, एंड्रोजेनिक एलोपेशिया, गंजा हो जाएगा इंसान. ओलिगोमेनोरिया इज बेटर मतलब फर्स्ट चॉइस देन द एमेनोरिया विच विल लीड टू इनफर्टिलिटी ऑल्सो सर. लॉन्ग टर्म कॉम्प्लिकेशन कैन बी मेटाबॉलिक एक्स सिंड्रोम, एंड मेटाबॉलिक एक्स सिंड्रोम के अंदर व्हाट वी हैव सीन, velvety black appearance, that is called as acanthosis nigricans. So obesity, diabetes mellitus, hypertension, they will lead to a skin condition associated with skin condition, and that is going to be the acanthosis nigricans. Acanthosis nigricans. Sir, now the diagnostic criteria of PCOS is Rotterdam criteria. Insulin resistance की वजह से हो रही है, follicle छोटे छोटे रह रहे हैं. Now there will be a menstrual dysfunction, we agree to that. Androgen levels are high. If you see the pathophysiology, the androgen levels are high. Then ultrasound में there is a multiple size, more than 12 number and short size you will see, and it will make a necklace appearance. Necklace appearance myself. Now this appearance is not of a PCOS, then this appearance is of a ovarian hyperstimulation syndrome. Ovarian, this is big, not a small size, this is a big size, ठीक है. This is ovarian hyperstimulation syndrome. Ovarian hyperstimulation syndrome. Hyperstimulation syndrome. Done sir? अगर इसमें छोटे छोटे होते then it should be for the PCOS. E/A रेशियो भी होती है. Normal it is 2:1, but here it is 1:2. FSH-LH रेशियो भी उल्टी हो जाती है 1:2. ट्रीटमेंट में लाइफस्टाइल मॉडिफिकेशन. You can give, because of diabetes mellitus, you can give a drug metformin. Androgenic feature, बाल वगैरह जड़ रहे हैं, you will give the OCPs. अगर menses, oligomenoria कम आ रहे हैं, delayed menses आ रहे हैं, तो progesterone withdrawal, you will give the progesterone. Progesterone का काम होता है यूट्रस को सिक्रीटरी बनाना. तो जब यूट्रस सिक्रीटरी बना होगा, एकदम विड्रॉल करोगे तो ब्लीडिंग आ जाती है. तो ओलिगोमेनोरिया भी ट्रीट कर, इनफर्टिलिटी को ट्रीट करोगे लेट्रोजोल की मदद से. So this is all a short sweet story of a 1 page of a PCOS or Stevens-Lethal syndrome, which will cover all your MCQs related to this topic in the exam. We just covered in 5 minutes. Now vaginitis is another topic which is regularly asked in the exam. So my dear friends, number 1 is vaginitis. Number 1 is vaginitis. Okay? Number 1 is vaginitis. Vaginitis. Sir, trichomonal vaginitis, it is caused by Trichomonas vaginalis, greenish white discharge, ET, dysuria, increased frequency of micturition, tiny ulcers on vagina. You can see right here, tiny ulcers on vagina. This is strawberry vagina, angry looking vagina, colpitis macularis. So these all are features of what's your Trichomonas vaginitis. Investigation of choice, saline microscopy. Drug of choice, metronidazole. Mate partner treatment is needed. So Trichomonas vaginalis is done. Can you tell me from the yesterday's class which mortality is there of a Trichomonas vaginalis? Which mortality is there? We have studied in the microbiology. Which mortality is there? Which mortality is there? कौन सी मोर्टेलिटी थी यार, कल ही पढ़ा था प्लीज. टम्बलिंग, टम्बलिंग मोर्टेलिटी. वेरी गुड. चलो, नाउ कमिंग टू द कैंडिडल वेजिनाइटिस. कैंडिडा, ऊपर सफ़ेद नीचे सफ़ेद, सलाइन माइक्रोस्कोपी. ड्रग ऑफ चॉइस में क्या दोगे? फ्लूकोनाजोल, सिंगल डोज. फर्स्ट ट्राइमेस्टर अगर प्रेग्नेंट होगी नो ट्रीटमेंट. सेकेंड एंड थर्ड ट्राइमेस्टर क्लोट्रिमाजोल क्रीम लगाओगे. मेल पार्टनर ट्रीटमेंट यस नीडेड, यस नीडेड. क्लमाइडिया वेजिनाइटिस डेडली है, ठीक है, एंड नाट करते हैं. न्यूक्लिक एसिड एम्पलीफिकेशन टेस्ट करेंगे. गोल्ड स्टैंडर्ड में क्या करेंगे? मैकॉय और हेला सेल कल्चर करेंगे. ड्रग ऑफ चॉइस में एजिथ्रो एंड डॉक्सीसाइक्लिन प्लस कॉन्टैक्ट ट्रेसिंग इज डन सर. प्लस कॉन्टैक्ट ट्रेसिंग इज डन सर. नेक्स्ट इज बैक्टीरियल वेजिनोसिस. नाउ देयर इज अ गार्डनेला वेजिनालिस. बिकॉज ऑफ दिस bacteria, what is happening? Basically your pH is increasing, that from acidic so it is going to the basic. Moment the pH is acidic to the basic, what will happen? There will be a decrease in Dorderland bacilli. डॉटरलाइन बेसिलाई एक एसिडिक बैक्टीरिया है, इसकी वजह से आपका पीएच बढ़ जाता है। पीएच बढ़ने की वजह से क्या होएगा, अंदर बैक्टीरिया आ जाएगा, बैक्टीरिया अंदर एंट्री करेगा। जब डॉटरलाइन बेसिलाई कम होगा पीएच बढ़ेगा, पीएच बढ़ेगा तो ये गार्डलेना अंदर आएगा, अंदर आएगा तो यहाँ पे बीमारी कॉज करेगा, जिसकी वजह से थिन ग्रेइश डिस्चार्ज, जिसकी मछली जैसी बदबू आती है। अगर 10% क्यूएच माउंट पे डालो तो पीएच मोर देन 4.5, क्लू सेल्स इंपॉर्टेंट more than 20%, whiff test positive 10% QH mount पे डालो, fishy odor, Nugent score is more than 7, drug of choices metronidazole, 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 or 4 are very very important. So my question number 1 for all of you, sir, angry looking vagina is a feature of, angry looking vagina is a feature of, चलिए फटाफट से, angry looking vagina is a feature of Trichomonas, Trichomonas vaginalis, Trichomonas vaginalis. Drug of choice in Trichomonas, Trichomoniasis. Drug of choice. Drug of choice is going to be metronidazole. Contact tracing is required or not required, sir? Contact tracing is required or not required? Contact tracing is required or not required? Contact tracing is not required. Sir, curdy white discharge is seen in, curdy white discharge is seen in, curdy white discharge is seen in very good, and it is caused by, and it is caused by, is caused by, sir, Nugent score is done to diagnose, Nugent score is done to diagnose, Nugent score is done to diagnose, Nugent score is done to diagnose bacterial vaginosis. Sir, Amsel's criteria is for, Amsel's criteria is for, Amsel's criteria is for, Amsel's criteria is for bacterial. Sir, Rotterdam criteria is for, Rotterdam criteria is for, very good, shabash. Rotterdam criteria is for, Rotterdam criteria is for, sir, which STD is called as deadly STD? Which STD is called as deadly STD? Deadly STD, in which NAT testing is done, chlamydia. That is what, sir, your chlamydia. So all your questions related to these 4 topics are also done and dusted, my dear friends. Done and dusted, my dear friends. Let's talk about the next topic, comfortably called as pelvic inflammatory disease. My dear friends, yes, pelvic inflammatory disease is an inflammation of uterus, fallopian tube and ovaries. Most common cause in acute is Neisseria gonorrhea, and the people who are using IUCDs, actinomyces will cause this. And what is the risk factor for that? Remember, multiple sexual intercourse with multiple partner can lead to the pelvic inflammatory disease. Now, acute and chronic PID, we will divide it into. What will happen in the acute? There will be a pain, plus there will be a pyosalping, very important. Sir, pyosalping word लिखा हो without confusion, acute mark करके आना है, hydrosalpings लिखा हो तो chronic. पहले पस पड़ती है, बाद में वो पानी पानी हो जाता है, सर. So pyosalpings and hydrosalpings you have to remember. Sir, there will be a diagnostic criteria. First is minimum criteria. Then there is an additional criteria, and then there is a definitive criteria, my dear. Sir, minimum, additional and definitive criteria. Sir, minimum criteria, there will be cervical, uterus and adnexal tenderness. Tenderness present होगी. Additional में fever होगा. WBC count बड़ा होगा. CRP बड़े हुए होंगे. That is additional criteria. Now coming to the definitive criteria of the acute PID. Sir, remember, एंडोमेट्रियल बायोप्सी वी विल टेक सर, प्लस अल्ट्रासाउंड में ट्यूबो ओवेरियन मास, प्लस अबे मेरी शादी के पीछे क्यों पड़े रहते हो तुम लोगों ने कर ली हैं? कोई जो मुंह उठाता है जो मेरी शादी के पीछे पड़े रहते हैं। अभी अभी तो आए हो। लेप्रोस्कोपी में सनसेट साइन, ट्रिकलिंग साइन फ्रॉम द फिम्बरी, इफ दिस इज फिम्बरी there will be trickling of pus like this is looking like a sunset sign, this is looking like a sunset sign. So this is the definitive. एक तो बायोप्सी ले लो भाई साहब, बायोप्सी के बाद ट्यूबो ओवेरियन मास देख लो, ट्यूबो ओवेरियन मास के साथ साथ में लेप्रोसी अगर लेप्रोस्कोपी करोगे फिम्बरी में you are going to see the trickling of the pus, that is called a sunset sign, that is called a sunset sign. Now how you will manage the case sir? OPD में आया तो क्या करोगे, अगर अंदर एडमिटेड है तो क्या करोगे? जब एडमिट होता है तो आईवी इंजेक्टेबल प्रेफर करते हैं, फॉर दैट इंजेक्शन क्लिंडा एंड जेंटा। अगर ओपीडी में आया एक इंजेक्शन दे दो बाकी टैबलेट्स दे दो तो सेफ्ट्राइक्सोन, डॉक्सी एंड मेट्रो, सेफ्ट्राइक्सोन, डॉक्सी, CDM इन द ओपीडी, एंड इंजेक्टेबल में आईपीडी देना है क्लिंडा एंड जेंटामाइसिन, क्लिंडा एंड जेंटामाइसिन, क्लिंडा एंड जेंटामाइसिन, क्लिंडा एंड जेंटामाइसिन, क्लिंडा एंड जेंटामाइसिन। ठीक है, डन एंड डस्टेड, डन एंड डस्टेड। नाउ क्रॉनिक पीआईडी, क्रॉनिक पीआईडी देयर इज अ डल पेन ऑन द मूवमेंट, देयर विल बी अ हाइड्रोसल्फिंग्स, लेप्रोस्कोपिंग में वॉयलेंट स्ट्रिंग अपीयरेंस व्हिच इज आल्सो कॉल्ड एज फिग-हर्ट्ज-कर्टिस सिंड्रोम। ये टिपिकल फाइंडिंग देखने मिलेगी आपको। एडिशन बने होंगे पेरीहिपैटिक रीजन पे, जब मूवमेंट करोगे तो वहां पे दर्द होती है, इंटेंस पेन इज देयर, सच फिट्स-हर्ट्ज-कर्टिस सिंड्रोम। नाउ in the chronic PID, if tube is getting completely blocked, it will lead to infertility. And sir, if the tube is partially blocked, there will be ectopic pregnancy. So PID के साथ there can be infertility also, there can be a ectopic pregnancy also. Again, I want to summarize. PID is an infection. Risk factor is multiple sexual partners, and causative organism is Neisseria gonorrhea. If IUCD user is there, then actinomyces. Clinical feature में there is going to be pain. In acute there is going to be the pyosulfings. In chronic there is going to be hydrosulfings. In the chronic itself there is going to be the Fitz-Hugh-Curtis syndrome, where you will have a dull movement on the dull pain on the movements. In the acute part we have learned about the three criteria. One is your minimum criteria, which is about the tenderness. An additional criteria will be there, which is about the fever, temperature. Then there is CRP, then there is WBC. Then other than that we are having the definitive criteria, where we were taking biopsy, tubo-ovarian mass, and along with that we were doing the laparoscopy. Laparoscopy में what we were seeing, the sunset sign we were seeing. You were saying sir sunset sign, sunset sign, sunset sign. Then treatment in the OPD, CDM, C for ceftriaxone, injectable form, doxycycline, metronidazole, and if patient is admitted then with clinda and gentamicin, clinda and gentamicin. ठीक है, clinda and gentamicin, clinda and gentamicin sir. ठीक है सर। chronic PID का treatment is according to the cause. First of all, anti-inflammatory, inflammation को हटा दिया, subside करने के बाद whatever complications are there, you just remove them. Like tube is blocked, what you will do, you will cut the two end and anastomosis. Partially blocked, you will put the instrument and you'll try to dilate it. So these are the treatments you will offer to such cases. Now coming to the next part is endometriosis. Sir, endometriosis, the presence of active endometrial tissue outside the uterus that we were talking about. Sir, अब आपका endometrial tissue कहीं और present है, और most common इसकी घूमने की जगह कौन सी है? ओवरीज। रिस्क फैक्टर KRAS जीन। अच्छा ये बताइए KRAS जीन कौन सा कैंसर करा रहा था? आज ही बताया ना आपने मुझे। कैन यू प्लीज टेल मी अगेन, द KRAS जीन वाज डूइंग विच कैंसर? हिंट देता हूं, एप्पल कोर डिफेक्ट वाज सीन देयर। एप्पल कोर डिफेक्ट वाज सीन देयर। Colon cancer, cutie pies, C for colon, C for cutie 5, and you guys are cutie pies. High estrogen is also a risk factor. Nulliparity is also a risk factor. कभी भी जो है प्रेग्नेंट नहीं हुई हो, प्रोटेक्टिव, सुट्टा पीने से एंडोमेट्रियोसिस नहीं होती क्योंकि वो एरोमेटाइजेशन को इनिबिट करता है। ओसीपीज अगर कोई खाता हो, ओरल कॉन्ट्रासेप्टिव पिल्स, जो 21 and 7 टैबलेट्स की कल बात हुई थी, उसकी वजह से एंडोमेट्रियल थिनिंग होती है। तो दीज आर द प्रोटेक्टिव मेथड्स फॉर द एंडोमेट्रियोसिस। अगर वो पतला रहेगा तो अपनी जगह पे रहेगा। तो प्रोटेक्टिव फैक्टर्स, रिस्क फैक्टर्स। अब सिम्टम्स क्या है? डिसमेनोरिया, मेंस्ट्रुअल पेन, वी हैव टॉक अबाउट द पैथोलॉजिकल कॉज वाले में। डिस्पेरोनिया, इंटरकोर्स पेन, मेंसेस के दौरान भी पेन और इंटरकोर्स के दौरान भी बहुत ज़्यादा पेन हो रही है। प्लस अगर एंडोमेट्रियल टिश्यू कहीं और होगा तो बच्चा कैसे पैदा होगा? देयर इज गोइंग टू बी इनफर्टिलिटी सर। पर वजाइनल एग्जामिनेशन में यू विल सी एडिनेक्सल मास, there is going to be the ovarian cyst, and that is ground glass appearance on the USG. Investigation of choice is laparoscopy. Chocolate cyst you will see, but just by looking at chocolate cyst, but just by looking at adnexal mass, just by looking on ground glass appearance, you cannot confirmately say that this is endometrial tissue. For that, the gold standard is histopathological examination. हिस्टोपैथोलॉजिकल एग्जामिनेशन। तो एंडोमेट्रियोसिस क्या चीज़ है? अपनी जगह से दूसरी जगह टिश्यू चला गया है, ज़्यादातर जाता है ओवरी, और आपका रिस्क फैक्टर में एक जीन है केरास, नल्ली पैरिटी, कभी बच्चा पैदा नहीं किया, प्रोटेक्टिव में आपका सुट्टा और ओसीपी आ गया। और पर वजाइनल एग्जामिनेशन पे आपको देखने, एक तो सिम्टम्स में पेशेंट बोलेगा कि डॉक्टर साहब इंटरकोर्स में बहुत दर्द है और पीरियड्स में भी बहुत दर्द है, बस बच्चा पैदा नहीं हो रहा। सर एडिनेक्सल मास प्रेजेंट होगा, सर ग्राउंड ग्लास ओपेसिटीज प्रेजेंट होगी आपकी सिस्ट में। देन सर आपका अगर आप लेप्रोस्कोपी करोगे यू विल सी अ चॉकलेट सिस्ट, एंड डू यू विल सी अ हिस्टोपैथ, देन यू विल सी एंडोमेट्रियल ग्लैंड्स प्रेजेंट देयर। दिस इज हाउ यू विल कंफर्म द डायग्नोसिस। नाउ मैनेजमेंट, इफ ओवेरियन सिस्ट इज लेस देन 3 सेंटीमीटर, सिस्ट एस्पिरेशन मोर देन 3 सेंटीमीटर, सिस्टेक्टमी। सर एंडोमेट्रियल डिपॉजिट के लिए कॉटराइजेशन एंड फल्गरेशन, उसको जलाने की कोशिश करेंगे। एडिशन के लिए एडिशोलाइसिस करेंगे। एंड ड्रग ऑफ चॉइस, बिकॉज यू नीड योर HPO एक्सेस टू वर्क फाइन, टू सप्रेस इट, बिकॉज अगर उसको मिलते रहेंगे हार्मोन तो वो वहीं पे ग्रो करता रहेगा। तो समटाइम्स वी हैव टू सप्रेस द HPO एक्सेस, फॉर दैट वी विल गिव अ कॉन्टिन्यूअस GnRH, वी विल गिव अ कॉन्टिन्यूअस GnRH, कॉन्टिन्यूअस GnRH। नाउ एडिनोमाइसिस, what is adenomyosis? When your endometrium is present in myometrium because of endomyometrial junction thinning. एंडोमेट्रियम और मायोमेट्रियम की जंक्शन अब बहुत पतली हो गई, जिस वजह से एंडोमेट्रियम इज प्रेजेंट इन द मायोमेट्रियम, विच यू कैन सी राइट हियर सर, विच यू कैन सी राइट हियर सर। दिस इज मोस्ट कॉमनली सीन इन द मल्टीपैरा और ओल्ड एज ग्रुप। मल्टीपैरा में बार बार बच्चा पैदा हुआ, जिसकी वजह से जो एंडोमायोमेट्रियल जंक्शन ढीली पड़ गई, ओल्ड एज की वजह ढीली पड़ गई। मोस्ट कॉमन सिम्टम इज मेनोरेजिया, मन भर के साइकिल आई। सॉल्ट पेपर अपीयरेंस, इन्वेस्टिगेशन ऑफ चॉइस इज MRI टू चेक द endomyometrial junction thickness. Gold standard is hysteroscopic curettage. You will check whether this tissue is endometrium or not. And treatment is total abdominal hysterectomy. Because the risk factor are 2, 40 साल के बाद, और अपना मल्टीपैरा, यानी कि बच्चे पैदा हो चुके होंगे, फैमिली कंप्लीट होगी। Here the treatment is total abdominal hysterectomy. Total abdominal hysterectomy. Now coming to the next topic is fibroid. So far everything is going comfortable. Please give me thumbs up in the chat box if everything is going comfortable. वरना मैं सवाल पूछना शुरू कर दूंगा फिर। चलिए, let's move on to the next one. शाबाश, very good, very good. Sir, hydrosalpinx is a feature of, my dear friends, hydrosalpinx is a feature of, my dear ladies and gentlemen, hydrosalpinx is a feature of, hydrosalpinx is a feature of acute or chronic? Chronic. Fitz-Hugh-Curtis syndrome is a feature of, Fitz-Hugh-Curtis is a feature of, sir, gold standard investigation for endometriosis is going to be, gold standard investigation for endometriosis is going to be, Gold standard investigation is histopathy. Very, very good. Very, very good. So treatment of adenomyosis is going to be, the definitive treatment of adenomyosis is going to be, the definitive treatment of adenomyosis is going to be love you too. पढ़ाई करो अब, चलो. Total abdominal hysterectomy. Very good. Now next topic is fibroid. From where they are originated? They are originating from the myometrium. ठीक है, सब म्यूकस फाइब्रॉइड्स होते हैं, फिर सब फंडल फाइब्रॉइड्स होते हैं, है ना. डिफरेंट टाइप ऑफ फाइब्रॉइड्स आर देयर सर. यूट्राइन, एक्स्ट्रा यूट्राइन, एन नंबर ऑफ फाइब्रॉइड्स आर देयर सर. एन नंबर ऑफ फाइब्रॉइड्स आर देयर सर. ठीक है, चलो चलो. रिस्क फैक्टर इज इंक्रीज एस्ट्रोजन एंड नल्लीपैरिटी. इंक्रीज एस्ट्रोजन एंड नल्लीपैरिटी. There is a genetic translocation between chromosome number 14 and 12. 12-14. हाई सोशो. अमीरों की बीमारी कौन? फाइब्रॉइड्स. अमीरों की बीमारी क्या है? फाइब्रॉइड्स सर. प्रोटेक्टिव फैक्टर अगेंस्ट फिजिकल एक्सरसाइज एंड स्मोकिंग. स्मोकिंग क्या करेगा? ब्लॉक द एरोमेटाइजेशन. एरोमेटाइजेशन, एरोमेटाइजेशन. ठीक है, चलो डन. देन सर यूट्राइन फाइब्रॉइड. यूट्राइन फाइब्रॉइड, इफ यू टॉक अबाउट यूट्राइन, इंट्राम्यूरल इज मोस्ट कॉमन, फिर सब म्यूकस होता है, फिर सब सीरस होता है. ठीक है, इंट्रा, अगर ये इसकी बाउंड्री है यूट्रस की, इफ आई मेक इट एबल टू मेक इट और नॉट, यस आई एम एबल टू मेक इट. ठीक है, ये आउटर साइड और इनर साइड के बेस पे देखेंगे. सब सीरस इज दिस. पहले सब म्यूकोजल आया, फिर बीच में आया इंट्राम्यूरल. ठीक है, और फिर बाहर की तरफ को आया सब सीरस. थर्ड नंबर का है ये, बीच वाला जो है पहले नंबर का है, ये है दूसरे नंबर का. ठीक है जी, चलो. नाउ सर एक्स्ट्रा सर्विकल फाइब्रॉइड्स, एक्स्ट्रा यूट्राइन में विल टॉक अबाउट द सर्विकल फाइब्रॉइड. आस्क्ड इन द एग्जाम, एंटीरियर और पोस्टीरियर वॉल पे होगा तो क्या होगा? इफ इट इज ऑन द एंटीरियर वॉल, इंक्रीज फ्रीक्वेंसी ऑफ यूरिनेशन. और पोस्टीरियर पे होगा तो यूरिन रिटेंशन कराएगा. क्या कराएगा सर? यूरिन रिटेंशन, यूरिन रिटेंशन, यूरिन रिटेंशन. ठीक है. नाउ यूट्राइन फाइब्रॉइड का मोस्ट कॉमन सिम्टम इज व्हाट सर? मेनोरेजिया. मन भर के साइकिल का क्या कॉज था? यूट्राइन फाइब्रॉइड. इन्वेस्टिगेशन ऑफ चॉइस इज यूएसजी. Best investigation is MRI. Complication can happen hyaline degeneration, ठीक है, calcaneus degeneration and also red degeneration. These are the type of degeneration which can happen with the fibroids. And treatment part, sir, mostly fibroids are asymptomatic. If asymptomatic and size less than 10 centimeter, USG follow up to check the size, sir. Sir, if symptomatic and multipara is there, already family complete हो चुकी है, total abdominal hysterectomy. And sir, if nulliparous, just do myomectomy. Just do myomectomy. Myomectomy. And sir, medical management is continuous GnRH to suppress the HPO excess. And sir, remember, plus tranexamic acid, because if fibroids are symptomatic, what symptom they are having? Menorrhagia. मन भर के cycle, मन भर के cycle, मन भर के cycle. So this is fibroids. We have talked about types of fibroid, most common fibroid, extrauterine fibroid, their symptom and their treatment. Mostly they are asymptomatic, and if symptoms are present, the symptoms are going to be the menorrhagia, sir. And here, if we see the asymptomatic and size less than 10 centimeter, just follow up. No need to intervene. And if there is symptoms, size more than 10 centimeters, you see multipara or primipara or nulliparous. Multipara total abdominal, and primipara you will have a myomectomy. You will do a plus supportive measurement, continuous GnRH to suppress the HPO excess, plus you will give a tranexamic acid to stop the timing. Done, sir? Sure. Let's talk about the congenital malformation of the uterus. Congenital malformation of the uterus. Sir, congenital malformation of the uterus, first we'll talk about the Mullerian duct start develop कब होती है? 7 to 8 weeks. Mullerian duct start fusing at 12 weeks. And Mullerian duct बनाती क्या है? अब आपको पता लग चुका है. Uterus, cervix, fallopian tube, ये upper 1/3 of the vagina. Upper 1/3 of the vagina is made by the Mullerian duct. पीछे हमने गलत बोल दिया था क्या? ठीक है, तो याद रखिए मुलेरियन डक्ट अपर 1/3 ऑफ द वेजाइना बनाती है, लोअर 2/3 इज मेड बाय यूरोजेनाइटल साइनस. जस्ट चेक इट, इफ आई हैव सेड रॉन्ग आई एम वेरी सॉरी, प्लीज करेक्ट इट दैट टाइम. ठीक है. एबनॉर्मेलिटीज सर, अगर इनर वॉल ऑफ द यूट्रस डू नॉट फ्यूज देयर विल बी ए यूट्राइन सेप्टम. यू कैन सी राइट हियर ए. If Mullerian duct fuse partially, there will be a heart-shaped uterus. There will be a heart-shaped uterus. This is B. There will be one vagina. There can be two cervix or plus two uterus is definitive. Two uterus. Uterus 1, uterus 2 is there. Uterus 1 and uterus 2 is there, sir. Sir, if Mullerian duct do not fuse at all, there will be a separate vagina, two uterus, two vagina. Two uterus, two vagina, one uterus, one vagina, like that it will happen. If only one Mullerian duct develop, there is going to be the unicornuate or banana shape uterus is going to be there. Banana shape uterus is going to be there, sir. सिर्फ सेप्टम हो सकता है, पार्शली फ्यूज हुए तो हार्ट शेप हो सकता है, और अगर दोनों फ्यूज नहीं हुए तो बायलेटरल होगा. टू सर्विक्स, टू वजाइना, टू यूट्रस विल बी देयर. इफ ओनली वन डक्ट, ओनली वन साइड विल बी देयर. ठीक है. हाउ टू इन्वेस्टिगेट? लीच विल्किंसन कैनुला डाला जाता है, डाई डाली जाती है, देन वील टेक अ हिस्ट्रोसाल्फिंगोग्राम. ऑन दैट हिस्ट्रोसाल्फिंगोग्राम वी आर गोइंग टू इन्वेस्टिगेट ये क्या है. नाउ सर, most common cause is ultrasound. Most common investigation is ultrasound. Gold standard is laparoscopy plus hysteroscopy is better answer. Hysterosalpingography की जो मैं बात कर रहा था is better answer than MRI. Now treatment, if septate uterus is there, this hysteroscopic removal of the septum. If uterine didelphys is there, then metroplasty you have to do. ठीक है, इन दोनों यूट्रस को आपस में जोड़ा जाता है, that is called as meatroplasty. Coming on to the next topic, and sir, that is your infertility. Next topic is what, sir? Your infertility. Infertility. My dear ladies and gentlemen, failure to conceive even after 1 year of unprotected and regular intercourse will be termed as infertility. If a patient is coming to you, आपके पास मरीज आता है, बोलता है डॉक्टर साहब 11 महीने हो गए, रोज मेहनत करता हूँ, बच्चा पैदा नहीं हो रहा है, तो यू विल से another 1 month वर्क मोर हार्ड, यू विल सक्सीड. ठीक है, तो 1 साल कम से कम होना चाहिए इन अनप्रोटेक्टेड, प्रोटेक्टेड नहीं, अनप्रोटेक्टेड, बिल्कुल बिना किसी पर्दे के. ठीक है. नाउ फीमेल फैक्टर्स क्या क्या हैं और मेल फैक्टर क्या है, लेट्स टॉक अबाउट देम. दिस इज अगेन एग्जाम क्वेश्चन सर. चलिए. नाउ सर, ओवेरियन फैक्टर्स, HPO एक्सिस फेलियर, कार्लमैन सिंड्रोम, पल्सटाइल GnRH पहले ही पढ़ा है, कार्ल 1 जेंडर एनोस्मिया प्लस इनफर्टिलिटी. HPO एक्सिस डिसफंक्शन PCOS के अंदर होता है, फेल हो जाता है, कार्लमैन में डिसफंक्शन होता है PCOS में, प्लस हाइपरप्रोलैक्टिनीमिया. सर लेट्रोजोल इज अ ड्रग ऑफ चॉइस फॉर PCOS इंड्यूस इनफर्टिलिटी एंड हाइपरप्रोलैक्टिनीमिया. ब्रोमोक्रिप्टिन विल गिव सर, ब्रोमोक्रिप्टिन विल गिव सर. ट्यूबल फैक्टर में PID याद आया, PID was causing the tubal obstruction which was leading to infertility, and endometriosis can also lead to your infertility. Best test to check the tubal patency कि ट्यूब ठीक है कि नहीं है, तो laparoscopic chromoperturbation done at best 10th day before the menses are starting. Those days are the best days to start that. And treatment of tubal block, if tubal block has happened, in vitro fertilization, because tubes are blocked, Mullerian duct वाला area block है, but your HPO axis is fine, that means ovulation is happening. Then coming to the cervical factors, we have talked about the HPO axis, ovarian factor, tubal factors, cervical factor. Now the sperm is trying to enter, but there are the dushman of sperm, there are the enemies of sperm called as anti-sperm antibodies. They are killing the sperm. They are not allowing a normal sperm to enter. For that we just check a test called as Sims test or Huhner test. You will see a jerky movement. You will see a jerky movement. And treatment is intrauterine insemination. Treatment is what, sir? Intrauterine insemination. Now this is female factor, sir. एंटीस्पर्म एंटीबॉडीज हो गई, PCOS हो गया, एंडोमेट्रियोसिस हो गया, कार्लमैन सिंड्रोम हो गया, आपका पिट्यूटरी ट्यूमर हो गया, PCOS हो गया. दीज ऑल आर फॉर द फीमेल फैक्टर्स. नाउ मेल फैक्टर्स, लेट्स लर्न अबाउट द नॉर्मल सेमाइनोग्राम, सर. द मिनिमम अमाउंट ऑफ स्पर्म इज 1.5. Maximum is it up to 5. Sperm count is more than 15 million per ml, and in per ejaculation approximately we spend 39 million sperms. Then morphologically normal sperm is equal to more than 4%. Viable sperm are more than 58% and total mortality is 40%. Now, what are the abnormalities regarding to this, sir? One by one. Semen, if it is less than 1.5 ml, it is called as hypospermia. Hypospermia. And if semen is more than 5.5, called as hyperspermia. If sperm is absent, called as aspermia. And if sperm is if semen is absent, called as aspermia. If sperm is absent, called as azoospermia. Semen less, semen more, and semen absent. Hypospermia, hyperspermia, aspermia, and azoospermia when sperm is absent. Now sperm count less than 15 million, oligospermia. Morphologically normal sperm is more less than 4%, teratospermia. Motility of a sperm is less than 32%, asthenospermia. Answer, viable sperm less than 58 is necrosospermia. Necrosospermia. So let me ask you some questions and you will answer me right now, sir. You will answer me right now, sir. Question number 1. Sir, less semen less than 1.5 ml is called as, less semen is called as, less semen is called as, and so no semen is called as, no semen is called as, no semen is called as, sir, morphologically normal sperm is less than 4% is called as, morphologically normal sperm is less than 4% is called as teratospermia. 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 Very, very good. Now move on to the last one. Male factor can be pretesticular, testicular, and post-testicular. But if it's pre-testicular, in the pre-testicular, we are having a problem in hypothalamus or pituitary, because of which FSH, LH, and testosterone, all three are less. So what we'll do, हाइपोथैलेमस को स्टिमुलेट करना है तो पल्सल्टाइल GnRH दे दो ट्रीटमेंट के तौर पे. अंडरस्टूड. टेस्टिकुलर प्रॉब्लम, एक्सीडेंट कैन हैपन, रेडिएशन कैन हैपन. सो FSH LH वाज नॉर्मल बट टेस्टोस्टेरोन वाज हाई, सॉरी लो. Testosterone was low. So remember, management is accordingly. Management was accordingly. So the people who are asking for the PDF, please join our Telegram channel. Okay. Post-testicular, the cause is obstruction. Everything was normal. Then why the problem was happening? The problem was happening because of the obstruction in the ducts. For that, we are having two methods. One is TISA, testicular sperm aspiration, and microscope or epidermal sperm. Epidermal is best because fresh sperm is coming. And this is an IPD procedure. If you are not able to extract sperm from here, then you have to do the intrauterine insemination. Now, what are the indication for intrauterine insemination, my dear friends? First is impotency. If penis is not able to erect fully, if penis is not erecting fully and down like this, then you have to do the intrauterine insemination. Vaginismus, if vagina is closing mouth when you are trying to go inside, vagina is so becoming so narrow, so angry and not allowing the penis to penetrate, that is vaginismus. In that condition, mild oligospermia, sperm count is less. Hypospadias, now your urethral opening is not here but somewhere else, that is hypospadias. Retrograde ejaculation, you are fired like this, sperm fired like this, but it is going like this, ulta ja raha hai. These are some indication for the intrauterine insemination. Now what is ARTs? Assisted reproductive techniques. So once question was asked, all of the following are ARTs except. So IVF is ART. Yes. ICSI, ZIFT, GIFT, they all are ART, but intrauterine insemination, you are not handling the gametes. You are completely, you can say, ejaculating whole of the sperm with the semen. But in these kind of techniques, IVF, ICSI, ZIFT, GIFT, where we are handling with the gamete. So micro handling is going on in this ARTs, but this is a way to remember this. Micro handling is going on with the ARTs, and with the intrauterine insemination, you are completely helping the sperm to go inside, directly going to inside in the uterus. Not a single gamete उठा के डाल दी कि semen हटा के डाला, sperm अलग से हटा के डाली है. No, wholesome you are putting inside. Now coming on to the next is menopause. Menopause, my dear friends, cessation of menses at least for the 1 year. In India 47, world is 51. Premature menopause less than 40 years. Most common cause is genetic. Delays is more than 55 and causes uterine fibroids. And uterine fibroids you have learned so well right now, sir. Thank you. Then physiotherapy is cessation of HPO excess. How it is happening? Estrogens are low, progesterone low, endometrial thickness is low, but FSH and LH are high. FSH and LH are high. Anti-Mullerian hormone is also becoming abnormally high. तो FSH LH हाई होंगे जब मैं आपका सिजेशन हो जाएगा HPO एक्सेस का. सिम्टम की बात करेंगे, हॉट फ्लशिस होगा, ड्रग ऑफ चॉइसेस टिबोलोन, प्रीवियस ईयर क्वेश्चन. ऑस्टियोपोरोसिस, ड्रग ऑफ चॉइसेस बिसफॉस्फोनेट्स. ड्राई वजाइना ईस्ट्रोजन दोगे, लिपलिपापन आएगा. लिबिडो कम हो जाएगा तो एंड्रोजन्स दोगे. Then sir, if there is a premature menopause less than 40 years, diagnosis is anti-Mullerian hormones, which is, sir, less than 1 nanogram per ml, and FSH is more. So anti-Mullerian hormone is less, FSH is more on day 3, will make a diagnosis that there is a menopause happen. There is a menopause happen. Now coming on to the next subject, and that is obstetrics, and we have completed our gynecology. Another 40 minutes and we are taking down this subject. समझ में आ गया जितनी चीज़ें we have studied? All of you might have already studied the things and you have just rebrushed it. What was there and what not, है ना. इंपॉर्टेंट चीज़ें ये होती है, इसमें ये होता है, ये करते हैं, ये बीमारी में ये है, PCOS में क्या है, एंडोमेट्रियोसिस में क्या है, एडिनोमाइसिस है, फाइब्रॉइड्स के अंदर क्या चीज़ है, ऑल दोज वन थिंग. व्हाट इज इनफर्टिलिटी, मेल कॉज, फीमेल कॉजेज, व्हाट इज योर मेनोपॉज, ऑल दोज टॉपिक्स वी हैव कवर्ड सो फार. नाउ सर, लेट्स मूव ऑन टू द नेक्स्ट टॉपिक, दैट इज कॉल्ड एज obstetrics. Let's first talk about the placenta. Sir, obstetrics is little bigger than the gynecology, so we will increase our speed little bit. Let's take it down by 7. Let's take it down by 7. Sir, yes, sir, placenta, if we talk about, weight is 500. There is a maternal component and the fetal component. Two components are there. Sir, this maternal component is formed by decidua bacillis and fetal is formed by chorion frondosome. Where is the site? Upper posterior or fundo posterior. Khatam. Hormone secreted by placenta. What important hormone? Beta HCG, estrogen, PAPA, HPL. Sir, PAPA is pregnancy associated plasma protein. HPL is human placental lactogen. Now coming to the internal os and the lower edge of placenta. Normal internal os and lower edge of placenta, there should be a distance more than 2 centimeter. Less than 2 centimeter is called as low-lying placenta, and if placenta is covering the internal os, this is called as placenta previa. You can see right here, sir. The image is blurred, but still it's okay. This is normal, more than 2 centimeter. This is lower edge of placenta. This is internal os. If it is less than 2 centimeter, then it is called as low-lying placenta, and if it is completely covering, this is called as placenta previa. Now abnormalities related to this, let's learn about them, sir. Low-lying placenta. The lower edge is within 2 centimeter from that. We have low accessory lobes, bilobeta, suction curiate and spuria. Bilobeta में 2 equal size lobes are there connected with the blood supply. Suction curiate is one big, one small connected with the blood supply, and spuria is supra साफ हो गया है, बड़ा छोटा lobe not connected with the blood supply. Extrachoral placenta. Now sir, maternal surface is larger than the fetal surface. where maternal surface is larger. Normally fetal surface is larger than the maternal surface. Here the problem is maternal surface larger than. Here is a circummarginate and circumvallate placenta. Circummarginate and circumvallate placenta. And now other deformities are like battledore placenta, where umbilical cord is attached at the placental margin. You can see filamentous. पहले umbilical cord fetal membrane पे inject हुई. From fetal membrane it travels to the placenta, maternal component. पहले fetal component पे गई, फिर maternal component पे आई. This is called as filamentous insertion of the cord. Filamentous insertion of the cord. Now the question comes, the blood is coming. Now how you will differentiate? Differentiate single alkali denaturation test or APT test. Sir, here what is happening, when you are putting the blood with a 10% QH mount, the fetal blood is resistant. Fetal blood जो होता है, that is a resistant blood, and less problem will happen. Less problem will happen. Less problem will happen. Fetal blood will be there, less problem will happen. Sir, sorry, if fetal blood will be resistant and maternal blood will be denatured. This is how you will differentiate between maternal and the fetal blood. Now amniotic fluid की बात करेंगे. Sir, less than 7 weeks पे who is secreting? Maternal plasma. 7 to 20 weeks diffusion from the fetal skin. And sir, more than 20 weeks it is fetal urine. It is what, sir? Your fetal urine. Sir, normally you will see a single deepest pocket is between. How to measure it? It's important to know amniotic fluid index and single deepest pocket. Sir, single deepest pocket is 2 to 8 centimeter and amniotic fluid index is 5 to 25 centimeter. Sir, single deepest pocket is 2 to 8 centimeter and amniotic fluid index is 5 to 25 centimeter. 5 to 25 centimeter. And the amount is normally 200 to 2000. Now, on the basis of this data, let's talk about oligo and polymenorrhea. Oligo and polymenorrhea, my dear friends. The single deepest pocket, if it is less than 2 and amniotic fluid index is less than 5, then we call this oligo, and volume is less than 200. And if the single deepest pocket is more than 8 centimeter and amniotic fluid index is more than 20, we call this as polymenorrhea. And fluid is more than 2000, sir. And most common cause of mild is idiopathic in both of them, but most common cause of severe here in the oligo is maternal diastolic hypertension, and in the poly it is open neural tube defect. Now अगर कोई चीज़ कम है तो amnio infusion of normal saline on the body temperature we give, और अगर ज़्यादा है तो बाहर निकाल लो. That is called as amniocentesis. Now max amount of amniotic fluid is going to be at what level? Can you tell me? There is a huge controversy over this 32, 34. Some teachers say 32, some books say 34. So 34, I think most of the people are agreed on 34 itself. Anna? Chalo. So is just one question comes like this, 34 or 32 you have to choose. Okay. And best, I think most of the teachers are going in the favor of 34 only. So we'll also go in the max majority only. Chalo. Now, sir, we have talked about the poly and hydroamenorrhea. And let's first tell about the single deepest pocket. Single deepest pocket and amniotic fluid index and amniotic fluid. क्या था? Oligo and poly. Less than 2, more than 8. Less than 5, more than 25. Less than 200, more than 2000. This is a basic thing you need to know. और ज़्यादा होगा तो निकालना है amniocentesis, कम होगा तो amnio infusion करना है, nasal आपका saline का, normal saline at the body temperature. Done. Now let's talk about the colors of amniotic fluid. Sir, color में at term it is straw color. RH compatibility golden yellow, listeria में green हो जाता है, abruptio placenta में dark, fetal demise हो जाए black, और postpartum pregnancy में greenish yellow, which is a saffron color, which is what's your saffron color. Now let's talk about the other things. Pregnancy. The next topic we are going to talk about is pregnancy. Sir, pregnancy. Period of amenorrhea is 40 weeks or 280 days. This is right from the LMP. But if someone is asking you true period of amenorrhea always minus 14 because first 14 days are ovulatory phase. First 14 days are ovulatory phase. Now what are the periods we are having? Growth phase, we are having ovular period, embryonal period and fetal period, sir. Ovular period is up to 2 weeks, what we have just talked about. Embryonal 3 से 8 वीक एम्ब्रियो रहता है, 9 वीक ऑनवर्ड्स क्या रह जाता है, वो फिर fetal बनता है, fetal बनता है. These are the 3 growth periods we have. We have 3 trimesters also, sir. What are those 3 trimesters, my dear friends? Here the trimester number 1 is up to 14 weeks. And from 14 to 28 is trimester 2, and more than 28 week up to 42 it is trimester 3. So 3 trimester, 3 growth period, and now GT PAL scoring. Number of the time she is becoming pregnant is G. Number of term deliveries is T. Number of preterm deliveries is P. Number of abortion is A, and living children is. This is called as GT PAL scoring. GT PAL scoring, which is normally done in the OPDs also. Preterm, early term, term, late term, post term. All these things you should know before going to the exam. What is early term? So 37 week. Before 37 week, we call that preterm. First of all, 37 weeks से पहले बच्चा पैदा हो तो preterm baby. 37 weeks to 38 week 6 day is early. 39 to 40 week 6 day is term baby. And 41 to 41 week 6 day is late term, and 42 week onward it is your post term babies. Post term baby, sir. Post term baby, sir. Again, I question one answer. Sir, 37 weeks से पहले क्या बोलोगे? What is 37 weeks before? Can you tell me before 37 weeks? Yes, my dear ladies and gentlemen, before 37 weeks it is going to be preterm. 37 to 38 week 6 days is going to be. Yes, very good. Yes, 39 to 40 weeks 6 days is going to be. 39 to 40 weeks 6 days is going to be. 39 to 40 weeks 6 days is going to be. Very good. Sir, 42 week onward. छोड़ो 41 को. 42 week onward is going to be. 42 week onward is going to be. तो फंडा समझ में आ गया. First trimester is up to. चलो another question. First trimester is up to. First trimester is up to. Second trimester is up to. In the GT PAL scoring, the T alphabet is for. GT PAL scoring, T alphabet is for. GT PAL scoring, T alphabet is for term babies. T alphabet is for term babies. Term babies. Term babies. Term babies. Term. What is estimated date of pregnancy? There is a formula called as Niggle's formula. What is LMP? LMP mein you have to add 9 months plus 7 days. 9 months. One more method is there. Add 1 year and then subtract 3 months and 7 days. Now coming to the next part is symptoms in the pregnancy. What a patient is going to tell you in the pregnancy part, sir. First trimester, my dear ladies and gentlemen. Yes, first trimester. First trimester earliest is amenorrhea. Period नहीं आ रहे, सुबह सुबह उल्टी आती है. Morning sickness drug of choice is going to be micturition. बार बार सुसु आता है, थकान होती है, breast enlargement हो रही है, discomfort हो रहा है. These are what, sir? Symptom of first trimester, and first trimester was up to 14 weeks, my dear friends. First trimester was up to 14 weeks, my dear friends. 14 weeks, my dear friends. First trimester, 14 weeks, my dear friends. चलो ठीक है. डॉक्सिलामाइन इज अ करेक्ट आंसर सर. दूसरा ट्राइमेस्टर हुआ, अब बच्चा पेट में लात मारने लग गया, तो बच्चा इज हिटिंग इन द एब्डोमेन. सो रिमेंबर मल्टीपैरा, इफ already she was pregnant, it will be felt at 16 week onwards. If she is pregnant for first time, it will be felt at 18 week onwards. It will be felt at 18 week onwards. 18 week onwards. Third trimester, सर 28 वीक ऑनवर्ड्स टू द 42 वीक्स, लाइटनिंग मतलब वेलकम साइन, ऐसा लगता है बच्चा बाहर आने वाला है. इफ शी इज अ मल्टी पैरा, द रिसेप्टर्स आर लिटिल इनसेंसिटिव नाउ, तो इट विल बी फेल्ट एट द टाइम ऑफ लेबर. एंड प्राइमरी पैरा के अंदर 38 वीक ऑनवर्ड्स देयर विल बी अ वेलकम साइन सर, वेलकम साइन. तो क्विकनिंग एंड वेलकम साइन, सेकेंड ट्राइमेस्टर एंड थर्ड ट्राइमेस्टर साइन शुड बी क्लियर इन योर हेड सर. नाउ साइन इन प्रेगनेंसी, सिम्टम्स वी आर डन विद सर. फर्स्ट ट्राइमेस्टर में आपको पहले पीरियड नहीं आएंगे, ब्रेस्ट एनलार्जमेंट, सुबह सुबह जो है आपका मन खराब होता है, बार बार सुसु आता है. दीज ऑल आर द फीचर्स ऑफ द फर्स्ट ट्राइमेस्टर. सेकेंड में क्विकनिंग वॉज हैपनिंग. इफ इट इज अ मल्टी पैरा इट्स गोइंग टू कम एट 16 वीक ऑनवर्ड्स. इफ ए प्राइमरी पैरा 18 वीक ऑनवर्ड, देन वेलकम साइन इज देयर इन द मल्टी पैरा एट द टाइम ऑफ लेबर, प्राइमरी पैरा एट द 38 वीक ऑनवर्ड, 38 वीक ऑनवर्ड सर. ठीक है, चलिए. नाउ कमिंग टू द फर्स्ट ट्राइमेस्टर. First trimester sign, what you are going to see, my dear friends, Goodall sign. Goodall sign, that is a softening of the cervix. Goodall's earliest sign felt at 6 week onwards. 6 week onward, Goodall sign, softening of the Jacquemer और Chadwick sign. जख्मी कर दिया, नीला कर दिया क्योंकि congestion हो रही है. Bluish discoloration of the cervix vagina due to the venous congestion. Jacquemer और Chadwick sign sir. Osiander sign, pulsation of palpation of a uterine vessels, 8 week onwards. Osiander, पिसाच की तरह पेट फैल रहा है, asymmetrical enlargement of a uterus, Pisaki sign, Pisaki sign, Pisaki sign. Then coming Palmer sign sir, some sense of tone due to uterine contraction. रखोगे ऐसा लगेगा, Braxton Hick contraction आती है सर. Hager sign, bimanual. Abdominal and vaginal fingers are approximating each other. This is also felt at 8 weeks, 8 weeks, 8 weeks. So these are the different 6 signs you have to remember for the exam seen at first trimester. Sir, palpation of uterine vessel is called as, this sign is called as pulsation of pulsation of uterine vessel is called as, uterine vessel is called as Osiander sign. Sir, asymmetrical enlargement of the uterus is called as, asymmetrical enlargement of the uterus is called as, asymmetrical enlargement of the uterus is called as, asymmetrical enlargement of the uterus is called as Pisaki sign. Bluish discoloration of the uterus is called as, bluish discoloration of the uterus is called as, bluish discoloration of the uterus is called as, softening of the uterus is called as Goodall sign, Chadwick sign. Done. Chalo, done. Let's talk about the second trimester. Palpation of the fetal part is felt at 18 week on, plus auscultation of the heart sound with a stethoscope 18 week on. Very good. Clinical sign of pregnancy, auscultation of the heart sound, my dear. Auscultation of the heart sound, my dear friends. Now coming to the third trimester, lightning sign. Lightning sign, same we were talking about. Welcome sign or lightning sign, same sir. Now investigation for the pregnancy. So sign and symptoms are clear to all of you. Everyone is clear. You people have given the answers also कि फर्स्ट ट्राइमेस्टर में क्या साइन देखने मिलेंगे, सेकेंड ट्राइमेस्टर में क्या साइन, क्लिनिकल साइन क्या था हमारा, स्टेथोस्कोप से हम हार्ट रेट को फील कर पा रहे थे सर. चलिए, इन्वेस्टिगेशन. अर्लीस्ट इज यूरिन प्रेगनेंसी टेस्ट पॉजिटिव 1 day आफ्टर द ओवरड्यू. अगले महीने पीरियड आना था 28 को, तो ये टेस्ट पॉजिटिव आना शुरू हो जाएगा 29, 30 ऑनवर्ड्स. बेस्ट टेस्ट इज अ ब्लड टेस्ट. दिस इज यूरिन टेस्ट, स्क्रीनिंग टेस्ट, ब्लड टेस्ट विद फिया और रिया. फिया इज बेटर. बिफोर 7 days ऑफ द ओवरड्यू, यानी कि 14th डे पे कोई प्रेग्नेंट हो गया था तो 21st डे ऑफ द साइकिल पे यू कैन डू द ब्लड टेस्ट एंड यू विल कम टू नो प्रेगनेंसी है कि नहीं है, इन केस यू आर प्लानिंग. सेफ इज अल्ट्रासाउंड, तो यू विल चेक द सैक्स, जेस्टेशनल योक एंड एम्ब्रियोनल सैक. तो ट्रांस वेजाइनल एंड ट्रांस एब्डोमिनल 2 तरीके के अल्ट्रासाउंड होते हैं दोस्तों. 4, 5, 6 and 5, 6, 7. This is how you will remember. Transvaginal में you are going to see little earlier as compared to the transabdominal. So transvaginal, this is going to be the 4 week, 5 week, 6 week, and the sacs are gestational. First is gestational, second is yolk sac, third is embryonal sac. Gestational sac, yolk sac and embryonal sac, it will come that transvaginal, it is going to be the 4, 5, 6 and transabdominal, it is going to be the 5, 6 and 7. 5, 6 and 7. Best clinical sign of pregnancy is auscultation of the heart sound by stethoscope. Now my question is, it is felt at what age? It is felt at what age, my dear friends? Can you answer my question? It is felt at what age? It is felt at what age? जल्दी से जवाब देंगे. Sir, 18 week onward. Best sign is visualization of a cardiac activity at 4 to 5 week onwards. Earliest is visualization of cardiac activity by USG 4 to 5 week onwards. But the best clinical is auscultation 18 week onwards, sir. 18 week onwards, sir. 18 week onwards, sir. Then what are the changes going to happen in the pregnancy, my dear friends? So investigation you have done, sir. We talk about the earliest tests, blood tests, ultrasound also. Now let's talk about the pregnancy changes. So number one thing is face. On face there will be a mask, and this mask during pregnancy is called as colasma, and after pregnancy is called as melasma. After pregnancy is melasma, during pregnancy is colasma. Breast size बढ़ने लग जाएगा, Montgomery tubercle आने लग जाएंगे, abdomen में linear nigra line आ जाएगी, that is a brownish black line between xiphisternum the pubic symphysis. Stria gravidum आ जाएंगे, stretch marks आ जाएंगे. Vagina will be bluish and more acidic now. Then we talk about the weight. Total weight gain in pregnancy is 11 to 12 kg. Then coming to the fundal height, best clinical by the size of. अगर आपको fundus की height देख के you have to tell how old pregnancy is. This is how we will do, sir. If it is pubic symphysis, sorry, base पे it is going to be at 12 weeks. Midway between pubic symphysis and your umbilicus is 16 week. Umbilicus is 20, 22 and 24 weeks also umbilicus पे ही होता है. Then at 28 week में it is more near to umbilicus and away from xiphisternum. 32 weeks it will become near to the xiphisternum. At 36 week it will become at xiphisternum. 36 week पे head is mobile, but 40 weeks पे head is fixed. 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 So this is how clinically we measure the size, sir. Now coming to the next topic is ectopic pregnancy. So here I think this topic pregnancy, till here it is everything is clear. We talk about the trimesters. We talk about the signs in pregnancy, symptoms in pregnancy, test of pregnancy. Now we talk about the complication related to pregnancy, and that is number one, ectopic pregnancy. Sir, what is ectopic pregnancy? Right here you will see implantation of fertilized ovum outside the uterus. And what is the risk factor, my dear friends? Risk factor is history of previous ectopic pregnancy. Most common site is ampulla, and most common site of rupture is isthmus. Isthmus. Now symptoms like lower abdominal pain is going to be there. Per vaginal examination you will see uterus तो खाली पड़ा हुआ है, और कहाँ मास प्रेजेंट पड़ा है? ट्यूब्स में पड़ा हुआ है, फेलोपियन ट्यूब्स के अंदर. और सर्वाइकल मोशन टेंडरनेस भी है, जैसे सर्विक्स को मूव कर रहे हैं वहाँ दर्द भी हो रहा है. सो दीज आर द सिम्टम्स ऑफ द एक्टोपिक प्रेगनेंसी. नाउ एक्टोपिक प्रेगनेंसी ऑन द बेसिस ऑफ बीटा HCG, हाउ यू आर गोइंग टू मेक द डायग्नोसिस? सर, इफ बीटा HCG इज डबल्ड, बट डबल्ड लेट डेवलपिंग इंट्रायूट्राइन प्रेगनेंसी. अगर आपका यूट्रस खाली पड़ा है और आपकी प्रेगनेंसी कहीं और है, बट बीटा HCG आपका डबल हो रहा है, your beta HCG is doubling, then my dear friends remember late developing intrauterine pregnancy. If beta HCG is decreasing, that matlab abortion has occurred. And if beta HCG is increasing but taking more time, that is the diagnosis where you will see this is a ectopic pregnancy. This is what's your ectopic pregnancy. Now ultrasound mein Buggles sign, ring of fire sign you are going to see, sir. Buggles sign and ring of fire sign. Investigation of choice is transvaginal sonography plus beta HCG correlation, where beta HCG is doubling but taking more time. Gold standard is laparoscopy, sir. Management of ectopic pregnancy depends on the beta HCG. Sir, medical management, if beta HCG is between 1000 to 5000, Sir, if the size of mass is less than 4, then methotrexate is a drug of choice. If jaundice is there, then you will give anti-actinomycin D. Surgical management is first indication is if medical management fails, plus beta HCG if more than 5,000, mass is more than 4 centimeter, then you will do laparoscopic removal, sir. Then coming on to the next one, if hemodynamically stable, ठीक है सर, एक्टोपिक प्रेगनेंसी को निकालने का सर्जिकल मेथड देखना, जो हम लेप्रोस्कोपी की मदद से कर रहे हैं. इफ द फीमेल इज हीमोडायनेमिकली स्टेबल एंड अनरप्चर्ड एक्टोपिक प्रेगनेंसी इज देयर, then we do a linear salpingostomy. We will just put a cut on the fallopian tube like this and we will take it out. If hemodynamically unstable and rupture, we'll do salpingectomy. We will cut the two parts and we will anastomose it. We will anastomosis, sir. Now coming to the molar pregnancy, sir. Next topic is what, sir? Your molar pregnancy. Sir, there is an abnormal proliferation degeneration of chorionic tissue. Risk factor can be vitamin A, D की कमी, फॉलिक एसिड की कमी. मोलर प्रेगनेंसी पहले हिस्ट्री है सिगरेट एंड ओसीपीस. नाउ देयर विल बी अ टू टाइप ऑफ मोलर प्रेगनेंसीज, कंप्लीट एंड पार्शियल मोल, सर. लेट्स सी व्हाट दे आर. कंप्लीट मोल में व्हाट इज हैपनिंग, एम्प्टी ओवा इज अटैक्ड बाय स्पर्म एंड 46XX क्रोमोसोम इज प्रेजेंट राइट देयर, सर. रिमेंबर, खाली ओवा पे अटैक करा, किसने अटैक करा सर? स्पर्म ने अटैक करा. एंड यूट्रस इज फिल्ड विद ग्रेप लाइक वेसिकल्स. ऑन यूएसजी स्नोस्टॉर्म अपीयरेंस. पार्शियल मोल पे 2 स्पर्म ने एक ओवा पे अटैक करा, पार्शियलिटी कर दी. एक ओवा पे 2 स्पर्म आर अटैकिंग एंड दे आर मेकिंग द क्रोमोसोम 69XXY. दे आर मेकिंग द क्रोमोसोम 69XXY. तो 46XX where empty ova was attacked is a complete mole, sir. And where one ova is attacked by 2 sperm making 69XXY, this is going to be the partial mole. Sir. Now symptom of mole pregnancy, irregular bleeding, amenorrhea. Investigation, gold standard is going to be the histopath examination and beta HC correlation. In the complete mole it is going to be more than 10 raised to power 5, and in beta HCG in the partial mole is going to be 10 raised to power 5 say less. Now management in the multipair and the primary, we are talking about the partial and the complete mole. If there is a multipara, total abdominal hysterectomy you will do. If it is nulliparous, suction evacuation will you, and also beta HCG follow-up is required. Now the complication of molar pregnancy can be invasive mole or choriocarcinoma. Now invasive mole is an invasion of molar pregnancy in myometrium, and again treatment is hysterectomy. If it is going there, you will remove it. Choriocarcinoma, most common symptom is irregular bleeding. Beta HCG is the investigation of choice. Most common size of metastasis is lung. And can you tell me which appearance you are going to see right in the lungs? कैसी appearance देखने मिल रही है आपको यहाँ पे lungs में? Which appearance you are going to see in the lungs? Yes, which appearance you are going to see in the lungs? The appearance which you are going to see in the lungs is, sir, cannonball appearance. Very good. Cannonball appearance. Done. Now for low risk patient who are having choriocarcinoma, the treatment is methotrexate. Sir, for the low risk patient the treatment is methotrexate, and for the high risk we will give a Backshaw regime, and that is EMACO. Etoposide, methotrexate, actinomycin D, cyclooncovin. So this regime we will give for that. Then antepartum hemorrhage. What is antepartum hemorrhage? What is postpartum hemorrhage? Let's move on to these topics which are important for the exam. Sir, antepartum hemorrhage, bleeding from the genital tract after the age of viability and before the delivery of the baby. And age of viability in India is 28 week onwards. 28 वीक के बाद अगर कोई ब्लीडिंग हो रही है, दैट इज कॉल्ड एज एब्रप्शियो प्लेसेंटा. एंड व्हाट आर द कॉजेस फॉर दिस एंटीपार्टम हेमोरेज? वन इज एब्रप्शियो प्लेसेंटा, प्लेसेंटा प्रीविया, वासा प्रीविया, लोकल टीयर. नाउ व्हाट आर दोज? लेट्स टॉक अबाउट देम वन बाय वन. Placenta previa, initially we have studied the placenta is covering the internal os. If a lower edge of placenta is within 2 cm from the internal os, that is called as what? Low lying placenta, and is completely covering, that is called as placenta previa. The risk factor for that is previous history of lower caesarean section. Then classification is Brownish classification. Brownish classification of placenta previa कहता है पहली क्लासिफिकेशन टाइप 1 कहता है कि अभी ये पास आया है, टच नहीं करा है, फिर कहता है इंटरनल ऑस के पास आ गया, फिर कहता है थर्ड में इट इज पार्शियली कवरिंग इंटरनल ऑस, फोर्थ में कहता है इट इज कंप्लीटली कवरिंग द इंटरनल ऑस. एंड ब्राइट रेड पेनलेस मैसिव, यस, bright red painless bleed is a feature of placenta previa and bright red painful bleed is a feature of abruptio placenta. This is how you can differentiate both of them. Sign, if we talk about abdomen and uterus, soft and non-tender. Abdomen and uterus, soft and non-tender. Investigation of transvaginal sonogram. Pervaginal examination is mandatory right here to check, sir. Then if type 1 and type 2 anterior is there, according to the classification, type 1 and type 2 anterior and posterior. So remember, treatment is normal vaginal delivery, sir. क्योंकि अभी तक वो उसको obstruct नहीं किया है. And if type 2 posterior and type 3, type 4 is there, where they are covering the internal os, then the treatment is cesarean section. So your placenta previa treatment depends on the classification. If they are covering, then classification, then treatment is cesarean section. If they are not covering, normal vaginal delivery you can attempt for. Now second is abruptio placenta. What is the difference between abruptio placenta and placenta previa? Dark red bleeding with the pain is abruptio placenta. Now placental separation, there will be a premature separation of a placenta. पहले ही separate हो गया, history of previous abruption. या तो ज़्यादा भारी बच्चा होगा, बहुत सारे बच्चे होंगे, हाइपरटेंशन होगी. सो दीज आर सम रिस्क फैक्टर फॉर द abruptio placenta. Now there are two type of abruption. One is concealed type, one is revealed type. Concealed type में one end is already there, one end is open. This is concealed type. If both the edges are open, this is called as revealed type. This is called as revealed type. Symptom is abdominal pain, abruptio placenta, continuous dull plaining, pervaginal bleeding is there. USG में you are going to see the clinical correlation. USG में you can see it and clinical correlation where abdominal pain is there, bright red bleeding is there. Management में induction of labor if no DIC. If disseminated intravascular coagulation disorder is there, then you will go for the fresh frozen plasma and then you will go for the induction of the labor. Anyhow, the treatment is induction of the labor. Now sir, let's talk about the abortion topic. In abortion, I just want to talk about MTP Act 2021. MTP Act 2021, up to 20 weeks, one doctor required, 20 to 24, 2-week doctors required, and MTP can be done up to 20 weeks. For congenital malformation, no age limit is there. Just medical board review is required, sir. Medical board review is required. And sir, if there is a contraceptive failure, only 20 weeks tak it is required. Only 20 weeks tak it is required, sir. Then sir, first trimester, how we will do the abortion? First trimester, medical method up to 7 weeks we can do, sir. Best is suction and evacuation. Medical mein first drug we use is Miffy. After 48 hours we use a mistoprostol. If they fail suction and evacuation with the help of Carmen cannula, and number size depends on the age of pregnancy. Second trimester, best is prostaglandin. Drug of choice is dinoprost and carbaprost. Pregnancy induced hypertension, gestational hypertension 20 weeks onward होती है और 12 week of delivery तक ये normally रहती है. It stays there for this much time. And drug of choice for gestational hypertension is labetalol. This is again a question. Now preeclampsia and eclampsia, what is this? Preeclampsia is BP plus hypertension. BP plus hypertension. If it is severe, there can be a HELP syndrome. And what is this HELP syndrome? Before that, let's see what parameters are increasing. See, mild and severe we have divided it into preeclampsia, mild and severe. Systolic BP between 140 to 160 and severe more than 160. It's mild preeclampsia and severe. Diastolic BP 90 to 100, more than 110. More than 110 is going to be the severe. Proteinuria daily less than 5 gram in 24 hours is mild, and more than 5 is going to be the severe. Dipstick test, if it is plus 3 tak it is going to be mild. If more than plus 3 it is going to be severe. And here monitoring is required. If mild preeclampsia is diagnosed, till 37 week you can monitor the BP. अगर इतना ही रह रहा है, wait for it, and then induction of labor. Sir, if severe preeclampsia is there, There can be chances of end organ damage, vision can go, headache, intrauterine growth retardation can happen, HELP syndrome can happen. In this, sir, only monitoring till 34 week is done. A drug labetalol will be given, then induction of labor will be done. But what if HELP syndrome is there? HELP syndrome mein there is a tenses criteria. What this tenses criteria says, platelet less than 1 lakh. Again, platelet less than 1 lakh. LDH more than 600, liver enzyme more than 70 international unit will help you to diagnose. And if HELP syndrome is there, you will not wait for even 34 weeks. You will go for the termination of pregnancy. You have to terminate the pregnancy, sir. Pregnancy, sir. Now, eclampsia. Preeclampsia is done. Proteinuria plus hypertension. Now, eclampsia part, if we talk about, sir, severe preeclampsia plus convulsions due to the cerebral hypoxia. First is to maintain the airway because convulsions are coming. And drug of choice to prevent and treat eclampsia is magnesium sulfate. फिर labetalol देंगे for preeclampsia and immediate induction of labor irrespective of the gestational age, irrespective of the generation age. Done. Now drug of choice for hypertension emergency, IV labetalol. Chronic hypertension, labetalol. Refractory, बार बार हो रही है, ड्रग देने के बाद भी आराम नहीं आ रहा, लेबेटालोल दे दिया. देन नेक्स्ट इज सोडियम नाइट्रोप्रोसाइड एंड स्टेटस एपिलेप्टिकस. स्टेटस एपिलेप्टिकस जब आपका सीजर ज़्यादा टाइम तक रुक जाता है, 5 मिनट से ज़्यादा है, बार बार आ रहा है, देन थायोपेंटॉन सोडियम विल गिव. एंड थायोपेंटॉन सोडियम इज व्हाट ड्रग? IV एनेस्थेटिक ड्रग, सर. IV जनरल एनेस्थीसिया का IV एनेस्थेटिक ड्रग. ठीक है, गर्लिक जैसी बदबू थी, ठीक है, याद आया? देते ही 11 सेकंड में आदमी बेहोश हो जाता है. दैट आई टॉट यू. Predictor of PIC is ultrasound Doppler. There will be a less than 22 weeks. There is a diastolic notch present. This is diastolic notch. Diastolic notch present here, sir. After 22 weeks, diastolic notch disappear. That will indicate there is a hypertension, gestational hypertension. This is how you will diagnose. RH incompatibility. Other good topic coming up for all of you, sir. RH incompatibility. Sir, RH incompatibility, if fetus is RHD positive and mother is negative, आगे incompatibility. In the first pregnancy, IgM is formed and the baby is saved. Why? Because IgM is a pentamer and it cannot cross the blood placenta. तो पहली प्रेगनेंसी में तो बच्चा हो गया सेफ, but in the next pregnancy, fetus is again RHD positive and now the mother blood is having IgG antibody. Now IgG is entering the placenta and causing fetal hemolysis leading to apoxia and other complications like liver is damaged, hepatosplenomegaly, polyhydramnions and hydrops fetalis. ठीक है, हाइड्रोप्स फेटालिस. हाइड्रोप्स फेटालिस कब बोलोगे? या तो स्किन एडिमा, एसाइटिस, हाइड्रोथोरैक्स, पेरिकार्डियल डिफ्यूजन, these kind of symptoms are there. Yellow swollen baby is a result of RH incompatibility. Also head size is increased. That is a sign, Buddha sign. That is called as Buddha sign. Scalpel edema, Buddha sign. Diagnosis के लिए Coombs test, indirect Coombs test is for fetal, direct is for mother. Now direct is for fetal, indirect is for mother. Now, sir, if ICT is negative, indirect Coombs test is negative, give anti-D2 to mother at 28 weeks of pregnancy. ठीक है? Now, if ICT is positive, indirect Coombs test is positive, induction of labor after 34 weeks. If direct Coombs test is done for a newborn and if DCT is negative, सेकेंड डोज मदर को दे दो विद इन 72 आवर्स टू 28 डेज. तो आईसीटी नेगेटिव होगा तो क्रक्स ऑफ दिस इज इफ आईसीटी इज नेगेटिव गिव द फर्स्ट डोज. इफ डीसीटी इज नेगेटिव विच इज डन ऑन द न्यूबॉर्न आफ्टर द बर्थ गिव अगेन मदर 72 आवर्स टू 28 डेज. 72 आवर्स टू 28 डेज, सर. 28 डेज, डन, सर. मल्टी फीटल प्रेगनेंसी, लेट्स टॉक अबाउट, सर. मल्टी फीटल प्रेगनेंसी. Multifetal pregnancy, if we talk about, sir, monozygotic and dizygotic. सर एक ही जाइगोट अगर दो हिस्सों में डिवाइड हुआ, दिस इज कॉल्ड एज मोनोजाइगोटेड एंड बच्चे विल बी सेम, जेंडर सेम, ब्लड ग्रुप सेम, शक्ल सेम, सब कुछ सेम, बट फिंगरप्रिंट्स आर नॉट सेम. फिंगरप्रिंट्स आर नॉट सेम. So identical twin blood group sex same रहेगा, can be monochorionic, can be dichorionic. What is dichorionic? There can be two sac and two placentas. And what is monochorionic? One sac. Monochorionic, monoamniotic is one sac, one placenta. Monochorionic diamniotic is one placenta and two sacs. So this can happen. Dizygotic from the two different zygotes, non-identical twins. दो zygotes से दो fertilize हुए, दो बच्चे पैदा हो रहे हैं. Sir, they are always dichorionic. What do you mean by dichorionic? दो ये, this is dichorionic. दो placenta, दो sac, dichorionic. Then coming to the type of monozygotic twins. Sir, division होना जरूरी है. अगर divide नहीं होंगे, they will be चिपके हुए and problem will be there. तो कितना division कैसे है? If division is happening within first 3 days, it will be didi, dichorion, diamnion, which we were seeing right here, dichorion, diamnion. If division is happening between 4 to 8 days, it will be modi, monochorion and diamnion. This one, sir, monochorion, diamnion. If division is happening between 9 to 12 days, there is going to be the monochorion, monoamnion, like this. एक ही chorion, एक ही amnion. So this is how it is going to happen. Division within 3 days will lead to separate didi. Then 4 to 8 days it's modi, and after 9 to 12, in the 9 to 12 days it is momo. And after 12 days, if it is there, then it is going to be the conjoined twins. Paraphagus is most common than the thoracophagus. Now this is monochorion and dichorion. Monochorion, it is there is going to be the T sign. And if dichorion is going to be there is going to be the lambda sign. There is going to be the lambda sign. Now complication what can happen in the monochorion, monoamnion? सोचो, अगर ये एक ही में प्रेजेंट है तो क्या कॉम्प्लिकेशन हो सकती है? इसकी कॉर्ड और इसकी कॉर्ड एक दूसरे के गले में जा सकती है. सो दिस इज अ मोस्ट कॉमन कॉम्प्लिकेशन, दैट इज कॉर्ड एंटेंगलमेंट. Now what complication can happen in monochorion and diamnion? So this is monochorion and this is dichorion. So they are getting the same blood supply. So there can be a twin transfusion syndrome. Twin transfusion syndrome. So this is a complication happened with this, sir. Now, sir, remember, yes, twin transfusion syndrome. Now delivery positions, let's talk about. Most common position is both cephalic, and treatment is vaginal delivery. If first baby is non-cephalic, do cesarean section. If first is cephalic and second is breech, पहले का सिर बाहर आ रहा है, दूसरे के पैर बाहर आ रहे हैं, तो याद रखना पहले की करा दो आप vaginal और दूसरे वाले का assisted breech delivery कराइए. First cephalic, second transverse, पहले की vaginal, दूसरे का internal podalic version. And when internal podalic version is given, when first baby is born, during the time what we are having between the first and second, in that time we will do an internal podalic version. An external podalic version is done at the age of 36 to 38 week under the ultrasound guidance. Now coming to this part, types of pelvis. There is a very famous classification about this, and this is called as Cardwell-Molly classification. If your pelvis is having round inlet, it's called a gynecoid. If transverse diameter is more than anterior posterior palatoploid. If your heart shape is there, then it is android. And if anterior posterior diameter is more, it is called as anthropoid. Anthropoid. Then, sir, contracted pelvis. Any pelvis less than 1 centimeter. Normal सेंटीमीटर किसी का 11 है, अगर 10 हो गया वी विल कंसिडर दैट एंटीरियर पोस्टीरियर है हमारा 11, अगर वो 10 हो गया कॉन्ट्रैक्टेड. ट्रांसफर्स हमारा 14 है, कम हो गया अगेन कॉन्ट्रैक्टेड पेल्विस. नाउ कंजेनाइटल कॉन्ट्रैक्टेड पेल्विस, नेगल्स पेल्विस. फर्स्ट ऑफ ऑल वी टॉक अबाउट नेगल्स पेल्विस. वन एला ऑफ द सैक्रम इज एब्सेंट. रॉबर्ट के अंदर बी कमिंग, बोथ एला ऑफ द सैक्रम आर एब्सेंट. Acquired in the children, it is bean shaped because of the rickets. Adult in the osteomalacia, triradiate patient. So both of them having a deficiency of vitamin D. Vitamin D deficiency, sir. MRI and C-section will do, plus cephalopelvic disproportion. अब क्या है, बच्चे का सर और pelvis की outlet दोनों आपस में मैच नहीं कर रहे हैं. अगर थोड़ा बहुत मैच नहीं कर रहा है तो वी डू ए ट्रायल ऑफ लेबर, जिसकी वजह से थोड़ी वाइब्रेशन होगी, इट माइट कैन कम इनसाइड. If after giving the trial of labor it is not coming, then we have to do something else, that is cesarean section. Fetal skull diameters, transverse diameter if we talk about bimastoid, दो mastoid के बीच में 7.5, bitemporal 8, and sir biparietal is going to be 9.5. ये बड़ा है इसीलिए most common engaging diameter is going to be this. Longitudinal diameter suboccipitobrachmatic 9.5. 9.5. Mento vertical like this from here to here 14 centimeter largest. Presenting part, a part of presentation which is above the internal os. जो भी internal os के ऊपर होगा, for example vertex है, face है कि brow है, that is presenting part. Denominator क्या है? Bony prominence of that presenting part is called as, for example vertex का क्या है? Occiput. face का क्या है? Chin, mentum. ठीक है, ये इसका denominator हो जाता है. लाई क्या रिलेशन बिटवीन मैटरनल एंड फीटल स्पाइन, कैसा है भाई? ट्रांसवर्स लाई है कि वर्टिकल लाई है? दैट इज अ फीटल एंड मैटरनल स्पाइन. स्टेशन, रिलेशन बिटवीन प्रेजेंटिंग पार्ट एंड इश्चियल स्पाइन. नाउ सर एट इश्चियल स्पाइन इफ इट इज देयर जीरो स्टेशन. अगर इश्चियल स्पाइन से ऊपर है प्रेजेंटिंग पार्ट -1 -2, अगर नीचे आ रहा है तो +1 +2, लाइक दिस वी विल लर्न इट सर. पोजीशन, रिलेशनशिप बिटवीन डिनोमिनेटर एंड पेल्विस. अब जो ब्रोमी प्रोमिनेंस थी उसको हम डिनोमिनेटर बोलते हैं, और पेल्विस के साथ उसका क्या रिलेशन है? दैट इज कॉल्ड एज पोजीशन. फॉर एग्जांपल लेफ्ट ऑसिपिटो ट्रांसवर्स इज बेटर आंसर देन लेफ्ट ऑसिपिटो एंटीरियर. लेबर की 4 स्टेजेस वी शुड नो सर. व्हाट आर द 4 स्टेजेस ऑफ लेबर वी हैव? स्टेज 1, स्टेज 2, स्टेज 3, स्टेज 4. सर स्टेज 1 इज फ्रॉम ट्रू यूट्राइन कॉन्ट्रैक्शन टू द कंप्लीट सर्विकल dilatation. Stage 2 is from complete cervical dilatation to the delivery of the baby. Stage 3 is placenta coming outside. Stage 4 is placenta is your physiological placenta expulsion, physiological observation after the placental expulsion. Now stage 1 is having 2 parts. Stage 1 of labor, latent and active phase. Latent phase में up to 5 centimeter dilatation is there sir. And active phase में 6 to 10 centimeter dilatation is there. Now the duration in the primary and penda, let's leave it. Active phase, remember, if active phase is arrested for 4 hours, we will do a cesarean section. And if your primary phase is affected approximately during primary and delayed for 14 hours, remember this thing. प्राइमी में 14 आवर्स के लिए हुआ, अगर मल्टी में तो थेरापेटिक रेस्ट, प्राइमी में 20 आवर्स से ज़्यादा हुआ तो थेरापेटिक रेस्ट यू हैव टू गिव सर. देन कमिंग टू द फ्राइडमैन प्रोटोग्राम पार्ट पर प्रोलॉन्ग लेबर का वो बताएगा, ये विल टेल यू अबाउट द प्रोग्रेस ऑफ द लेबर. सो देयर आर 2 लाइन, एक्शन लाइन एंड अलर्ट लाइन. इन बोथ ऑफ देम लाइन द डिफरेंस इज गैप इज 4 आवर्स. If alert line is crossed, prolonged labor. If action line is crossed, C-section. Stage 2 is baby coming out. How baby is coming out, sir? Engagement, descent, flexion, internal rotation, crowning, extension and restitution. Now how to remember it? सबसे पहले engagement हुई. किसकी engagement हुई? Decent आदमी की. तो engagement कैसी हुई? पहले झुकना पड़ा, flex करा तो अंदर ही अंदर खुशी हुई, internal rotation. अंदर खुशी हुई तो सर पे क्या पहनाया गया engagement के बाद? ताज, that is crowning. क्राउनिंग होते ही छाती चौड़ी हो गई, दैट इज एक्सटेंशन. एक्सटेंशन के बाद क्या, वो रेस्ट पे चला गया. जैसे ही रेस्ट पे गया उसकी दुनिया बाहर की बदल गई, दैट इज एक्सटर्नल रोटेशन. दैट इज व्हाट सर? योर एक्सटर्नल रोटेशन. अब मोस्ट मैनेजमेंट ऑफ डिले इन सिजेरियन सेक्शन, मैनेजमेंट ऑफ डिले सिजेरियन सेक्शन कब करना है? If this second stage of labor is in primary is delayed for 3 hours and multi is delayed for 2 hours, you will go for the cesarean section, sir. Stage 3. Now placenta is getting expelled. Bar. Sir, stage 3, keep baby tray below the maternal level. Drug of choice is oxytocin. Look at the sign of placental separation. Abdominal sign क्या होगा? Firm globular cricket ball like feel हो जाएगी अगर आप पेट फील करोगे. और वजाइना में गश ऑफ ब्लड विल बी कमिंग आउटसाइड. एंड अगर कोई दिक्कत होती है तो वी विल ट्राई टू प्रोड्यूस मोर कॉन्ट्रैक्शन विद द हेल्प ऑफ ऑक्सीटोसिन सर. इफ इट इज डिलेड विल 30 मिनट्स वी विल गिव अ ड्रग कॉल्ड एज ऑक्सीटोसिन सर. नाउ कमिंग टू द स्टेज 4, 1 hour physiological observation for the physiological chills. ना प्रेशर कितना होता है स्टेज 1 में 40 to 50, इन स्टेज 2 and 3 100 to 120 mmHg of pressure of contraction is going to be there, sir. Now sir, uterine inversion, sir, there is a mismanaged third stage of labor, that is what, sir? ये प्लेसेंटा वी आर गेटिंग आउट मिसमैनेज तरीके से, इसकी वजह से यूट्राइन इन्वर्जन. फर्स्ट डिग्री में डिम्पल, सेकेंड डिग्री में अप टू इंटरनल ऑस, थर्ड डिग्री में अप टू एक्सटर्नल ऑस, फोर्थ डिग्री में इट इज कंप्लीटली आउट, कंप्लीटली आउट. मैनेजमेंट, इमीडिएट रिसस्टिकेशन, मैनुअल रिपोजिशनिंग विद द हेल्प ऑफ जॉनिसन्स मेथड, दैट इज जॉनसन्स मेथड. If Johnson's method fail, O'Sullivan hydrostatic method. If that fails, Huntington's method. There is surgical method we do, sir. Now coming to the preterm labor, sir, preterm labor. Sir, if labor happens before 37 weeks, if a labor happens before 37 weeks, this is history of previous preterm, पॉलीहाइड्रोमनियन, मैक्रोसोमिया मल्टी. इसकी वजह से क्या है, वेट ज़्यादा है, इनकी वजह से वेट ज़्यादा है. वेट ज़्यादा होने की वजह से भी क्या होता है, प्रोस्टाग्लैंडिन रिलीज होते हैं. इसकी वजह से भी क्या होता है, उसकी वजह से क्या होता है, आपका कॉन्ट्रैक्शन हो जाते हैं प्री टर्म लेबर. सो इडियोपैथिक इज मोस्ट कॉमन देन इन्फेक्शन. डायग्नोसिस इज सर्वाइकल लेंथ लेस देन 2, ऑस डायमीटर मोर देन 3 एंड फाइब्रोनेक्टिन प्रोटीन इज कमिंग आउट. ट्रीटमेंट में स्टीरॉयड देंगे, डेक्सामिथासोन. It is highly recommended before 34 weeks because 34 weeks पे surfactants are getting mature. Before that you have to do tocolytic drugs like nifedipine we have to give so that contraction we can stop. Sir, in heart disease we can give the atosiban. Sir, MgSO4 is only given less than 28 weeks if convulsions etc. are there, sir. Sir, if the time is more than 34 weeks, wait and watch. These all treatment you are giving less than 34 weeks. Now, prom, sir, premature rupture of membrane. Now, sir, membrane rupture before the onset of labor. Labor start भी नहीं हुई, membrane पहले rupture होगी. Can infection हो सकती है? Yes. भार ज़्यादा हो सकता है, polyhydramnion, macrosomia, all these things can make that happen, sir. Diagnosis की बात करेंगे, sir. Litmus paper test, it turns red to blue, sir. Litmus paper test, red to blue. Furning pattern, fibronectin protein, USG में oligohydramnions. Because of the rupture of the membrane, your amniotic fluid is getting out. Now, if gestational age is less than 34 in prom, the treatment is must. MgSO4 less than 28 week, antibiotics, steroid and tocolytics. More than 34 weeks, if prom has happened, then antibiotic and induction of labor you have to do, sir. Induction of labor you have to do, sir. Now, sir, next is post-term pregnancy. More than 42. Most common cause क्या है? Clerical error, that is mistaken date. और अगर सच में हो रखा हो, then you have to report. Induction of labor. Induction of labor कैसे? Medical और surgical ways of induction of labor. Sir, prostaglandin E2, dinopros, sweeping and stripping of membrane, augmentation मतलब लेबर को स्पीड अप करना, ऑक्सीटोसिन, या फिर आर्टिफिशियल रप्चर ऑफ मेम्ब्रेन बाय द कॉर्नर, कोचर फोर्सेप. ऑब्स्ट्रक्टेड लेबर में क्या होता है, सर? व्हाट इज हैपनिंग द ऑब्स्ट्रक्टेड लेबर? सर, देयर इज अ प्रोलॉन्गेशन ऑफ लेबर डिस्पाइट गुड यूट्राइन कॉन्ट्रैक्शन. बहुत ज़्यादा यूट्राइन कॉन्ट्रैक्शन है, ठीक है, फिर भी बच्चा बाहर नहीं आ रहा, तो patient will be exhausted, vagina will be hot, dried, hematuria, plus one bad ring is there, which is a contraction ring. We will see this is called as Bandel's ring. Bandel's ring, sir. Immediately C-section you will do, sir. Post-term pregnancy. In this we see a physiological ring, and that is because of the overuse of oxytocin. May resolve spontaneously if not cesarean section. Now coming to the next topic called as postpartum hemorrhage. Postpartum hemorrhage. Sir, postpartum hemorrhage, primary and secondary, we are dividing it into. Primary, if we talk about within 24 hours of the delivery, and most common cause is uterine atony. Secondary is after 24 hours to 12 weeks of uterine retained placenta. Manage कैसे करो? How are you going to manage this, sir? Injection of transamic acid 1 gram plus resuscitation. Drug of choice is oxytocin. Oxytocin अकेला काम नहीं करेगा, तो uterine massage. ये भी काम नहीं कर रहा तो कार्बोप्रॉस हैम्बेट ड्रग दे सकते हैं हम। ये भी काम नहीं कर रहा तो बायोमैनुअल यूट्राइन कंप्रेशन, ये भी नहीं कर रहा तो एक्सटर्नल एओर्टा कंप्रेशन, ये भी नहीं कर रहा था मिलिट्री एंटी शॉक गारमेंट, मिलिट्री भी काम नहीं करी तो बकरी बैलून कैथेटर एंड कॉन्डम कैथेटर। if it is not going to work, then you will go for the no response के बाद मल्टी पैरा है तो काट के छोड़ दो, प्राइमी पैरा है तो you have to compression by the B-ledge suture। यूट्राइन आर्टरी को कर सकते हो, ओवेरियन आर्टरी को कर सकते हो। इफ स्टिल नॉट, देन यू हैव टू डू हिस्टेक्टमी एंड यू हैव टू पुट द अम्ब्रेला और द पैराशूट पैक इनसाइड, अम्ब्रेला और द पैराशूट पैक इनसाइड सर। नाउ सर, deliveries, breech position, frank breech, complete breech and footling breech. What is this, sir? Sir, if your thigh is flexed, this flexed thigh and knees are extended, this is frank, and the presenting part is buttocks and genitalia. Sir, if your thigh is flexed and knees are also flexed, here will be buttocks, genitalia and feet. If your feet are coming out, that is called footling breech. Footling breech. Just 5 minutes more. Management of breech. For the extended legs, like this, Pinard maneuver. For the extended arms, love set maneuver. For the delivery of the after coming head, in the developed countries, we use a Piper forceps. So, lamba wala forceps dekh ke jana ek bari. Piper. Other method is Burn Marshall method. We will put a after coming head inside, baby pura andar dalenge, and then we give in preterm Duchenne incision, and in term we do a Zavanelli maneuver. After coming to the conclusion, there is a stargazer breech. Hyperextended neck is coming outside like this. बच्चा बार-बार ऐसे करके. In this C-section. Transverse breech का most common cause is prematurity. Now what you do at 36 weeks, external cephalic version. But if first baby is cephalic and second is transverse, we do internal podalic version, and when we do at the time of labor. When we do at the time of labor. है ना? And यहाँ पे she is in labor C-section. चलो done. Instrumental delivery में दो चीज़ हैं. Prerequisite station should be +2. Membrane rupture होनी चाहिए. Contraction, no contracted pelvis होना चाहिए. Complete dilatation होनी चाहिए. ठीक है. 3 attempt fail हो जाए तो then you have to go for the C-section. Vacuum delivery better because you do not need complete dilation. Only 6 centimeter dilatation is enough. And sir, the only limitation is fetal distress के अंदर we should not use it. We should not use it, sir. And remember, if 3 attempt fails, again C-section we have to do. C-section we have to do, sir. Next is episiostomy. Episiostomy, if you remember, sir, episiostomy, 2 incisions we give. One is mediolateral. Middle incision is dangerous because it can rupture the anal sphincter. Mediolateral we give, it is a safe, and it is done to increase the vulval outlet, sir. Vulval outlet, sir. Then cesarean section indication, contracted pelvis, cephalopelvic disproportion, etc. Type of incision, अगर पेट पे देंगे most common is phenostyle, और अगर uterine में देंगे most common is Kerr incision. Kerr incision. The last topic is purpurium, sir. 6-week period after delivery in which all organ return back. First of all, let's talk about the uterus. Immediately after the delivery, it is 1 gram or 1 kilo. After 1 week, आधा हो जाता है. 2 week के बाद 300. 3 week के बाद 100. 6 week के बाद it becomes a normal organ. Normal organ. ठीक है? चलो. Normal organ. चलो. Now, postpartum discharge, lochia, very important topic for the exam. Chalo, shabash. Lochia rubra, serosa and alba. Sir, lochia rubra are for red color. RBCs are coming. Lochia serosa, WBC is yellow color. Alba is decidua, white color is coming. So, decidua, alba and serosa. These are the 3 important terms you will remember for the exam. What is postpartum blues and depression? Blue is sudden withdrawal of estrogen, progesterone. So there is going to be the nervousness for the first 10 days. Reassurance is treatment. And postpartum depression is seen after 2 to 3, not 4 to 6 months. 2 to 3 months you will see drug of choice is SSRI, and that is fluoxetine. And here we completed subject till now. We will take Nice break. Obs and Gynae was longer, but covered approximately your 80% of the topics itself. Now, at what time we are going to come back? We need a break till 7:35 is fine. It's 7:18. I think 7:20 it will go. And we will come back at 7:35. 7:35. 7:35. Okay? Chalo. Done. Let's take a break. See you all. Welcome back with the 17 subjects of this Final Aid by Conceptual Medicine. Again, a PDF is posted on our Telegram group channel, and from there you can download it and you can use it. Now the subject which we are going to do is psychiatry. Initially in this PDF, medicine is given. I'm starting from the psychiatry, then last we'll do the medicine, and then we'll talk about the surgery part. Chalo. Let's talk about the psychiatry right now, sir. Are we all ready? Yes. Chalo. Welcome to the Conceptual Medicine Final Aid Chanting Style Revision, sir. Let's talk about the term psychiatry. Sir, the term psychiatry was given by Johann Christian Reil. And here, in psychiatry, there are different questions are asked, and those questions are mini mental state examination. So total 30 questions are asked. Different questionnaire is there and 30 questions are asked, out of which if score is less than 23, if the score is less than 23, the patient is diagnosed, PDF is in the group, with dementia. Diagnosed with dementia. Dementia. Memory loss and judgment is. नहीं, PDF नहीं आई. Wait. Let me sell. Final one is not there. Let me check. Okay, it will come right now. Meanwhile, you can listen. It's coming in the group. Don't worry. Big channel. Big channel. Big channel PDFs coming. Okay, it will come in just 5 minutes. Okay, I just conveyed and they are sending. So, chalo, mini mental state examination. There are 30 questionnaires is there. Less than 23 is considered a dementia. What do you mean by dementia? Memory loss plus judgment is impaired. On basis of this question, which will tell the recent memory, past memory, consciousness, then cognitiveness, all those type of questions are there. Now coming to the next one is called as what, sir? Your affect. Affect is that emotional state which can be observed by looking at my face. If you can say I'm happy or sad, that is what called as affect. The different type of affect we are having. What different type of affect we are having? Number one is what's called as euphoria, elation, exultation. Euphoria is excessive happiness beyond the point of relevance. See, it is posted, and link is also there. I think it's posted. Let me myself also check. PDF has been posted. Chalo, download it right now. Done. Right now PDF has just posted. Okay. Chalo. Got it. Done. Let's start with the class now. Affect is that state which can be seen, observed. So in that, number one is euphoria, excessive happiness beyond the point of relevance. The person is over happy. If I should be just happy and I am laughing, ha 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 ha, this is euphoric feeling. Elation, euphoria plus increase in psychomotor activity. I am hyperactive also along with the happiness. Exultation. Sir, euphoria, increase in psychomotor activity, delusion of grandiosity. What do you mean by delusion of grandiosity? A person feels some kind of special power, role or identity. Some kind of special role, power or identity, and this is most commonly seen with the male, more common than the female. Male more common than the female. Then coming to the next one is thought. Thought is cognition. For example, how you will check my cognition? I'll say I am Dr. Paras, I am teacher, I am doctor, I am surgeon. So you will say yes sir is saying right. If I will say I'm Dr. Paras, sometime lawyer, sometime I'm taxi driver, sometime I'm astronaut, sometime I am doctor, sometime I am plumber. So these kind of things will make no sense. That means my cognition is not working fine, and on the basis of this information you will come to know कि मेरा दिमाग सही है कि नहीं. So thought is cognition. What are the disorder related to the thought? Let's learn them one by one. PDF is annotated. नया PDF नहीं है. It's coming now. Okay, just sending. It's coming in just 1 minute. Don't worry about that. सबसे पहला वाला is derailment. Derailment, my different derailment. Now derailment is connection between two thoughts or loss. For example, my name is Paras, Delhi is capital of India. So there should be a addition to this. My name is Paras, I live in Delhi and Delhi is capital of India. Looks more sensible. My name is Paras, Delhi is capital of India. I am doctor, India is great country. So there is a derailment. Then loosening of association. Connection between two components of the same thought is not matching. I am Paras, I'll work hard, it is going to be the blockbuster of the year. This is component which is matching. If I say I am Paras, I am going to be blockbuster. So there is a component which is not matching of a same thought. Okay, I am Paras, I'll go to Goa. I'll say I am Paras, I'll take flight, I'll go to Goa. So this makes some sense, and if I'll miss the entire part between this, that means some component is missing. Some component is missing. It's just coming, don't worry, just coming. Signal issue is there, whoever is sending, team is sending us, we'll get the file. Okay, then what is derailment is done, this loosening of association is done. Incoherence. Thought disorder next is incoherence. What do you mean by incoherence? Sir, word salad. Many things we are mixing together. Tea, Paras, going, eating, flying, sleeping, phone call doing, studying. So all these things I am making a jumble. This is called as incoherence. Incoherence. Okay? Come to your place after passing the exam. Welcome, Vaibhav. Don't worry, welcome. Tangentiality, circumstantiality and neologism. Sir, what is this? Sir, one by one. Yes. Tangentiality is extra detail that never reaches the goal. Extra detail that never reaches the goal is called as tangentiality. Circumstantiality is extra detail that reaches the goal. If I am asking someone, are you committed or not? And that person is making story, but not telling that I'm committed or not. This is some kind of example of a tangentiality. And if another person who is having circumstantiality, I'm asking, are you committed? So this is doing jalebi talk, and then in the end, taking so much of time, they'll come to know. They'll tell us that yes, I'm committed or not. So taking time and then telling is circumstantiality. Never telling is tangentiality. Is a tangentiality. Then neologism, sir. Deriving new word without any meaning. Okay? Like suppose I am in bottle, I will say bottlosa. There is no word like bottlosa. Bottletting, no word like that exists. I just made it by my own choice. Aagi PDF aagi. Okay, sir. Now I'll ask some question regarding the thought disorder, and you'll tell me which thought disorder I am talking about. Sir, my question number one is, sir, extra detail that never reaches the goal is called as, extra detail that never reaches the goal is called as, extra detail that never reaches the goal is called as extra detail that never reaches the goal is called as tangentiality. That new word without meaning is called as, new word without meaning is called as, new word only called as Arshi ka tuck tuck. So last में देखो, you'll have this last slides. Neologism. Sir, component of the thought is not matching, that is called as, component of the thought is not matching, that is called as, when the component of the thought is not matching, that is called as, just the component of the thought is not matching, that is called as loosening of association, loosening of association, loosening of association. Now sir, content of thought, you will see right here sir, delusion. I'll simply tell you what delusion is, what superstition is. If any belief is supported by society, this is called as superstition. And if any belief not supported by society is called as delusion. मैं बोलूँगा कि आज मैं परमात्मा से प्रार्थना करूँगा, कल बारिश होगी, सोसाइटी करेगी हाँ 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 हाँ. मैं कहूँगा कल मैं बारिश कराऊंगा, सोसाइटी कहेगी ना 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 ना, तेरा दिमाग खराब हो गया, डिल्यूजन हो गया तेरे को. ठीक है. सो दिस इज अ बेसिक डिफरेंस. बिल्ली रास्ता काट जाती है, अपशगुन होता है, सोसाइटी बोलती है यस यस, दिस इज डिल्यूशन. मेरी गाड़ी रास्ता काट जाएगी तो अपशगुन होगा, दैट विल बिकम डिल्यूजन. इफ सोसाइटी, still no PDF of psychiatry. नहीं यार, क्या बात कर, क्या भेज दिया. Let me again. Okay. Done. Conceptual medicine, you'll get the PDF. Okay. 744 पे जो PDF आया, that is a PDF. That is a PDF. Okay. चलिए. So not supported by socio-cultural norm will become delusion. Supported by socio-cultural norm will become superstition. Perception, hallucination. There can be auditory, visual hallucination, reflex hallucination, all those kind of. Illusion is a misinterpretation of a stimulus. रस्सी को सांप समझना, फिर अंधेरे को परछाई समझना, ये सब चीज़ें आ जाती है illusion में. Now one by one let's talk about the delusion and delusion disorders. As I told you, delusion is something which is not supported by the society. Anything you are believing and society is not at all believing that. That is a false, firm, unshakable belief, sir. False, firm, unshakable belief which is not supported by socio-cultural norms. Sir, not supported by socio-cultural norms. Next is types of delusion. My dear friends, type of delusion, number one is delusion of persecution. A person feels someone want to harm me. कोई मेरा पीछा कर रहा है, कोई मेरे पैसे खाना चाहता है, कोई मुझे बर्बाद करना चाहता है, कोई मुझे मारना चाहता है. But when you will see, there is no one like that. That means society is not accepting your claims. So this will become delusion of persecution. Sir, next delusion is delusion of reference. Delusion of reference. A person will say that everything happening around is related to me. उसका ये काम हुआ मेरी वजह से, उसकी गाड़ी ठीक हो गई मेरी वजह से, आज उसके घर में पानी आ गया मेरी वजह से, वो पास हो गया मेरी वजह से, वो रुक गया मेरी वजह से, नए कपड़े आए मेरी वजह से। हर चीज में अपना रेफरेंस देना इज डिल्यूशन ऑफ रेफरेंस, डिल्यूशन ऑफ रेफरेंस। अरे मुझे तो पता है, अरे मैंने ही तो कराया, अरे मैं तो था वहाँ, अरे अपने थ्रू। दीज ऑल थिंग आर डिल्यूशन ऑफ रेफरेंस, डिल्यूशन ऑफ रेफरेंस. Now delusion of grandeur or grandiosity, already we talked about that patient feel that he or she is having some kind of special role, identity or power. This is most commonly seen with the male. Now delusion of love or erotomania. Sir, in this person is feeling overloved. ऐसा लगता है दुनिया संसार मुझे प्यार कर रहा है, इतना अच्छा लगता है, इतना अच्छा लगता है. Now you will tell me this is most commonly seen in the male or female. This is most commonly seen in the male or female. Male or female. Male or female. Sir, female more common than male. ऐसा मैं नहीं बेटा, ऐसा मेरे साथियों, ऐसा संसार भी कह रहा है और ऐसी किताब भी कह रही कि फीमेल को लगता है कि सारे मेल उनसे प्यार करते हैं, बट इन रियलिटी एवरी मेल लव्स एवरी फीमेल. परमात्मा ने बनाया ही ऐसा है कि नहीं? सो रिमेंबर डिल्यूशन ऑफ लव और एरिटोमेनिया है ना, ओवर लविंग मेल फीमेल. ठीक है. निलहिस्टिक डिल्यूशन, निलहिस्टिक डिल्यूशन. सर निलहिस्टिक डिल्यूशन और कोटार्ड सिंड्रोम, पर्सन फील द वर्ल्ड इज अबाउट टू एंड. सर दुनिया खत्म होने वाली है तो मैं क्लास क्यों कर रहा हूँ, क्यों मैं पास करूँ एग्जाम को, अरे सब तो खत्म होने वाला, अरे क्या ही करना ये करके, अरे क्या ही होगा यार, क्यों ही करना, क्या ही जीना. तो ये सारी बातें अगर कोई करने लगे, दिस इज कॉल्ड एज निलहिस्टिक डिल्यूशन. दिस इज कॉल्ड एज व्हाट सर? निलहिस्टिक डिल्यूशन, निलहिस्टिक डिल्यूशन. देन कमिंग टू delusion of infidelity or Othello syndrome. Sir, morbid jealousy towards their loved one, most commonly seen with the alcoholic patient. डेली अगर आप शराब का सेवन करेंगे तो आपके अंदर ये डेवलप होने के चांसेस और भी ज़्यादा हो जाते हैं. Then coming to the favorite delusion of double of examiners, Capgras, refuse to identify known person. Dr. Paras is teaching you and you are saying, no, he was not Dr. Paras, he was someone else. Then this is called as Capgras, associated with Lewy body dementia. Sir, free goalie. Now Dr. Paras is not there, and in the every lecture you are saying, oh, this is Dr. Paras. This is when I was not there, and you are saying I am there. This becomes free goalie. When I am really there, and you are refusing to identify, this is called as Capgras. This is called as Capgras. This is called as Capgras. 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 Now I'll ask different type of delusion. You will answer me, sir. If person feels world is about to end, this is called as. If person feels world is about to end, this is called as. If person feels world is about to end, this is called as nihilistic delusion. Nihilistic delusion, sir. Nihilistic delusion, sir. Morbid jealousy towards the loved one. Morbid jealousy towards the loved one is very good. Morbid jealousy towards the loved one is morbid jealousy. Othello syndrome. Othello syndrome. Very good. Sir, everyone loves me. Everyone loves me. Everyone loves me. I'm a Laveshwari. I'm a Lavanjali. I'm a love priya. Everyone loves me. I'm a lovely. It is delusion of love or erotomania. Person want to harm me. A person want to harm me. कोई मुझे नुकसान पहुंचाना चाहता है. This is going to be. A person wants to harm me. This is going to be, sir, persecution. Beautiful answers. Beautiful. Now coming to the delusion part is done. Now coming to the superstition part, sir. Superstition part, sir. Sir, false, firm, unshakable belief, sir. Sir, क्या sir? False, firm, unshakable belief supported by socio-cultural norm. For example, मैं हवन करूँगा तो पास हो जाऊँगा. हाँ बेटा करो. मैं जल चढ़ाऊंगा मैं पास हो जाऊंगा. हाँ बेटा. बिल्ली रास्ता काट गई, हाँ बेटा। लड्डू खाओगे अगर बाबा जी का प्रसाद तो कृपा होगी, बोलो हाँ बेटा खाओ। तो दिस इज व्हाट सर कॉल्ड एज सुपरस्टिशन, दिस इज कॉल्ड एज सुपरस्टिशन, 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 ठीक है। चलो now sir, let's talk about the perception. In perception disorder you are having illusion and hallucination. Illusion is misinterpretation of the stimulus where you will see, अब तुम्हारे सामने ऐसे रस्सी लटक रही हो तो रस्सी 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 नहीं, तुम बोलोगे सांप सांप सांप, जब वहां जाके देखा तो रस्सी लटक रही थी। भूत भूत भूत, वहां जाके देखा तो शैडो थी। तो मिस इंटरप्रिटेशन ऑफ द स्टिमुलस, मुझे ऐसा लग रहा है पीछे कोई खड़ा है, मुझे ऐसा लग रहा है मेरे साथ कोई चल रहा है, कोई मुझे लगता है जब मैं रात को सोता हूं तो मेरे बगल में आके कोई सो जाता है। These all are what are your illusions. These all are what are your illusion. Then coming to the hallucination, auditory, आवाजें आ रही हैं, मुझे कोई बुला रहा है, that is what are your illusion, ठीक है। Then visual, no stimulus but 3D live clear is there, image is there, no control, no will, and but I know, like in the MBBS Munna Bhai, in the MBBS Munna Bhai there was Gandhi ji coming on its own, going on its own, able to talk, not able to stop, knows he's not there, still able to talk. These all things coming under the visual hallucination. Now the other type of hallucinations are also there, that is coming under tactile hallucination, cockroach on the body. This tactile is associated with the MCQ called as, which toxicity we are talking about? Which toxicity we are talking about, sir? Right here. Which toxicity we are talking about, sir? Right here, sir. Which toxicity? Which toxicity we are talking about, sir? Right here. Tactile hallucination. Cocaine toxicity. Otoscopy, visualizing oneself without the mirror. बिना शीशे के खुद को देख पा रहे हो. Negative otoscopy, no image in the mirror. Image खुद की image ही नहीं बन रही mirror में. Reflex hallucination associated with LSD. फॉर एग्जाम्पल LSD कंज्यूम करने के बाद किसी को लाल रंग दिखा दो तो उसकी दुनिया पूरी ऐसे ट्यूं 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 घूमने लग जाती है. दिस इज व्हाट कॉल्ड एज रिफ्लेक्स हैलुसिनेशन. रिफ्लेक्स हैलुसिनेशन. नाउ नेक्स्ट इज व्हाट्स अ डिलीरियम. डिलीरियम इज नथिंग बट कंफ्यूजन. डिलीरियम इज नथिंग बट कंफ्यूजन. ढीला हो गया दिमाग. द पेशेंट इज नॉट ओरिएंटेड टू टाइम प्लेस पर्सन. दिस इज रिवर्सिबल कंडीशन. इफ नॉट रिवर्सिबल, गो विद द लो डोज एंटीसाइकोटिक. नाउ मोस्ट कॉमन साइकोटिक इलनेस आफ्टर द मेडिकल सर्जरी इज डिलीरियम. थोड़ी देर के लिए आदमी कंफ्यूज रहता है, एंड अगर स्ट्रोक हो जाए तो डिप्रेशन इज गोइंग टू बी देयर. सर नाउ कमिंग टू टर्म्स, दैट इज साइकोसिस एंड न्यूरोसिस. व्हाट इज साइकोसिस, व्हाट इज न्यूरोसिस? लेट्स टॉक अबाउट दिस. Psycho person is there, that means brain is absent, and if brain is absent, no insight, no contact with the reality. Neurosis means some neurons, some brain is present, so insight is present, contact with the reality is present. Okay. And now HD symptom, those are hallucination and delusion. They are present in psychosis, where insight and contact reality is not there. There you will have a hallucination also, you will have a delusion also. And in the necrosis, in the neurosis, they are going to be absent. They are going to be absent. Now extrapyramidal symptoms occur after taking the antipsychotic drug. Extrapyramidal side effects are there of a antipsychotic drug, sir. Right from the initial phase they can happen on the duration basis. Duration कितनी है उसके बेस पे क्या हो सकता है? Sir, acute dystonia is the earliest thing to happen within 1 to 5 days. In this uncontrolled muscle spasm, mostly the face, tongue, etc. Sir, we can give benztropine, sorry, in both of them if eye is involved. अगर आंखें ऊपर रोल हो गई होगी, then we'll use a IM promethazine. Then we give a IM promethazine, sir. Sir, Parkinsonism. Which Parkinsonism, sir? Drug-induced Parkinsonism occur within 1 to 4 weeks. एक महीने के अंदर after the drug initiation. Parkinson-like feature, rigidity, bradycardia, tremors, this will be seen. So acute dystonia, muscle spasms are there. Benztropine you can give. If eye is rolling upside, then you can give IM promethazine. Sir, akathisia occur between 5 to 60 days. तो कम से कम 2 महीने तक हो सकता है. Restlessness, irresistible desire to move around. बार बार उठता है आदमी, एक जगह बैठ नहीं पाता. Beta blocker, benzodiazepine you can give. Neuroleptic malignant syndrome, weeks to month. It takes muscle rigidity, unstable BP, fever, myoglobinemia. Sir, dantrolene sodium. Malignant syndrome, dantrolene CDM is a drug of choice. Late is tardive uncontrolled movement like this. ऐसे ऐसे होने लग जाता है. Sir, this is involuntary movement and VMAT inhibitor like venlafaxine we will give right here. So acute dystonia से लेके we can have a tardive dyskinesia. These are the extrapyramidal side effects. These are what, sir? Extrapyramidal side effects. Done. Now schizophrenia, a very big topic and 100% asked topic in the exam is schizophrenia. My dear friends, schizophrenia, if we talk about, Eugen Buehler has given the terms schizophrenia. He has given 4 A's: autism, autistic personality, having no contact with the reality, and we having a mental retardation also. Ambivalence, slow action is there, slow growth is there, milestone, everything is delayed. Ambivalence, the person who is stuck between yes or no. Affective disturbance, there will be a flat mood. And sir, association loosening, there will be no contact with the reality. So these are the 4 features given by Eugen Buehler. Then coming to the next, positive symptom and the negative symptom. Very important to remember. Positive symptom are the HD symptom, my dear friends. What are the HD symptom we are having? Hallucination and delusion. Hallucination and delusion. And negative symptom we are having 4 A's. What are the 4 A's we are having? Alogia, नहीं बोल रहा. Asocial, socially cut off हो गया. Anhedonia, the previously pleasurable activities are no more pleasurable. अब pleasure ही नहीं आ रहा उनमें, मजा ही नहीं आ रहा. Apathy, no emotional feelings for anyone, sir. This is called as 4 A's which are negative symptom. Alogia, asocial, anhedonia and apathy. Anhedonia and apathy. Sir, first rank symptom ICD-10 के accordingly. There are the 3 thought, hallucination and sir 3 made phenomena. Remember, 3 thought phenomena are thought broadcast. That means person will say, मैं जो सोच रहा हूँ डॉक्टर साहब, that is going out. Then thought withdrawal. सर जो मैं सोच रहा हूँ कोई इसको लेके जा रहा है, अगर कोई सुन पा रहा है दैट इज ब्रॉडकास्ट, लेके जा रहा है विड्रॉल, और मैं नहीं सोचना चाह रहा डॉक्टर साहब फिर भी मुझे सुनाई दे रहा, दैट इज कॉल्ड एज इंसर्शन. फिर भी मैं सोच रहा हूँ वो सब चीजें. ऑडिटरी हेलुसिनेशन सर, ऑडिटरी हेलुसिनेशन सर. हियर द थॉट्स आर ऑडिबल, थॉट्स आर ऑडिबल. सर दूसरा क्या सोच रहा है सर, अब मुझे वो सुनाई दे रहा. सर वॉइस कमेंटिंग ऑन अ पेशेंट, मेरे को कोई आवाजें लगा रहा है. सर 2 लोग बात कर रहे हैं, मेरे को वो सुनाई दे रही है. सर 2 लोग आपस में बात कर रहे हैं दूर, मुझे वो बातें सुनाई दे रही है. सर दिस इज ऑल कॉल्ड एज ऑडिटरी हेलुसिनेशन. एक में उसको लगेगा कि दूसरों की बातें सुनाई दे रही है, एक में उसको आवाज दे रहे हैं, इसमें 2 लोगों की बातें सुनाई दे रही है. मेड फिनोमिना, मैंने नहीं किया, मुझसे कोई करा रहा है. तो क्या करा रहा है? सबसे पहले वॉयलेशन. आदमी सो रहा था, बाहर निकला, डंडा लिया, मार दिया. तो पूछा क्यों मारा, तो बोला मैंने नहीं मारा, किसी ने मुझसे मरवाया है. इम्पल्स, उठा, डंडा लिया, कूदा, दौड़ा, बाहर मार दिया, मुझसे किसी ने मारा. अफेक्ट, अब मैयत में जाके हंस रहे हैं, किसने बोला क्यों हंस रहे हो, तो बोले मैं नहीं हंस रहा, मुझे कोई हंसा रहा है. सो दीज आर द 3 मेड फिनोमिना, 3 ऑडिटरी फिनोमिना एंड 3 थॉट फिनोमिना, माय डियर फ्रेंड्स. हाउ टू रिमेंबर? BV, BWI, दैट मीन बीवी सोचने पे मजबूर करती है. तो दीज आर थॉट फिनोमिना. ठीक है सर. बाकी इसके अंदर आएगा विया, मेड फिनोमिना इज बिया. ठीक है. नाउ सोमैटिक स्पेसिफिसिटी, द पर्सन विल फील दैट ही इज एक्सटर्नली कंट्रोल्ड. मेरा मुझ पे बस नहीं है, मुझे कोई बाहर से मुझे बाहर से कोई कंट्रोल कर रहा है. मेरा दिल चुरा के कोई ले गया है और उस दिल के साथ कोई खेल रहा है. मैं परेशान हो रहा हूँ, मैं उलझ रहा हूँ. Then coming to catatonic, also delusional perception also coming under this. Then catatonic symptoms, increase in excitement, stupor can happen. या तो बहुत excited होगा या बिल्कुल चुप होगा. Echolalia, mimic the examiner's voice is echolalia. Mimicking the examiner's action is echopraxia. Plus posturing will be there, catalepsy. L आ रहा है, L मतलब लकड़ी जैसी, लकड़ी जैसा posture, मतलब hard posture, wax type posture will be there. And if loosening of muscle tone is there, that is associated with narcolepsy, that is cataplexy. नीचे पड़ गया, P for पड़ गया नीचे. कैसे पड़ गया? मसल टोन चली गई. दिस इज सीन इन नार्कोलेप्सी. नार्कोलेप्सी, ठीक है, नार्कोलेप्सी. यस अर्चना जी, बिल्कुल उतना आप रिवाइज कर लीजिए पहले तो. ठीक है. डायग्नोसिस कैसे बनाएंगे साहब? सर डायग्नोसिस में एचडी सिम्टम, फॉर्मल थॉट डिसऑर्डर, सर नेगेटिव सिम्टम 4A's, एलोगिया, सोशल एनेडोनिया, एपैथी एंड कैटाटोनिक सिम्टम जस्ट लाइक स्टूपोर, एक्साइटमेंट, इकोलेलिया, प्रेक्सिया, समथिंग कैन बी देयर. Out of these symptoms, according to ICD-11, if 2 or more than 2 symptoms are present for equal to or more than 1 month, we consider that as schizophrenia. The DSM-5 कहता है 2 or more than 2 symptoms for equal to or more than 6 month, we consider that as schizophrenia. Schizophrenia. Now, sir, हाँ तुम पक्का हो जाओगी, तुम तो पक्का हो जाओगी, ठीक है, डोंट वरी, मेरा पूरा आशीर्वाद आप सबके साथ है, पक्का हो जाओगे आप, ठीक है. टाइप ऑफ स्कीजोफ्रेनिया, ठीक है. टाइप ऑफ स्कीजोफ्रेनिया, सर पैरानॉइड, कैटाटोनिक, सिंपल एंड हेबीफ्रेनिक. माय डियर फ्रेंड्स, वी सी राइट हियर पैरानॉइड स्कीजोफ्रेनिया इज अ मोस्ट कॉमन स्कीजोफ्रेनिया. पैरों से हम मोस्ट कॉमनली चलते हैं. इट इज व्हाट सर? पैरानॉइड स्कीजोफ्रेनिया. पैरानॉइड स्कीजोफ्रेनिया. कैटाटोनिक, बेटा आज रात को ही है, आ जाना, आज रात को मेरी शादी है, तुम्हें पहले दिन से ही बहुत ज़्यादा वो रखा है, टेंशन हो रखी मेरी शादी की, बेटा आज रात शादी है, एवरीवन इज इनवाइटेड, ठीक है, आफ्टर क्लास आओ शादी खेलेंगे, ठीक है. चलिए सर, सिंपल स्कीजोफ्रेनिया. सर स्कीजोफ्रेनिया, सिंपल स्कीजोफ्रेनिया इज हैविंग द वर्स्ट प्रोग्नोसिस. अगर सिंपल लोग फुटते हैं तो देयर विल बी अ वर्स प्रोग्नोसिस, ठीक है सर. हेबीफ्रेनिक स्कीजोफ्रेनिया is bad habits are there. Hebephrenic is bad. Now drugs we give in a schizophrenia, typical and atypical antipsychotics, sir. Typical and atypical, you will see the typical one, they act on the typical D2 receptor, and atypical will act on D2 as well as serotonin receptors, ठीक है. Now what are the drugs you have to remember? कहते हैं haloperidol, chaloperidol, flufenazine, that is haloperidol, chlorpromazine and flufenazine. Chlorpromazine and flufenazine. Atypical is colanzapine, olanzapine, aripiprazole, risperidone and ziprasidone. Sir, all of the antipsychotic is having a common side effect, that is dry mouth. One clozapine is having exception, which is increase in secretion. ठीक है, चलो. Now sir, depression की बात करते हैं. Major symptoms of depression. So schizophrenia is clear to all of you. Positive symptom, negative symptom, formal thought disorder, catatonic symptom, ICD-10, DSM-5 के accordingly we have diagnosed it. Types of schizophrenia, then treatment we have decided of a schizophrenia. Now sir, coming to the depression part, sir. Depression में major and the minor symptoms are there. Major symptom में what we are having, sir? EMI. E stands for loss of energy, low mood and lack of interest, sir. Yes sir, E stands for loss of energy, low mood and lack of, plus there will be a omega sign. There will be what, sir? Omega sign. हाँ बिल्कुल करो यार, करो बिल्कुल. ओमेगा साइन. माइनर एंड मेजर साइन. माइनर साइन में क्या आ जाएगा? या तो बहुत ज़्यादा सोएगा या बहुत कम सोएगा इंसान, या बहुत खाएगा या कम खाएगा, दिमाग काम नहीं करे, कंसंट्रेशन कम होगी, सेल्फ कॉन्फिडेंस चला जाएगा, सुसाइडल थॉट्स आएंगे. सर अकॉर्डिंग टू ICD-10, 2 मेजर एंड 2 माइनर सिम्टम्स इफ दे आर प्रेजेंट फॉर एटलीस्ट मोर देन 14 days, वी कॉल दिस एज डिप्रेशन. Sir, DSM-5 says any 5, that is major, minor, any 5 symptoms are there, then this is what, sir, your depression, 14 days. Treatment is pharmacological and psychological. Psychological is CBT. There is one called as CBT, another called as BT. If counseling के साथ में money is given, or you can say reward is given, then it is called as behavior therapy. Only counseling is CBT. So CBT is better. CBT is better than the pharmacological therapy. So CBT is having more impact. Then if it is not getting resolved, you can add then pharmacological therapy. In that you will add SSRI, and best SSRI we are having fluoxetine. Then one cognitive theory of depression is what given by Aaron Beck, sir. Hopeless, helpless, worthless. Hopeless, helpless and worthless, sir. Hopeless, helpless and worthless, sir. Sir, what is happening right here in the mania? Hypomania and mania. साइकोमेट्रिक एक्टिविटी बढ़ गई, मूड हर टाइम है, सो कम रहा, बातें ज़्यादा कर रहा, अपने आप को बड़ा समझ रहा है, खुश रहता है, चिल्लाने लग जाता है, अनस्टेबल मूड है. Symptom for 7 days are considered as manic episode. Up to 4 days we call this as hypomania. Treatment में atypical, typical antipsychotics. Bipolar affective disorder, if we talk about, sir, BPAD1 and BPAD2. Sir, BPAD1 is MD, that is mania and depression. Treatment is valproate. BPAD2 is HD, sir, hypomania and depression. Hypomania and depression. And overall bipolar disorder, what is the drug of choice for overall bipolar disorder? Can anyone tell me? Overall drug of choice for bipolar disorder, what is going to be? Overall drug of choice for bipolar disorder, this is going to be, sir, lithium. Yes, lithium. Lithium. Very, very nice answer by everyone. Now, let's talk about GAD. GAD stands for Generalized Anxiety Disorder, जो हमें होती है नॉर्मली एग्जाम से पहले, कोई भी कंपटीशन, शादी से पहले, ठीक है? डन. चलो, फ्री फ्लोटिंग एंजाइटी. फ्री फ्लोटिंग एंजाइटी. W for worry. W for worry. A for anxiety. T for increase in muscle tension. जब हम चिंतित होते हैं हमें डर लगता है, मसल टेंशन बढ़ जाती है, कंसंट्रेशन कम हो जाती है. अगर हम डरेंगे तो हमारी कंसंट्रेशन कम हो जाएगी, इसलिए डरना मना है. हाइपर अरोज, इरिटेटेड हो जाएंगे. और ट्रीटमेंट में क्या करोगे? CBT प्लस SSRI, CBT प्लस SSRI, CBT प्लस SSRI, CBT प्लस SSRI. ठीक है. पैनिक अटैक, पैनिक अटैक, पैनिक अटैक. Sudden severe spontaneous attack of anxiety. Impending doom like feeling. Person will feel कि मरने वाला हूँ, दुनिया खत्म होने वाली है. Sir, in this treatment is CBT plus SSRI. CBT is a treatment of choice for all anxiety except phobia, in which we give a behavior therapy. अगर किसी चीज़ से किसी को डर लगता है, उस केस में आप क्या दोगे सर? Behavior therapy. Behavior therapy. In performance anxiety, we give a propranolol. अगर जैसे कभी एग्जाम सेंटर जाने के बाद पाल्पिटेशंस हो रही है, देन वी यूज अ बीटा ब्लॉकर्स लाइक प्रोपेनोलॉल. ओके. अदरवाइज बिहेवियर थेरेपी, एंड इफ इट इज क्रॉनिक पैनिक अटैक, CBT प्लस SSRI इज अ ट्रीटमेंट. नाउ लेट्स टॉक अबाउट द डिफरेंट टाइप ऑफ फोबियाज, माय डियर फ्रेंड्स. सर, नंबर 1 टाइप ऑफ फोबिया वी हैव टू टॉक अबाउट इज निक्टोफोबिया, फियर ऑफ डार्क. एंड फॉर नाइट, नाइट इज डार्क, फियर ऑफ डार्क. ठीक है. किसी को अंधेरे से डर लगता है तो उसको बोलना है आओ तुम्हें इनाम मिलेगा, चलो अंधेरे में चले. ठीक है. डोंट टेक इट अदरवाइज. चलिए. एक्रोफोबिया, आक्रो फ्लाइज एट हाइट, फियर ऑफ हाइट, फियर ऑफ हाइट, फियर ऑफ हाइट, फियर ऑफ हाइट. साइनोफोबिया, C फॉर कैनाइन, कैनाइन टेस्ट कुत्ते के होते हैं, फियर ऑफ डॉग्स. एल्यूरो कैट्स, एल्यूरो कैट्स. सर, एल्यूरो कैट्स हो गया. माइसोफोबिया इज अ फियर ऑफ डर्ट एंड जर्म. जिनोफोबिया X इज अ फियर ऑफ स्ट्रेंजर. थेनेटो इज फॉर डेथ. एगोरा इज फॉर ओपन स्पेस. एगोरा साधु क्या है? ओपन स्पेस में नहीं जाते हैं, ओपन स्पेस में नहीं जाते हैं, डर लगता है ओपन स्पेस से. क्लस्ट्रोफोबिया, फियर ऑफ क्लोज्ड स्पेस. एंड पायरोफोबिया इज अ फियर ऑफ फायर. And in the phobias, the treatment is behavior therapy. Which type of behavior therapy? Desensitization. जैसे अंधेरे से डर लगता था तो अंधेरे में लेके गए, फिर इनाम दिया. ठीक है. जैसे अगर खुली जगहों से डर लगता है तो खुली जगह में लेके गए, फिर इनाम दिया. बंद कमरों में जाने से डर लगता था, वहाँ लेके गए और फिर इनाम दिया. तो लेके गए, इनाम दिया, लेके गए, इनाम दिया. दिस इज कॉल्ड एज डिसेंसिटाइजेशन. फिर किसी को आग से डर लगता, उसको धीरे धीरे आग में लेके गए, फिर उसको इनाम दिया. फिर किसी को हाइट से लगता था, कुत्ते से लगता था, कुत्ते के पास लेके गए, फिर इनाम दिया. तो दिस काउंसलिंग प्लस इनाम प्रोसेस इज कॉल्ड एज. ठीक है. ठीक है. पारस भोपिया, वाह अब्दुल्ला, क्या बात है. पारस भोपिया इज अ फियर ऑफ पारस सर की मैरिज बाय कमेंट सेक्शन. वाह जी वाह, क्या बात है. ठीक है. आज ही है भाई, आज ही है. ठीक है. चलो. Now coming to the obsessive compulsive disorder. Obsessive compulsive disorder, my dear friends. Obsessive compulsive disorder, remember this is ego dystonic, not agreed to self. हाथ साफ है फिर भी अपनी बात नहीं मान रहा. This is behavior therapy plus SSRI, exposure and response. For example, कोई मान नहीं रहा तो उसके हाथों में क्या करना है? हैंडकफ्स लगा देने, अगर हो पड़े हुए आपके पास तो. वरना नहीं हो, किसी के पास शौक कोई नहीं रखता हो हैंडकफ्स का, तो दे पीपल कैन यूज अ रोप. ठीक है, दे पीपल कैन यूज अ रोप और कुत्ते की चेन भी यूज कर सकते हैं उसको हाथ बांधने के लिए, ठीक है। चलो सर, सो दिस इज, अगर कुछ नहीं मिले तो नाड़ा तो होगा, उसको यूज कर लेना, ठीक है। सो दिस इज व्हाट सर योर ऑब्सेसिव कंपल्सन, ठीक है, ठीक है। चलो now hypochondriasis where the patient visit multiple doctors to confirm the diagnosis, ठीक है। PTSD कोई इंसिडेंट हुआ, कार ब्लास्ट जिसमें कोई हादसा हो गया, अब इसके बाद क्या हुआ, इकलौता इंसान बच गया वहाँ से, वो इंसान बचने के बाद क्या हुआ, उसको बार बार वो चीज़ें याद आती थी। 1 महीने तक आएगा तो एक्यूट स्ट्रेस डिसऑर्डर, अगर 30 दिन से ज़्यादा आएगा देन इट इज़ कंसिडर्ड एज PTSD, ट्रीटमेंट इज अगेन CBT प्लस SSRI। डिसोसिएटिव एमनीशिया एंड फ्यूज, amnesia is complete loss of the memory after traumatic incident. Fugue is some person was there, some incident happened and person disappeared, and after 6 months or 1 year you found that person back and he is making assumptions, मैं कहाँ था, कहाँ गया, क्या किया, is not able to tell exactly what he did for that period of time when he was lost, my dear friends, and this is called as dissociative fugue. Adjustment disorder, most of the FMG friends who went abroad they had an adjustment disorder. So DIL, दिल याद रखना, D फॉर डिक्रीज स्लीप, इरिटेबिलिटी, लो मूड, जिनका ज़्यादा रहता है 3 महीने तक, यूजुअली रिजॉल्व बाय 6 मंथ, इफ़ नॉट देन बिहेवियर थेरेपी नीड टू बी गिवन। जैसे मैं पढ़ने गया लखनऊ, मेरा मन नहीं लग रहा था तो मेरे पापा ने मुझे क्या करा, थोड़ा सा काउंसलिंग करी और मुझे एक सैमसंग का टैब गिफ्ट करा, तो मेरा एडजस्टमेंट डिसऑर्डर ठीक हो गया, ठीक है। ऐसे ही जो है एक हर किसी को जो है कुछ ना कुछ इनाम मिलता है तो ठीक हो जाता है, ठीक है। चलो अल्कोहल की बात करते हैं दोस्तों, लेट्स टॉक अबाउट दिस अल्कोहल पार्ट। सर 30 mg पर DL इज अ लीगल लिमिट, 200 से 300 में स्लर स्पीच, 300 के ऊपर पेशेंट माइट कैन डाई और माइट कैन गो इनटू कोमा। नाउ दिस इज समथिंग व्हिच इज इंपॉर्टेंट आई वांट टू टॉक अबाउट, एंड दिस इज अल्कोहल विड्रॉल सिम्टम्स। सर 6 to 8 आवर्स बाद में क्या होता है, देयर इज गोइंग टू बी द ट्रेमर्स, anxiety, nausea, vomiting, yes. So after 12 to 24 hours, alcoholic hallucination. Then after 24 to 48 hour, alcohol withdrawal seizures. There is going to be alcohol withdrawal seizure, alcohol withdrawal seizure. And 2 से 3 दिन बाद क्या होता है, 48 hours are 2 days, 72 hours are 3 days. 2 से 3 दिन बाद होता है डिलीरियम ट्रेमंस, D फॉर डिलीरियम, T फॉर ट्रेमंस, D फॉर डिलीरियम, T फॉर ट्रेमंस, ठीक है। ठीक है, चलो 6 to 8 is tremors, anxiety, nausea, vomiting. Then 12 to 24 hour is alcoholic hallucination. Then 12 to 24 to 48 hours is alcoholic withdrawal seizures, and 48 to 72 hours there is going to be the delirium tremens. These are withdrawal symptoms according to the duration. You should remember for your exam. You should remember for your exam. Remember for your exam. Now let's talk about the next topic called as eating disorders. Eating disorders. My dear friends, eating disorder number 1 is anorexia nervosa. Patient is not eating. Bulimia. Patient is eating but throwing outside. Binge eating. Eating and eating, not throwing outside. So this is all are the problem. We need a cognitive behavior therapy. Need to give a counseling, sir. Counseling, sir. Impulse, irresistible desire to do something. मजा आता है इसलिए कर रहे हैं, पता है गलत है, still we do it because मजा आता है. So in this number 1 is kleptomania. चुराने में मजा आता है चीजें. अच्छे घर का बेटा बेटी है, किसी को पेंसिल चुराने में मजा आता है, किसी को बैग चुराने में, चप्पल चुराने में मजा आता है, किसी को किसी कपड़े चुराने में मजा आता है. This is called as kleptomania. This is called as kleptomania. 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 ठीक है. Then dipsomania, periodic drinking. Dipsomania is what, sir? Periodic drinking. Trichotillomania, pulling the hairs. Mainly females, जब एकदम मजा आता है इनको, क्या गुस्से में होती है, बाल खींचती है अपनी, फिर बालों को खा जाती हैं, तो इसकी वजह से क्या होता है, ट्राइकोबेजोर. क्या होता है, ट्राइकोबेजोर. ठीक है. नाउ सर मल्टीलोमिलिया, इनको जानवरों को परेशान करने में मजा आता है, पता है गलत है फिर भी करते हैं क्योंकि मजा आता है, क्योंकि मजा आता है. ठीक है. चलो, the child psychiatry is the next topic, sir. Child psychiatry is the next topic, sir. ADHD, sir. Attention deficit hyperactive disorder. Sir, what is this ADHD? Boys के अंदर most commonly, boys are easy to distract. अगर कोई भी फेक आईडी बना करके अपनी और आपके चैट बॉक्स में आकर के आपको उल्टा सीधा बोलेगा, तो boys are the people who will distract easily, है ना. and girls are very clever. They will not get distracted easily because for girls 1000 options are there, and for boys in 1000 one time option comes. So boy think after 6 month exam will recome, but this fake or real, it will never come again. So boy give preference to the fake IDs and girls never. Girls knows कि आज पास होने से पहले 1000 ऑप्शन है और पास होने के बाद 1 लाख हो जाएंगे, बट बॉयज गिव प्रेफरेंस टू आज है कल नहीं, ठीक है. दिस इज अ harsh reality. So ADHD is attention deficit hyperactive disorder. Sir, aggressive and destructive behavior 50% 50% जो है प्यूबर्टी तक रिजॉल्व हो जाता है, एंड ड्रग ऑफ चॉइसेस मिथाइलफेनिडेट इफ नॉट गेटिंग रिजॉल्व. कंडक्ट डिसऑर्डर, बच्चा बदतमीज है, स्कूल से निकाला जा चुका, कोई बिहेवियर नहीं है, स्कूल के टीचरों के प्रति कोई इज्जत नहीं है, जानवरों को परेशान करता है. इन सच बच्चा यू डोंट हैव टू डू एनीथिंग, जस्ट कॉल द पेरेंट्स and tell them everything. The parents will take the bacha home and done. This is parent management training. This is what, sir? Parent management training we do in this, sir. Sleep anuresis or bed wetting. Sir, bowel control, bladder control, when they are coming, sir, bowel control is coming at 4 years and bladder is coming at 5 years. 5 years, sir. Okay? 5 years, sir. Chalo. Then, sir, behavior therapy and bladder training. This is what we do, sir. Sir, behavior therapy, bell and pad method. Bell and pad method क्या होता है? जैसे सुसु आता है, गीला होता है, वैसे अलार्म बजने लग जाता है. जैसे ही बेड पे सुसु किया ऐसे ठीक है. ब्लैडर ट्रेनिंग, डिक्रीज फ्लूइड इनटेक इन द इवनिंग में फ्लूइड, वरना ट्रीटमेंट में आप ड्रग्स यूज कर सकते हो. फर्स्ट लाइन डेस्मोप्रेसिन, डिक्रीज द यूरिन प्रोडक्शन. सेकेंड लाइन इमाप्रिन, इंक्रीज एरोजल, मतलब इरिटेबिलिटी बढ़ा देता है, स्फिंक्टर की टोन बढ़ा देता है. तो डेस्मोप्रेसिन यूरिन की प्रोडक्शन को कम कर देगा और अपना इमिप्रिन जो है वो हाइपर एरोज कर देगा, ताकि आपको पता लग जाए. ठीक है, ठीक है, चलो डन. Now personality disorder is of 3 types. What 3 type of personality disorder is? Cluster A, cluster B and cluster C, sir. Cluster A, B and C. Sir, A is paranoid, S for schizoid and S for schizoid. Paranoid is a suspicious personality. Suspicious personality. Suspicious personality. Sir, schizoid is away from social life and schizotypal is stranger or odd behavior. Stranger or odd behavior, sir. Sir, histrionic is attention seeker. Who is attention seeker, male or female? Who is attention seeker? Can you tell me, sir? Who is attention seeker, male or female? Who's attention seeker, male or female? कल शर्ट का कलर अच्छा था. अरे यार, कल शर्ट नहीं पहनी थी बेटा, कल टी शर्ट पहनी थी. ठीक है, चलिए. सर, अटेंशन सीकर्स आर द फीमेल आर द अटेंशन सीकर. ठीक है. एंटी सोशल, नो रिस्पेक्ट फॉर लॉ. नार्सिसिस्टिक इज ग्रैंडियोस और सेंस ऑफ इंपॉर्टेंस, अगेन मेल में होते. बॉर्डरलाइन पर्सनैलिटी इज अनस्टेबल बिहेवियर, अनस्टेबल बिहेवियर. ठीक है, ठीक है, चलो. नाउ क्लस्टर सी इज डिपेंडेंट, डिपेंडेंट, अवॉइडेड एंड ओसीडी. ठीक है. Now, sir, remember, dependent is decrease in self-confident. OCD we have learned about ego dystonic, and avoidant is avoiding the people. Now, mental retardation. Sir, mild is 50 to 69. Let's start from the down, sir. Less than 20, 20 to 34, 35 to 49, and 50 to 69. Mild, moderate, severe, and profound. Mild, moderate, severe, and profound. ठीक है, and profound, sir. ठीक है. Now there is a telemental health program scheme which was asked in the recent exam, that is telemanas, where you can tell your mental problem and they will try to help you out with whatever therapy is needed, sessions are needed, or anything else is needed. They are there to help you out. Telemanas. Nymphomania and satyriasis. Excess sexual desire in a female is called as nymphomania, and sir, satyriasis is excess sexual desire in a male. Excess sexual desire in a male is called as Setri Ashish. Ever किसी का नाम आशीष हो, Ashish is a male, male is having more sexual desire, sir. Now, postpartum depression occur within 3 months, and postpartum blues occur within, this is blues, 2 to 3 weeks. Hallucination along with the symptom of postpartum depression. So, रुक जाओ एक second यार. Here is having a within 3 postpartum blues. Duration within 3 months. Sadness, tearfulness, sleep, anhedonia, suicidal thought. Postpartum depression occur within 2 to 3 months. And this is happening hallucination and delusion along with the symptom of postpartum depression. Postpartum depression. This completes our psychiatry subjects. Now, sir, we are going to start with the medicine subject, and before starting medicine, again a 5 minutes of quick break, water break I'm going to take. Then we are going to start with the internal medicine. Within half an hour we'll bind it up because isme mostly we'll do a PYTs only. Just break for 5 minutes. Welcome back to the final aid by conceptual medicine, my dear friends, and now we are going to start with the 18th subject, and that is going to be taken care as our internal medicine, where we are going to cover 4 to 5 system with very important topics, and we'll conclude this session within half an hour most probably, and be there with me and let's learn this medicine tomorrow together. Not tomorrow, sorry for my word. Internal medicine, first of all, endocrinology we'll talk about, sir. Diabetes mellitus. One question is for sure coming from the diabetes mellitus. Now what this insulin is doing? Insulin is getting secreted by the beta cells and GLUT2 channels in the pancreas, sir. Beta cells and GLUT2 channels in the pancreas. What they are going to do? They are going to shift your glucose from blood to the cells. If glucose is going from blood to the cells are becoming more healthy. That means there is going to be the weight gain. There is going to be the weight gain, and remember, decrease glucose, blood glucose and ketones, and decrease potassium also, sir. Potassium. So insulin is decreasing blood glucose, ketone and potassium also, but remaining, remember, it is leading to the weight gain because insulin is shifting blood from glucose from blood to the cells, my dear friends. Done, sir? Now coming on to the next diabetes mellitus types. It is type 1, type 2, MODY and LADA. What is MODY? Maturity onset diabetes of a young is called as MODY. Latent onset autoimmune diabetes in the adult is called as LADA. One by one we'll be talking about them, sir. Yes, one by one we'll be talking about them, sir. Sir, first of all, we are going to talk about what is going to happen in the diabetes mellitus. Sweet urine is going to, this is called as polyuria. The glycosuria is going to happen. Sir, this is insulin related. There will be a insulin related. There is going to be the polyuria, polydipsia. Weight loss. If diabetes is going to happen, the insulin is not working. The main function of insulin was to shift the glucose from blood to the cells. Now insulin is not there, so in diabetes mellitus what will happen? The cells will crave for the glucose because they are not getting the glucose. जो उनको देने वाला था वो दे नहीं रहा. That is why there is a weight loss in the diabetes mellitus. There is a weight loss in the diabetes mellitus. Now coming to the next term called as diabetes insipidus. Insipidus is two type: neurogenic and nephrogenic. Neurogenic is when desmopressin is not when the antidiuretic hormone is not getting what, sir? Released. And nephrogenic is when vanilloid receptors are present there, they are not working properly. That is called as vanilloid receptor. Okay? Vanilloid receptor is there. Now how to diagnose the diabetes? We are having a range right here with us, sir. Fasting and glucose tolerance test, HbA1c. Sir, fasting blood sugar is a screening of choice, but the best test is HbA1c. Now, what are the normal values we should remember for the exam? If you see normally, fasting blood glucose should be less than 100. Sir, yes, and in the glucose tolerance test, it should be less than 40 normally, and HbA1c less than 5.6 is considered normal. But in the diabetes mellitus, if you see, sir, diabetes mellitus, the fasting glucose is more than 126. Glucose tolerance test, that is after giving the 75 gram of the glucose levels are going after 200, sir. And sir, the HbA1c is, they see both the things are there. Someone is saying 6.5. The latest is coming with 7.5, more than 7.5. So what is a impaired range? That it is a khatre wali ganti where lifestyle modification is required, my dear friends. Here is impaired is 100 to 125. 140 to 199, the range between these two. So this is how the parameters we have to remember for the exam. कि इस वाले parameter से हिला तो we'll consider this as diabetes mellitus. Now diabetes mellitus type 1 and type 2 if we talk about, sir, type 1 is autoantibody related, sir. GAD, ICA, HLA, D34, DQ1, and receptor defect is seen in diabetes type 2. So insulin dependent is type 1, independent because receptor defect is there, that is why type 2. Type 1 is most commonly seen in the young people, and type 2 is most commonly with the old obese people with the insulin resistance. Now sir, other than that, in the type 1 insulin levels are low, and in the diabetes type 2 insulin levels are high but receptors are not working fine. Family history is absent in type 1, but in family history is present in type 2, sir. Type 2, sir. Type 2, sir. Now let's talk about this LADA. What is this LADA? This is a latent autoimmune diabetes in the adult. That means type 1 diabetes of old people. Type 1 should be in the young people, but now type 1 is happening, that is insulin in the old people. This is called as LADA, where GAD antibodies are present. GAD antibodies are present, sir. Then, sir, coming to the MODI, maturity onset diabetes of the young, where you will see type 2 diabetes, which is what, sir, your insulin independent, that is happening in the young people. That is called as MODI. There is a gene mutation. There is a HNF alpha gene mutation you are going to see. Alpha gene mutation. This is autosomal dominant. Autosomal dominant. Now, sir, the diabetes mellitus 1 is there. So we will give the insulin. We will give what, sir? Treatment में क्या देंगे, sir? Insulin देंगे. और longest acting insulin is going to be, sir, D-gludic. D-gludic will give, sir. Right here, sir. Coming to, sir, diabetes 2. Diabetes mellitus 2 अगर refractory है, sorry, in the one only, if it is refractory, then we'll give, sir, longest acting insulin, sorry, longest refractory D-gludic, longest acting will give, sir. Okay, then, sir, remember, normally हम normal देंगे, and if it is refractory, we'll give a long acting insulin. Different type of insulins are there that I'll not talk right here, sir. So diabetes mellitus type 2, lifestyle modification. Sir, drug of choice if we talk about, sir, metformin. Side effect lactic acid. Sulfonylureas will give, sir. Sulfonylureas potassium channel के through क्या करते हैं? Insulin channel उसको बढ़ाते हैं. Increase insulin by closing the potassium channel. Tolbutamide, glibenclamide. Tolbutamide, ठीक है. Thiazolidinedione, TZ, decrease resistance to the insulin, because insulin पर्याप्त मात्रा में पड़े हुए हैं, तो इसकी रेजिस्टेंस को कम कराता है. कैसे रेजिस्टेंस कम आती है? अगर आप डेली पीने लग जाते हो तो रोज ही पियो. रोजीग्लिटाजोन एंड पियोग्लिटाजोन. रोजीग्लिटाजोन एंड पियोग्लिटाजोन. रोजीग्लिटाजोन, पियोग्लिटाजोन. नाउ सर, AGI, अल्फा ग्लूकोसाइडेज इनहिबिटर, ये स्टार्क एब्जॉर्प्शन को कम कराते हैं. ए कार्बोस, है ना. ड्रग्स लाइक एक एंटी क्रेविंग ड्रग्स भी होते हैं, सर. ए कार्बोस, एकम्प्रोसेट, ठीक है. DDP4 इनहिबिटर, DDP4 इनहिबिटर, ठीक है. इन दिस सीता, साक्षा, रीता, विल्डा, ग्लिप्टिन्स आर देयर, सर. ठीक है. नाउ कमिंग टू SGLT2 ब्लॉकर्स. SGLT2 ब्लॉकर्स में क्या है? डिक्रीज ग्लूकोज रीअब्जॉर्प्शन फ्रॉम द किडनी. काना एंड डापा, ये ग्लूकोज को किडनी से ही रीअब्जॉर्ब नहीं होने देते हैं, ठीक है. वहाँ से एब्जॉर्प्शन कम करा देते हैं भाई. SGLT2 channels. Remember, Kana and Dapa. Type 1 and type 2 both drugs can be used. Acamprosate and pramlintide we can use, sir. Pramlintide we can use, sir. Done, sir. Now let's talk about the diabetic ketoacidosis. तो डिफरेंट ड्रग्स इन द डायबिटीज. इंसुलिन कब देना है, मोडी क्या है, लाडा क्या है, एक ओवरव्यू वी हैव टेकन. नाउ सर, चलो, डायबिटिक कीटोएसिडोसिस. सर, डायबिटिक कीटोएसिडोसिस, metabolic acidosis with the increase in iron gap. Sir, it is acidosis. The pH is becoming less than 7.3. Bicarbonates are also becoming less, that is less than 24. Blood sugar is increasing more than 25 milligram %. Sir, then ketone is coming in. Yes, ketone is coming in blood and urine. Important. रेस्पायरेशन में खुशबू आ रही है, दैट इज कू स्मॉल ब्रीदिंग, स्वीट स्मेलिंग. हार्ट रेट बढ़ जाता है, सर. इसके अंदर हार्ट रेट क्या हो जाता है? बढ़ जाता है, और बीपी कम हो जाता है. दीज आर द फीचर्स ऑफ डायबिटीज किटोसिस. ट्रीटमेंट में क्या करेंगे? IVNS, नॉर्मल सलाइन पहले देंगे, प्राइमरी ट्रीटमेंट, और फिर उसके अंदर क्या डालेंगे? इंसुलिन एंड बाइकार्बोनेट फॉर द एसिडोसिस. नाउ सर, एड्रीनल ग्लैंड. भाई तू दिमाग खराब हो गया, पढ़ लो यार. क्या कर रहे हो भाई? दे अपने सर को एनॉय कर रहे हो, नोटी हरकतें करके, है ना. चलो, एड्रीनल ग्लैंड कॉर्टेक्स से क्या सिक्रीट होता है, सर? स्टीरॉइड. और सर कॉर्टेक्स के से क्या सिक्रीट होएगा सर? स्टीरॉइड। और मेडुला से क्या सिक्रीट? मेडुला के क्रोमैफिन सेल से क्या सिक्रीट होता है? कैटाकोलामाइंस लाइक एपिनेफ्रिन, नॉन एपिनेफ्रिन एंड डोपामिन, नॉन एपिनेफ्रिन एंड डोपामिन, सर ये एड्रिनल ग्लैंड की सिक्रीशन से इंपॉर्टेंट, स्टीरॉइड एंड कैटाकोलामाइंस सर। नेक्स्ट इज फियोक्रोमोसाइटोमा। जब कैटाकोलामाइंस बढ़ जाते हैं, दिस इज कॉल्ड एज फियोक्रोमोसाइटोमा, इसके अंदर बढ़ते हैं। क्लासिकल ट्राइड इज देयर। व्हाट ट्राइड इज देयर ऑफ अ फियोक्रोमोसाइटोमा? अलोंग विद मी, यस, palpitation, increase in sweating and headache. Palpitation, increase in sweating and headache, plus postural hypotension will be there. For that, midodrine is a drug of choice. Screening is 24-hour fractional urine metanephrine. ठीक है? And best is plasma metanephrine. And best is plasma metanephrine. Plasma metanephrine. Thank you. चलिए सर, मेटास्टेसिस के लिए क्या चेक करेंगे सर? पेट स्कैन, 18FDG रेडियो आइसोटोप. If we talk about the investigation of choice, sir, investigation of choice we are going to do, sir. Investigation of choice we are going to do. We done, sir. Treatment की बात कर रहे सर. Treatment of choice. This is treatment of choice is surgical resection. Surgical resection. पर अगर आपको देना है drugs, so pre-op, intra-op and post-op, all three are different. All three are different, my dear friends. Remember, if pre-op is there, orally phenoxybenzamine, intra-op phentolamine IV. Never give beta blockers in this, sir. Intra-op, sir. Then post-op labetalol is a drug of choice. So phenoxybenzamine is a pre-op drug of choice. Intra-op is phentolamine and post-op is labetalol. Post-op is what, sir? Your labetalol. Now coming to the Cushing syndrome. Cushing syndrome. चलो, Cushing syndrome means increase in cortisol from the adrenal gland. So what is happening right here in the Cushing syndrome? पिगमेंट होता है, ठीक है, पिगमेंट होता है. ACTH बढ़ेगा तो पिगमेंटेशन इज प्रेजेंट, डार्क पिगमेंटेशन इज प्रेजेंट. और कैसा पिगमेंट होता है? इफ यू सी राइट हियर सर, हाउ द कुशिंग सिंड्रोम पेशेंट इज गोइंग टू प्रेजेंट. कोई थ्योरी समझ नहीं आ रही, कुछ नहीं आ रहा. मोटा पेट, पतली टांगे, मोटी गर्दन और यहाँ पे पिगमेंटेशन हो रखी होगी. दिस इज अ टिपिकल केस ऑफ अ कुशिंग सिंड्रोम. इन्वेस्टिगेशन के अंदर व्हाट यू आर गोइंग टू डू सर? इन्वेस्टिगेशन में 24-hour cortisol level, normally it increase more than 3 times if it is increasing, you will think of a Cushing syndrome. Dexamethasone suppression test, इसको दे के देखना है cortisol के level कम हो रहे हैं कि नहीं हो रहे हैं. This is what we check in this. Now Cushing disease and Cushing syndrome, if ACTH are high, the diagnosis is MRI पे pituitary edema, transsphenoid resection will do. If Cushing syndrome में लो ACTH होंगे तो MRI में adrenal adenoma होगा, तो ट्रीटमेंट में क्या करोगे? रिसेक्शन. And also using the steroid एकदम से नहीं छोड़ने हैं, you have to taper the dose. So 2 things are there. Cushing disease में आपका हाई होता है ACTH, सिंड्रोम के अंदर लो होता है. डी के अंदर हाई होता है, सिंड्रोम के अंदर लो होता है. अकॉर्डिंग टू दैट MRI पे डायग्नोसिस अलग होता है. इफ कुशिंग डिजीज इज देयर, इट इज पेट्रोटरी एडिनोमा, एंड इफ रिमेंबर सिंड्रोम इज देयर, देयर विल बी एड्रेनल एडिनोमा, एंड ट्रीटमेंट्स आर अगेन बोथ डिफरेंट सर. देन कमिंग टू द एडिशन डिजीज. एडिशन के अंदर क्या होता है सर? एडिशन डिजीज के अंदर क्या होता है सर? यहाँ पे देखिए, एड्रेनल इनसफिशिएंसी. So your cortisol is low and aldosterone is also low. Because cortisol is low, there is going to be the decrease in BP, metabolic acidosis. If aldosterone is low, sodium is less. Sodium is opposite to the potassium. If sodium is going to less, there is going to be the salt craving, plus potassium is going to be the high. अगर पोटेशियम हाई होता है तो हाइपोग्लाइसीमिया कराता है सर. रिमेंबर दिस थिंग सर, हाइपोग्लाइसीमिया कराता है सर. नाउ कमिंग टू द नेक्स्ट वन. If serum sodium levels, how much they should become? If they are less than 125 milliequivalent, then we go for ACTH stimulation test. Dexamethasone suppression test we did in the Cushing syndrome. Here in the addition we are giving the ACTH stimulation test. ACTH, and treatment is hydrocortisone. एक steroid देना है हमें, plus we have to give the fluids. Addition crisis होंगे तो IV hydrocortisone देगा. Now कौन syndrome में सारी चीजें ऑन हो जाती है? ऑन हो जाती है तो सोडियम इज हाई एंड पोटेशियम इज लेस सर, सोडियम इज हाई। एडिशन के अंदर उल्टा होता है, सोडियम इज लेस, पोटेशियम इज हाई। प्लस स्क्रीनिंग में एल्डोस्टेरॉन रेनिन रेशियो विच इज इंक्रीज मोर देन 750 सर, विद इन 750 सर। कंफर्मेशन इज सलाइन इन्फ्यूजन टेस्ट एंड ट्रीटमेंट में स्पाइरोलैक्टोन एप्लेरॉन देंगे सर, स्पाइरोलैक्टोन एप्लेरॉन देंगे सर। नेक्स्ट इज हाइपर पैराथायरॉइडिज्म। हाइपर पैराथायरॉइडिज्म में बोन रिजॉर्प्शन हो रहा होगा, पैराथायरॉइड हार्मोन बड़ा होगा, सीरम कैल्शियम बड़े होंगे, स्टोन फॉर्मेशन के चांसेस ज़्यादा रहते हैं, बोन रिजॉर्प्शन हो रहा है। अगर बोन रिजॉर्प्शन अगर आपका उंगलियों से होगा, ब्राउन्स ट्यूमर, स्कल में सॉल्ट एंड पेपर अपीयरेंस, स्पाइन के अंदर आपका वर्टिब्रा में रगर जर्सी स्पाइन देखने मिलेगी सर इसके अंदर। सर ट्रीटमेंट में क्या देंगे सर, लूप डायरेटिक एंड सीला कैलेट। सीना कैलेट क्या कराता है, ऑर्थोपेडिक में भी पढ़ाया था, इट इज गोइंग टू डिक्रीज योर पैराथायरॉइड हार्मोन। नाउ हाइपोपैराथायरॉइडिज्म, if there is a hypoparathyroidism, the serum calcium levels are going to be less, so hypocalcemic tetany can happen. If hypocalcemic tetany can happen, there is going to be Trozier sign and Chostic sign. इस केस में क्या करना है, 10% कैल्शियम ग्लूकोनेट IV देना है, 10% कैल्शियम ग्लूकोनेट आपको क्या देना है, IV। Then coming to the next is thyroid. Next is coming what sir, thyroid. Thyroid sir, remember iodide and iodide is adding together, ठीक है, it is adding together and converted to iodine I2. Remember it is done with the help of thyroperoxidase. Then iodine with the tyrosine making MIT DIT. Sir MIT and DIT they are making T3, DIT they are making T4. More active is T3 than the T4, and T4 which is less active, it will be converted into more active with the help of 5-deiodinase, with the help of 5-deiodinase, which is more active. Now if you have to stop it, if you have to stop the conversion, मतलब hyperthyroidism हो रहा है, then you will block this and block this. So blocking this drug is going to be carbimazole, methimazole, and if you need to do the another form of treatment, that is 5-deiodinase inhibitor, that is going to be the propylthiouracil, which is a drug of choice in case of a first trimester pregnancy. A primary hyperthyroidism and secondary hyperthyroidism, how the things are going to be and how the disease is going to present you. Sir, in the primary hyperthyroidism, remember T3 is high, TSH is low. And in the secondary hyper is the T4 is high and T3 is low. Along with that, remember here, sorry, in the secondary hyperthyroidism, both are high, sir. Sir, sorry, again, in the primary, T4 is high, TSH is low. In the secondary, T4 and TSH both are high. If both are high, pituitary adenoma. If T4 is high, TSH is less, grave disease. This is what, sir, your grave disease, sir. Grave disease. RAIU stands for radioactive iodine uptake, to check the activity of follicles. Iodine 123, 31 and 99 technetium, sir. For the test and diagnosis, for the ablation, and for again it will be used as a diagnosis part. So 123 and technetium 99 is for diagnosis, 131 is for the ablation. Graves disease, type 5 hypersensitivity reaction. Sir, in the primary hyperthyroidism, T4 will be high, TSH will be low. Autoimmune condition, so you will have autoantibodies like LATs, HLA-D, R3, then B8, these kind of antibodies you are going to see. Clinical feature mein, you will see the LDOG, lid lag sign, or lid lag of a dog, sir. Lid lag of a dog, sir. Remember? Now, treatment in the young is anti-thyroid drug like carbimazole. What is the mechanism of action of carbimazole, my dear friends? Can you tell me in the chat box? What is the mechanism of action of carbimazole? TPO inhibitor. And old people, we do subtotal thyroidectomy or radioisotope ablation we are going to do, sir, right here. If we talk about the thyroid storm, there is an increase in sympathetic activity. Palpitation वगैरह होएगी. For that we can give a beta blocker. Hydrocortisone दे सकते हैं. And propylthiouracil we can give, which is 5-deiodinase inhibitor. IP inhibitor. Dandana. डन सर. नेक्स्ट इज हाशिमोटो थायराइडिटिस. हाइपोथायराइडिज्म होता है इसके अंदर कौन सी एंटीबॉडीज देखने मिलेगी सर आपको? HLA-DR3 एंड DR5 टाइप 2 हाइपर सेंसिटिविटी. एंटी TPO एंटीबॉडीज आर आल्सो सीन सर. एंटी TPO एंटीबॉडीज आर आल्सो सीन सर. हिस्टोपैथ में हाशिमोटो में क्या देखना? हार्थल सेल. हाशिमोटो में पहले तो हाइपरथायराइडिज्म होता है और बाद में क्या होता है? हाइपोथायराइडिज्म. तो पहले जब हाइपरथायराइडिज्म होता है बीटा ब्लॉकर प्लस PT you will give. Later hypothyroidism is there, levothyroxine we give for the hypothyroidism. Early morning dose we have to give sir. Done sir. चलिए. Now sir, another two are there for you, small. One is subacute decuvirian viral infection in which first hyper, later hypo, then it will come normal. Riddle syndrome is a fibrosis of a thyroid. And clinical feature is going to be hypothyroidism, dysphagia and hoarseness of voices because there is an involvement of the recurrent laryngeal nerve. Now coming on to the next topic called as neurology. So important previous year topics we have covered in the endocrinology. Now let's talk about the neurology. Sir, headache. Number one type of headache we have to talk about is tension headache, my dear friends. Tension headaches. Primary. Sir, bilateral condition seen in female more than the male. ठीक है, ऐसा मैं नहीं, ऐसा किताब कह रही है. ठीक है, नथिंग पर्सनल. कंप्रेशन लाइक फीलिंग, ऐसा लगता है जैसे माथे पे कोई दबा रहा है गंदा. ट्रीटमेंट इज NSAID. ट्रीटमेंट इज व्हाट सर? NSAID. क्लस्टर हेडेक. क्लस्टर इज लाइक साउंडिंग लाइक अ लस्टी. हु इज वेरी लस्टी? मेल इज वेरी लस्टी. और एक तरफा ही लस्टी होता है तो यूनिलैटरल होती है. तो क्लस्टर हेडेक इज व्हाट सर? योर यूनिलैटरल हेडेक. क्लस्टर हेडेक इज व्हाट सर? योर यूनिलैटरल हेडेक. डन सर. सर, साइन एंड सिम्टम ऑफ अ लस्टी में मल्टीपल अटैक करता है लस्ट के ये. ठीक है, और इसके अंदर आंखें लाल हो जाती है और देख के क्या हो जाती है? लाल हो जाती है, दर्द होने लगते हैं, राइनोरिया होने लग जाता है, नाक से पानी बहने लग जाता है, आंख से पानी बहने लग जाता है और क्लस्ट्रोफोबिया, डरने लगने लग जाता है, लाइट सेंसिटिव हो जाती है आंख ज़्यादा. ठीक है साहब. नाउ ट्रीटमेंट इज हाई 100% ऑक्सीजन. अगर दिस ए क्लस्टर हेडेक प्लस ट्रिप्टैन ड्रग्स विल गिव. ट्रिप्टैन्स क्या करेंगे? वैसो कॉन्स्ट्रिक्शन एंड रिलीव द हाइपोक्सिया. ट्रिप्टैन्स विल डू द vasoconstriction and relieve the hypoxia sir. Then coming to the migraine, this is again a unilateral but in a female more common than male. The clinical feature is pound right here sir. Pound याद रखना है. इसके अंदर क्या है? पाउंड के अंदर सर पल्सल्टाइल, फोटोफोबिया. पल्सल्टाइल होती है इसे दब के होती है. ड्यूरेशन 1 day तक में होती है. ठीक है. यूनिलैटरल नोजिया, वॉमिटिंग, डिसेबिलिटी, काम करने से रोकती है, आप डेली एक्टिविटीज नहीं कर पाते हो. ठीक है, चलो ठीक है, डन. माइल्ड टू मॉडरेट होगा तो ट्रीटमेंट इज NSAIDs. मॉडरेट टू सीवियर होगा तो ट्रिप्टैन्स. ठीक है. ट्रिप्टैन्स दे एक्ट ऑन सेरोटोनिन रिसेप्टर्स एंड दे आर गोइंग टू डू द वेसोकॉन्स्ट्रिक्शन. प्रोफिलैक्सिस में क्या दोगे सर? प्रोपेनलॉल. प्रोफिलैक्सिस में क्या दोगे? Propranolol. Now let's talk about the next one, that is Prion's disease. Prion's disease, if we talk about sir, due to abnormal and infectious protein, beta sheets are seen, can lead to a mad cow disease, Kuru and CJD. Sir, these all are having a 100% mortality rate because of prions के अंदर जितने भी है 100% mortality rate is there. My dear friends, remember CJD के अंदर Creutzfeldt-Jacobson disease, sporadic by meat, जेनेटिक बाय म्यूटेशन. EEG पे क्या देखने मिलेगा आपको? स्पाइक पैटर्न. कैसा पैटर्न देखने मिलेगा? स्पाइक पैटर्न, शार्क स्पाइक पैटर्न. ठीक है. देन MRI पे हॉकी स्टिक अपीयरेंस. इफ यू कैन राइट, सी साइड, दिस इज हॉकी स्टिक अपीयरेंस. You are going to see, and ribboning of a cord. No treatment, person will die within 6 months to 12. तो Prion's disease का कोई ट्रीटमेंट नहीं है, person will die 100%. Next coming, Alzheimer's. Temporoparietal lobe is damaged. Sir, cause is ApoE4, ApoE2. So ApoE4 और E2 में डिफरेंस है. एक causative है, एक कौन सा है हमारा? प्रोटेक्टिव. तो E4 is causative and E2 is protective. E2 is what sir? Your protective factor. Sir, here you will see Hirano bodies in the hippocampus. Again a one-liner important for your exam sir. Hirano bodies in the hippocampus, my dear friends. Pathology is A beta amyloid and tau protein. A beta amyloid will make the senile plaques and tau protein will make the tangles. क्लिनिकल फीचर एल्जाइमर के भाई मेमोरी का दिक्कत होगी, बोल नहीं पाएगा, नॉलेज का, मोटर फंक्शन, मायोक्लोनिक जर्क्स विल हैपन. And MRI पे what will happen? The ribboning on the cortex, ribboning in the cortex, and enlarged ventricle. If you can appreciate right here, there is an enlargement of the ventricles. अब drug of choice क्या दोगे? Donepezil, which increase acetylcholine, which increase what sir? Your acetylcholine. Then sir, seizure disorder. We have already talked about seizure disorder. Let's skip it. That's all. Let's talk about the basal ganglia disorder now, sir. Next is what's a basal ganglia disorder. Sir, basal ganglia disorder, if we talk about, sir, Huntington disease, loss of GABAergic there is increase in a dopamine activity. Triple nucleotide repeat is there, this is CAG. Huntington में क्या होता है? Abnormal movements होती है sir. And MRI में box in car ventricle, you are going to see Huntington chorea, abnormal eye movement, psychosis, and drug of choice is tetrabenazine. Drug of choice in Huntington is tetrabenazine. नाचने वाली बीमारी कौन सी है? हंटिंगटन. क्या रिपीट होता है? कौन सा ट्राइन्यूक्लियोटाइड रिपीट होता है सर? कैग. डोपामीन एक्टिविटी बढ़ जाती है क्योंकि गाबाजेनिक न्यूरोजन लॉस होने लग जाते हैं. ठीक है, चलो लेट्स टॉक अबाउट द पार्किंसन डिजीज नाउ सर. एल्जाइमर इज दिस मास्क लाइक फेस. डोपामीन कम हो गया, एस्टिल बढ़ गया, ACH एस्टिलकोलिन बढ़ गया, मूवमेंट कम हो जाती है, टोन कम हो जाती है, और गेट कैसा होता है? फेस्टिनेटिंग या शफलिंग गेट हो जाता है सर. इसके अंदर फेस्टिनेटिंग या शफलिंग गेट हो जाता है. डिक्रीज इन मूवमेंट में ब्रेडिकार्डिया एंड हाइपोकाइनेसिया, स्लो मूवमेंट. ब्रेडिकाइनेसिया नॉट कार्डिया. ब्रेडिकाइनेसिया इज अ स्लो मूवमेंट एंड हाइपोकाइनेसिया इज अ स्मॉल मूवमेंट. रिजिडिटी होने लग जाती, कैसी? लेड पाइप रिजिड. रेस्टिंग ट्रिमर आने लग जाते हैं. गेट फेस्टिनेटिंग, ऐसे घिसने वाला गेट होने लग जाता है. देन ल्यूई बॉडी इज सीन. सर एल्जाइमर में क्या देखने मिलती है सर? हिरानो बॉडीज इन द हिप्पोकैम्पस. हियर यू आर गोइंग टू सी द ल्यूई बॉडी. एंड ट्रीटमेंट में सर अमंटाडीन, एल-डोपा, बेंस्ट्रोपिन, बेंजहेक्सोल, कार्बिडोपा, रोपेनेरोल, गिलिन एंड एंटेकापोन. So these mnemonic is a man loves Benz car, rolling, glowing, not park. These are the names of the drugs you have to remember for the exam. Sir, drug of choice for the patient more than 50 years is L-dopa plus carbidopa. And there is a side effect called as on and off phenomena for this drug of choice is safinamide. And permanent management for this Alzheimer, Parkinson disease is going to pallidotomy or deep brain stimulation. Now sir, atypical Parkinsonism having the two diseases in this. Remember, one is Pushpa disease. PSNP, that is progressive supranuclear gaze palsy. What is happening right here? Damage to the longitudinal fasciculars, not able to look down. आदमी को नीचे नहीं दिखता है, खाना भी गिर रहा है, सीढ़ियां ढल नहीं पाता है. So those are the problem happening in the EOG. You will see in the EOG square wave pattern you are going to see, plus MRI में hummingbird sign, kingfisher वाला. मल्टी सिस्टम एट्रोफी, ब्रेन स्टेम एंड सेरिब्रल एटेक्सिया होने, ब्रेन स्टेम चलेगी, इसके अंदर ब्रेन स्टेम इज इन्वॉल्व सर. देन सेरिब्रल एटेक्सिया इज ऑल्सो सी. ये नहीं भी याद करो सेरिब्रल. अच्छा, इसके अंदर सेरिब्रल लीजन इज वेरी इंपॉर्टेंट. बेजल गैंग्लिया में ये एटिपिकल वाला में ये पुष्पा झुकेगा नहीं वाला याद रखना. देन कमिंग टू द सेरिब्रल वाला सर, सेरिब्रल पार्ट सर. सर वी टॉक द सेरिब्रल का काम क्या होता है? कोऑर्डिनेशन. सीधा चल रहा है कि नहीं, हैंड आई कोऑर्डिनेशन है कि नहीं, दिस ऑल थिंग्स आर टेकन केयर बाय द सेरिबेलम. तो टेस्ट आर गेट विल बी ड्रंकन गेट, फिंगर नोज टेस्ट, स्लर स्पीच, निस्टैग्मस विल बी देयर. तो सेरिबेलल लीजन से ये दिक्कत हो सकती है. देन देयर विल बी ए फेड्रिक्स एटेक्सिया सर. दिस इज अपर एंड लोअर मोटर बोथ मिक्स्ड palsy. There is a Friedrichsen gene on chromosome number 9 which is getting damaged right here. परेशानी हो रही है इसमें. GA gene repeat trinucleotide is there. Romboc test is positive. That means patient falls down on closing the eye. This is a diagnosis of a Friedrichs ataxia sir. ठीक है. Now stroke की बात करेंगे सर. upper motor neuron is involved. सर stroke more than 24 अगर non focal neurological deficit 24 घंटे से ऊपर होगा, 24 घंटे के ऊपर हो जाएंगे, ब्लड सप्लाई नहीं मिल रही, ऑक्सीजन नहीं मिल रहा, देन इट इज गोइंग टू कंसिडर एज स्ट्रोक. अगर 24 घंटे के अंदर होता है दैट इज कंसिडर एज ट्रांजिएंट इश्केमिक स्ट्रोक. नाउ दिस इज डिवाइडेड इनटू टू, इश्केमिक एंड हेमोरेजिक, दैट वी ऑलरेडी डिस्कस इन द रेडियोलॉजी पार्ट. इश्केमिक का मोस्ट कॉमन कॉज वाज थ्रोम्बोएम्बोलिज्म. ठीक है. इश्केमिक in the NCCT ischemia will look more blackish or grayish color. Okay, brain tissue will look like a grayish color. Hemorrhagic, it will look more calcified and the causes are hypertension, SDH, EDH. The most common type of hypertensive bleed is going to be the putamen. The vessel involved in the mid-cerebral artery, clasp knife spasticity will be there, circumduction gait will be there. ऐसे 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 चलेगा आदमी इस तरीके से, है ना, ऐसे ऐसे टांग करके चलेगा इधर उधर से, है ना. Then Babinski sign is also positive for the there is the fanning of the finger. तो ये सारे फीचर किसके हो गए आपके, स्ट्रोक के. ठीक है. नाउ कमिंग इन्वेस्टिगेशन, एनसीसीटी, एमआरआई करा सकते हैं, सेरेब्रल एंजियोग्राफी करा सकते हैं. अगर ये हाइपरटेंसिव की वजह से होगा तो निमोडिपिन देनी है, दैट इज टू कंट्रोल द बीपी, कंट्रोल द बीपी. एंड इफ इट इज इस्केमिक थ्रोम्बोलाइसिस, you had tissue plasminogen activators like retaplase, streptokinase, aspirin, clopidogrel, blood thinners देने हैं आपको. तो ये सारे इश्कीमिया वाले में देने हैं. हेमोरेजिक वाले मेन कंट्रोल इज टू कंट्रोल द बीपी, एंड हेयर यू कैन गिव निमोडिपिन ऑल्सो, एंड इफ नॉट वर्किंग यू कैन ऑल्सो यूज लेबेटालोल एंड निकार्बिडिपिन, लेबेटालोल एंड निकार्बिडिपिन. ठीक है. चलो मेनिंजाइटिस की बात करें सर. मेनिंजाइटिस, दिस ऑल्सो वी हैव ऑलमोस्ट कवर इन द माइक्रो पार्ट ऑल्सो. ठीक है. लाइक HIV पॉजिटिव पेशेंट, मोस्ट कॉमन कॉज ऑफ मेनिंजाइटिक क्रिप्टोकोकस नियोफॉर्मिन्स. नाउ द कॉजेज आर गिवन डिफरेंट, 0 to 2 month E. coli, overall most common E. coli, but in the world it is A. galacti. Then 2 month to 2 year adult cause is pneumococcus pneumoniae. All age group E. coli, adult specifically pneumococcus pneumoniae. These are the two things you just remember. ठीक है. Now टेलिंग अबाउट द कर्निग एंड ब्रुजेंकी साइन. एक बार गर्दन अगर झुकाओगे तो पैर भी फ्लेक्स हो जाते हैं. ठीक है. दिस इज कॉल्ड एज ब्रुजेंकी साइन. ब्रुजेंकी साइन यू कैन सी हियर ऑन फ्लेक्शन. ब्रुजेंकी इज गर्दन उठाने पे टांगे फ्लेक्स हो जाती. कर्निग इज व्हेन यू आर फ्लेक्सिंग द लेग यू आर नॉट एबल टू एक्सटेंड इट, यू आर नॉट एबल टू एक्सटेंड इट. दिस इज कॉल्ड एज कर्निग साइन. Now again, how you will diagnose? If intracranial pressure is high, we will not go. If intracranial tension is high, will not go for the lumbar puncture. In that, we'll do the CT scan. In that, we'll do the CT scan. But we have to do the lumbar puncture. And lumbar puncture, if we remember, sir, low glucose is there, bacterial. Normal glucose is there, virus. A cog-wag pattern is there, lymphocyte is high. Then is TB meningitis. So 3 ways to diagnose the meningitis is also clear, sir. Treatment based on the cause. If pneumococcus meningococcal, penicillin G, pseudomonas, ceftazidime, cryptococcal, amphotericin B plus flucytosine. ये कल भी माइक्रो के अंदर I have taught you, sir. Gram negative में again ceftriaxone, IV steroid, dexamethasone in TB meningitis with anti-tubercular therapy. If it is tubercular with a cog-web pattern, sir. Cog-web pattern. Now coming to the next one, that is ALS, amyotrophic lateral sclerosis, sir. Amyotrophic lateral sclerosis, you will remember normal IQ. Sir, there will be a normal IQ, normal sensory, motor, normal bladder call. Everything is normal right here. Okay, everything is normal right here. And sir, remember ALS के अंदर bunina body is found. Okay, which bodies are found, sir? Bunina. Bunina body is found. Bunina body is found. Yeah. Bunina body is found, sir. Now, asymmetric features, what are going to happen? 3 type of feature are going to happen in ALS. One feature, you remember, asymmetrical bilateral distal muscles are affected, can't walk and stand. बाकी सब ठीक था. Bilateral bulbar palsy can happen. Ipsilateral tongue deviated so that difficulty in swallowing can happen. Sir, spastic paralysis. Muscle wasting will happen. Babinski is positive. Deep tendon reflex बढ़ जाएगी. So these are the problem. Rest everything. Bowel, bladder control, IQ ठीक है, senses ठीक है, but the motor functions are affected. Motors are affected right here, sir. Motor are affected by this, sir. Pathophysiology in the spastic, if in the ALS is SOD1 gene mutation. SOD1 gene mutation, SOD1 gene करता क्या था? हमें फ्री रेडिकल इंजरी से बचाता था हमारे दिमाग को. किससे बचाता था? फ्री रेडिकल इंजरी से बचाता था. एंड ट्रीटमेंट में व्हाट वी कैन गो? रिलूजोल एंड एंडाविरोन. रिलूजोल एंड एंडाविरोन वी कैन गिव, सर. नाउ कमिंग ऑन टू द मैस्थेनिया ग्रेविस, लोअर मोटर न्यूरॉन, autoimmune condition. This is an autoimmune condition where there is a type 2 hypersensitivity reaction. And pathophysiology, if you have to remember, antibody against the acetylcholine receptor. Also, MuSK antibodies and LRP4 antibodies are famous right here. मसल कॉन्ट्रैक्शन कम हो जाती है, फ्लैसिड पैरालिसिस हो जाती है, मोस्ट कॉमन फीमेल में है. क्या है? टोसिस, स्नैरलिंग फेस, ऐसे टेढ़ा मुंह बना रहा है, रेस्पिरेटरी मसल पैरालिसिस इन द क्राइसिस. Normal sensory, normal DTR, normal nerve conduction, everything is normal. But here you will see your ptosis will happen, snaring phase will be there. Investigation, anti-ACH antibody test, ice pack test, tensilon test. These are the famous tests we know already, sir. Then drug of choice, ACTH STIs inhibitor, pyridostigmine, neostigmine. Also you can add the steroid. If there is a crisis, you have to remove the antibodies by the plasmapheresis plus immunoglobulin you can give. Okay. Then Guillain-Barré syndrome. Then sir, Guillain-Barré syndrome. Let's talk about the Guillain-Barré syndrome. Autoimmune disorder, type 2 hypersensitivity, post-infectious antibody. After the infection, the antibodies are generated. They are destroying the ganglionicyte and destroying the myelin. And remember, GIT में Campylobacter jejuni, other respiratory system में viral CME, Epstein-Barr virus, Mycoplasma, influenza. These are the different organisms which are responsible for the production of the antibodies, and they are affecting the myelination. So clinical feature क्या है? Flaccid ascending paralysis. Always Guillain-Barré is starting from foot side. Pain and paresthesia, loss of touch and vibration is seen. Most commonly nerve involved is a facial nerve. Now sir, what you will see, cytoalbumin dissociation you will check. You will check the protein are increased but cell count is normal. Only proteins are increased in case of a Guillain-Barré. नर्व कंडक्शन देखोगे तो वेलोसिटी कम हो रखी होगी. ट्रीटमेंट में प्लाज्मा फेरेसिस या आईवी इम्यूनोग्लोबिन शोज लॉट ऑफ गुड रिजल्ट. लॉट इफ माई सेल्फ हैज सीन गुड रिजल्ट. स्पाइनल कॉर्ड डिसऑर्डर का टेबल रट्टा मारना है आपको सर. ब्राउन सिक्वर्ड, टेबस डॉर्सेलिस एंड सेरिंगोमाइलिया. सर रिमेंबर राइट हेयर सर. टच एंड पेन. Brown sequards में सर टच इज एब्सेंट ऑन द सेम साइड एंड पेन इज एब्सेंट ऑन द अपोजिट साइड. ब्राउन सीक्वर्ड्स के अंदर ये दो चीजें हैं. टेबिस डॉर्सालिस सर टेबिस और टी फॉर टच इज एब्सेंट बोथ साइड एंड पेन इज प्रेजेंट बोथ साइड. टेबिस के अंदर टच दोनों में एब्सेंट है, पेन दोनों में प्रेजेंट है. सेरिंगोमाइलिया सर टच इज प्रेजेंट बोथ साइड बट the pain is absent in the both side. उल्टा हो गया. Tabes dorsalis and syringomelia are opposite to each other. ठीक है सर. Respiratory system, I think we have talked mostly about everything right now. ठीक है. We have to talk about these two system only now. चलो. Let's talk about the respiratory system में क्या क्या बात करनी है. Yes. Let's talk about this hypoxia part. Sir. Hypoxia we talk about, sir. Hypoxia. Partial pressure of O2, SpO2, this is low. Any pulmonary cause can be there. Anemic hypoxia. Partial pressure of O2 is normal, SpO2 is normal, but hemoglobin is no. That is anemic. Less hemoglobin is a cause. Sir, stagnant hypoxia. Normal PaO2, normal SpO2, but peripheral cyanosis present because of the heart disease. Histotoxic, there must be a cyanide or carbon monoxide poisoning that will lead to the less absorption of the oxygen in the tissue, lead towards a tissue fails to use the oxygen. Histotoxic hypoxia. So these are the different type of hypoxia. Then respiratory failure, type 1 and type 2, sir. Type 1, only hypoxia where decrease in PaO2 is seen. Then there will be a hypoxia where PaO2 along with the hypercapnia is seen. अगर सिर्फ पार्शियल प्रेशर ऑक्सीजन का कम हो रहा है, दिस इज टाइप 1. ऑक्सीजन के पार्शियल प्रेशर के साथ साथ में अगर हाइपरकैपनिया हो रहा है, दिस इज कॉल्ड एज टाइप 2. सर दिस इज टाइप 1 इज बिकॉज ऑफ हाइपरवेंटिलेशन and type 2 is because of hypoventilation. Hyperventilation will lead to respiratory alkalosis and hypoventilation will lead to respiratory acidosis. Sir, treatment in type 1 is 100% O2 and treatment is type 2 is low flow O2. The diseases which are coming in type 1 is emphysema, asthma, etc. and type 2 it is COPD, etc. Now obstructive lung disease, fixed and variable obstruction we have to talk about. Sir, fixed and variable. Fixed is both inspiration and expiration is poor. Variable if expiration is poor and wheezing sound is coming, example COPD. So this is called as VTO, variable intrathoracic obstruction. Expiration poor है, तो there will be a intrathoracic obstruction. और अगर इंस्पिरेशन पुअर है तो देयर विल बी अ एक्स्ट्रा थोरेसिक ऑब्स्ट्रक्शन। अगर अंदर नहीं आ पा रहा है तो बाहर दिक्कत है, और अंदर से बाहर नहीं जा पा रहा तो अंदर दिक्कत है। दैट इज वेरी वेरी obvious thing. That is very very obvious thing, my dear friends. Then coming to the flow chart, this is telling you about the inspiration, and this is telling you about the expectation. If poor expiration is there, agar expiration is poor, there will be a variable intrathoracic obstruction and the curve will come like this. This is expiration, ye poor hai, inspiration is proper. COPD asthma, we will see curve like this. Sir, here the poor inspiration is there, so you can see curve is looking like this. Expectation ठीक है, आपकी expiration ठीक है. Now variable fixed where both inspiration and expiration are poor, so you can see both the curves are hampered. तो very simple thing, just remember expiration ऊपर होती है, inspiration नीचे होती है sir. Restrictive versus obstructive lung disease, we have already talked in the physiology also sir. चलो लेट्स टॉक अबाउट ओएलडी में, ऑब्स्ट्रक्टिव लंग डिजीज में. ओके अस्थमा के बारे में बात कर लेते हैं. अस्थमा इज नथिंग बट अ टाइप 1 हाइपर सेंसिटिविटी. एटियोलॉजी क्या है? देयर विल बी एलर्जन बाइंड टू IgE बिकॉज दिस इज होमोसाइटोट्रॉफिक एंटीबॉडी विच हैज एन एफिनिटी फॉर द मास्ट सेल. मास्ट सेल की वजह से क्या होता है? ब्रोंको कॉन्स्ट्रिक्शन, वीजिंग साउंड विल बी देयर, वैसोडाइलेशन एंड ब्रोंको. ऑन स्पूटम एग्जामिनेशन प्रीवियस ईयर टॉपिक इज दिस सर. Sir, Cushman spiral, Charcot Liddell crystal and Cariola bodies. These are very important. Sir, Cariola bodies, 3 C's, Charcot Liddell crystal and Cushman spiral. These are the 3 findings you have to remember for the exam, sir. Coming to the prophylaxis. Treatment prophylaxis. Diagnosis में this is peak flow meter, right peak flow meter. We will check with the help of this FEV1 percentage, etc. Now, prevent the exposure. IgE inhibitor like omalizumab, mast cell stable, nidocromil, chromoglide, leukotriene antagonist, Monty, Zafrilucas, bronchodiazaba, LABA, steroid दे सकते हो. These all are the treatment which we use in case of a asthma, sir. Now, sir, if there is an intermediate asthma that is less than 2 days in a week होता है तो SABA plus inhalational corticosteroids. If there is a persistent asthma, so you will give a steroid plus LABA, long-acting beta blocker, beta agonist, and prophylaxis. And if severe is there, then oral steroid we have to take. We have to take what, sir? Oral steroid. Next is what, sir? COPD. Here, what is happening in the COPD? There is an inflammation and inflammatory response because of pollution. Damage to ciliated epithelium, squamous metaplasia can happen. There can be a increase in the mucus production. They all will lead to a problem in breathing. सर स्क्वैमस मेटाप्लेशिया हुआ तो स्क्वैमस सेल कार्सिनोमा. सर रिड्यूस म्यूकोसिलरी क्लियरेंस हुआ तो स्टैसिस हो जाएगी, और अगर बहुत ज़्यादा म्यूकस प्रोडक्शन हुआ तो नैरोइंग हो जाएगी, कोपियस कफ आने लग जाएगा. ठीक है, कोपियस कफ आने लग जाएगा. सर हियर रिमेंबर इन्फ्लेमेशन, देयर इज अ इरिवर्सिबल एयरवे ऑब्स्ट्रक्शन इन दिस केस COPD सर. तो COPD के अंदर इरिवर्सिबल चेंजेस होंगी. देयर इज अ रीड इंडेक्स विच इज मोर देन 0.5. रीड इंडेक्स इक्वल टू और मोर देन 0.5 क्रॉनिक ब्रोंकाइटिस के अंदर देखने मिलेगा सर. अगर 4 से कम है, दिस इज नॉर्मल. अगेन आस्क्ड इन द एग्जाम. सर हिस्ट्री ऑफ स्मोकिंग विल बी देयर, ब्लू ब्लॉटर्स विल बी देयर सर. ब्लू ब्लॉटर, दैट मीन्स देयर विल बी अ साइनोसिस. सर देयर विल बी अ core pulmonary because of the lung problem. If your heart is getting failed, this is called as core pulmonary. And also there will be a clubbing, my dear friends. And remember, spirometer will show less FEV1 percentage. What is FEV1 percentage? पहले सेकेंड में कितनी हवा बाहर जा रही है, that is called as FEV1 percentage. FEV1. Stop smoking. Drug of choice is vernicillin, antibiotic, mucolytic, steroid. These are the supportive measures which we can give to a patient. Emphysema already we have discussed in detail many times. Alpha-1 antitrypsin, smoking. ठीक है, and treatment is supportive plus lung transplant. Then bronchiectasis, signet ring appearance is there, irreversible damage is there, supportive measure is there. Now the last is CVS, where I haven't covered much about the things. but just give it a read. I'll conclude this session now, okay, because ECG and etc. I haven't covered, just MI and all topic. So let's conclude this topic. Already we are running short of time now. And for surgery, my dear friends, for surgery, please watch on Dr. G. Banu Prakash sir. Dr. Nadeem sir is going to take the class. 2 days surgery session is planned. I think tomorrow and day after tomorrow is there. You can cover surgery from there, and that's all from my end. So we took approximately 19 hours to complete these 18 subjects. This we tried to cover all the PYTs, and may God bless you all. May God bless you all. Notes we will share. Notes we will share in the group itself. So from group you can take the notes, and for video is also there. Previous video is also there. You can watch it, but you can watch Dr. Nadeem sir's session. IELD session is going to be there, plus you are going to get the PDFs. So these 3 days we have covered approximately 18 subjects with all the PYTs. In the medicine, some of them are left. For that you can watch again on our G. Banu Prakash sir channel. You will cover from there. So this is the best I can do for you, and our team can do for you. And if any kind of doubt, query is there, do reach me out. And meanwhile, you can follow our Telegram channel and etc. May God bless you all. These 3 days were very amazing days. I have enjoyed a lot with all of you. May God bless you all, and may God bless you with a passing certificate soon. And soon we all will be receiving your good messages that, sir, we have passed. Again, we'll meet at the other corner of the story. So thank you so much. Jai Hind, Jai Bharat, and keep saying, I will pass, I will pass, I will pass. May God bless you all. Thank you so much for the love.